Awesome.
No kidding.
I can't. She's young. She's got the energy. Yeah, my.
Your first, right? And then the class, right?
Computer too. We've been getting it.
I've seen it work.
Are you serious?
It's both ways when people switch and when they don't switch.
Thanks for being
So it's like, the pros and cons.
There was several. Yeah.
I think it's a great.
That's kind of the, like, yeah, a lot of it in,
Sounds.
Uh-huh.
Yeah.
Fall back on the.
Last one. I love.
I know. You're out of character and break flu today.
Those events on the
Corvallis, yeah.
How do they match the house?
I'm always like that.
I'm always like, you know,
It's a small town.
color for your name badge, your place card.
Like, I was just in awe. I was like, oh,
So you're not just like, oh,
yeah, here's the summit.
so then.
It was mid hug.
I think this is our first time meeting each other in real life.
Yeah, well, it's nice to meet you.
Nice to meet you too. And last year.
When you like maintain that, like 10 years ago, I still are gonna.
Yeah, I've done a lot more.
You had a whole other thing.
Yeah.
I don't get bothered about
I was, you know. Yeah, I do know it. So I forget that.
I remember it the same thing. You have to have. And I am
Yes. I don't think I've said it to her. Yes.
And okay, that's right. The first one.
And then, yeah, of course, I'm counting.
Your demo.
And they're not doing it. Especially you. Would you like that?
If you're not.
Yeah, you're probably gonna learn some ownership, how to be possible.
I know. Were you?
But the funding is.
No,
I do. It was
Oh, and.
Sorry, I didn't mean to break it.
I'll make it over to the reaction.
I do. We went to Oklahoma.
So, kind of make sure that you have to check in with all these. Okay.
That was a good punchline.
And so we can call it back after that.
One, that's so much. I got my.
Right.
In my.
We gotta work.
In my.
Yeah.
You're making choices for your life. Or then we had that.
Yeah, it was.
But this is. Don't worry about
But
it.
isn't it funny?
Part of what I'm.
Come back in 4 months when you're ready.
So this week, they show up.
A little break.
I do it right around me, started to become like and I remember like seeing it on like a Instagram that night. It was like, oh,
I don't know. System, so much better than.
Understand, right? Because so and then it is still like how days out.
System.
Yeah. That's right.
Which is a whole different.
We had an ROI sign. Apparently, we had I know, we kind of say that. Maybe they something like a state ballot to the college.
Every
So, you know, no money.
Felt like I know. So.
And so I think that those.
How are you?
Because of the money.
I was like, oh, I should probably.
Butterflies, definitely gotta come over and say hi.
Hi. Even though I'm realizing I've done it in person. before.
Yeah, we don't have a huge presence there. Our clinicians typically don't.
You're so right. My hands hurt this time though. And I'm like, I get.
So they get our information, so.
The answer I was like, no, sorry. I brought mine
So
to
you
you.
have that partnership.
Bring it in, although I love all the awesome conversations that are happening that are not as exciting as strategic planning, but very fun nonetheless. So we're gonna get started today in a very official way, which I'm super excited about. We have a representative from the governor's office, the one and only Rachel Kearns Henry, who's gonna kick us off. It's words of inspiration, right?
All right.
No pressure, you got this.
No pressure, no pressure. Well, first, thank you all for taking time out of your day in the summer to be here for this 2 full days. As Addie noted, my name is Rachel Kearns Henry, she, her. I work with the governor as on Health and Human Services as a senior advisor on her team. And I focus on human services, youth behavioral health, and as serving as your liaison with the System of Care Advisory Council work. First, I want to extend the governor's gratitude. I'm sorry that she could not be here with you today in person, and she does want to send her deepest appreciation for the work and commitment for the work that you're doing here today. I also want to recognize Amy Baker, who's the governor's Behavioral Health Initiative Director, who sends her regrets. She was hoping she could make it down from Astoria to join us all here as well today, but was not able to make that occur. So she sends her gratitude and support for the work that you are doing today as well. So when the governor came into office, it should be no surprise, we have 3 priorities: education, behavioral health, and housing. And we continue to make progress in those 3 areas. And we're going to talk about some of that. And as we come here together, what we really have collective struggles and shared responsibilities that we're all coming together to try to help improve and see how we can make Oregon better. If children and youth are struggling, it's safe to say that the adults around them are struggling too. The System of Care Advisory Council cannot fix all of the systemic or societal influences and challenges, but through wise and intentional planning that you are all doing here today, we can develop strategies that strengthen child and family well-being. And that includes focusing on strengthening cultural protective factors and actively dismantling inequities. So thank you. That is where we hope that you can continue to focus so we can advance the next steps for our future here. Just want to make sure we highlight where have we been as we think about what's next, as we set the stage for today. We've had some strong accomplishments in recent years and in the last legislative session. This was a really challenging budget environment. We had to focus on stabilization and preservation, and we had to really think about targeted investments because we could not do everything that we wanted to do. As a reminder, many of those targeted investments on where we should be identifying and prioritizing in this youth behavioral health system came from the SOCAC. And I am very happy to share, and I think you all know, but we made successes in a budget environment, even with challenges. Overall, youth behavioral health investments at Oregon Health Authority, we had a $23 million in new investments that are advancing. We had $25 million in new investments at DHS that are focused on child and family and youth. And we had continued investments of $22 million focused on youth experiencing homelessness investments. So overall, that whole package to help really focus on where we needed to drive reforms, about $60 million, which again, for the first time in a budget environment and how budgeting works, we had to put our budget together in November. And then in May, the legislature said, forecasting, you don't have as much money. Even with the change in a reduction in investment in a budgeted amount, the legislature said those investments that we put forward into youth behavioral health are critical, and we agree that they need to continue, and we're advancing them. That is success, and we should all be very proud of that as a foundation for where we're going next. Now, there also were in discussions and many discussions that we had in the legislature, and the legislature wasn't able to finalize all legislation. One example of legislation we weren't able to finalize did look at cell phone use in schools. And I think what you saw, the governor did make a strategic decision to sign an executive order to move forward and say that coming this fall, we should look at the use of cell phones for students in schools. And she's asked for during the days that we put those cell phones away. And she's asked those school districts to work on policies so that we can help to ensure that we are focusing and supporting education and learning. Now, our behavioral health initiative director likes to say that executive order is one of the most important things that we can do for youth mental health as we think about how do we help to grow and weave connectedness and have kids focus on interactions with one another in the schoolrooms and not just focusing on their screens. That's an example of some of the ongoing policy work that Governor Kotek is leading, and we're going to continue to focus on implementing that in the future here. I also want to thank you all for your critical work that you advocated in the policy landscape, in particular for youth behavioral health, with your priority bill, HB 3835. I want to acknowledge that bill didn't make it through the finish line, and that's okay. Challenging legislation doesn't happen in one session. It takes ongoing discussions, it takes strategic navigation and persistence, and it takes time to listen to and collaborate and compromise. And we hope that we can continue that effort. Want to remind you and just share, Governor Kotek showed up in the room to testify on that priority legislation because she wanted to show the commitment and support for the work that the SOCAC had been advancing. And she knows that we need to make priority policy changes there to ensure that we have the capacity and workforce we need in the system in the long run. So the work's ongoing, and let's continue that work. We have those challenges ahead. The work's not finished, and let's continue to move forward. We are going to be moving forward into a challenging dynamic. We have a changing federal environment that is not ideal. There's threats to diversity, equity, and inclusion that we all are facing. There's shifts in then what policies the federal government is putting out for how we operationalize our programs. There are significant fiscal investments that are fiscal cuts that are coming to us over the next 10 years with our social safety net programs, with Medicaid and food security. I'm not going to lie, this is going to be really challenging. And we are going to have to think about what is that long-term plan as we look at how do we look at doing our work better. But what I will, to start that work, the governor is focusing on enterprise level analysis. How do we really look to see what is the impact of the federal funding cuts over the next 10 years? How do we need to think about what's the timing of those cuts and how they're going to be coming at us starting in 25? And where and how do we focus our work? How we focus our work comes from what we need to think about. What can we control? What are Oregon's values? And what do we want to preserve and protect? And much of that work and those principles are going to come from listening to all of the strategic planning efforts we have underway, like the one today. What is it that is that's within our control? How do we want to show up for kids and families? What do we want to improve? How can we make sure that that collective work and your collective voice helps us? Because we know sometimes when you have a burning platform, when you have a threat, that means we come together. We come together and it helps to push us to innovate, to do work differently, to think about how we can deliver services differently and improve outcomes. And that's going to be our collective challenge that we're all going to have. And I know based on the work that you've done and then how you have started to map out the learnings and listening to voices about what we need to improve, that we can make collective change and we can make improvements. Know that that's where the governor has really focused and asked all of her agencies. Focus on operational efficiency, focus on enhancing customer service, improve how we do the work for Oregon so that we can make our system better. So I ask you, where can we do better? What can we control? And how do we influence the future that we want for Oregon? This strategic plan that you are going to develop is going to help us as we navigate uncertainty ahead. Help us drive and identify clarity, unity, and a shared vision for where we want to bring Oregon to. We're excited and we are happy that you are here today. So thank you for that presence, lending your expertise, your lived experience, your passion, and your commitment, your life's work being here today. Please let me know as the governor's liaison how I can continue to support you. Absolutely. If there's areas that you want us to continue to show up, where we need to be thinking about the work differently. I am here for one-on-one meetings, to come to any SOCAC meeting, because we are committed to the work that you are doing. Let's remember, the governor's calling for your wisdom and leadership as we plan for the future. Child well-being does not arise from a cellular level, nor does it exist in a vacuum. It emerges from a web of belonging, connectedness, and support. I hope that you leave today grounded, inspired, and ready to continue advancing for a better future for Oregon's children's, youth, and families. Thank you for your work.
Thank you, Rachel. All right, I think we're gonna pick it. Oh, right. Elliot insisted on us introducing ourselves. I'm really trying to avoid this. I'll let you go first since this was your brilliant idea, but we'll keep it short. If you want to get to the fun stuff, you can see all the colors and sticky notes await.
So we're gonna be leading the next 2 days with you. Some of you have probably met Addie before now. I'm coming in for the retreat to help Addie with this. So wanted to introduce ourselves so you understand sort of our background and where we're coming from. So I'm Elliot Hinkle. I use they, them pronouns. I'm the principal and founder of Unicorn Solutions. I do a lot of work in child welfare, youth mental health, and LGBTQ populations. I was living in Portland the past 10 years, and then last year I moved back to Wyoming, where I grew up, to help with rural population stuff there. As you can imagine, there's some challenges, especially with the LGBTQ community. So some of my background that I think is helpful to think about context here.
I don't have a note card with my background. I'm not this
I
prepared
gave
for
her a
this part.
warning.
All right, continue.
So some of the stuff that sort of helps me think about how y'all have been doing your work and sort of what did I learn in my experiences. So the Governor's Child Foster Care Advisory Commission that exists, I was one of the vice chairs of that group in prior years with other folks and learned the challenges of volunteer state government running, right? Like how do these groups actually do what we set out to do or were asked to do? And that can be really, really challenging. So I have a lot of sort of love for the fact that this can be really hard to like move a giant system forward. I worked at New Avenues for Youth. I've done some peer support work with young people. I grew up in foster care in Wyoming, so a lot of my work background is in lived experience and how do we make sure that people with lived experience are not only heard, but are real valued partners at the tables that we're at doing this work. Worked with Oregon Foster Youth Connection. I've also done some federal technical assistance work with states and jurisdictions around their child welfare systems and mental health systems. And with that, worked with ASPE and the prior administration to make sure that all the federal governments were thinking about equitable technical assistance and partnership with people with lived experience, which brought up some really interesting conversations for them at the federal level of what they were really missing with some of that. I worked on the Healthy Transitions Grant at PSU, so with Lane and Douglas County, trying to figure out, again, some of the challenges that I think that SOCAC thinks about of how do we pilot things in these different areas and actually make it work for everybody in those places. And then one other thing that I do is fostering pride. So I partner with ODHS, I partner with Gobi and Basic Rights Oregon to try and recruit affirming foster parents for LGBT youth, but really all youth in Oregon. So there's lots of work that I'm connected to. If you ever want to connect about that, let's chat more. But hopefully gives you just a little more background of sort of where I'm coming from. And I love doing facilitation. I love doing people work. I love trying to get us on the road to where we're going. So happy to chat with folks sort of in the break and offline as well. But known Addie for years. I was like a young one coming into a committee in Multnomah County doing LGBTQ work for juvenile justice and child welfare. And it was like, you're really cool and you're stuck with me. So
I think it was the opposite. I was like, you're really cool, be my friend. As you can see from our logos, Elliot is the fun, exciting, and interesting one, and I am bland and boring, which is actually kind of true. I do have a note card, but it's blank now. I thought I could hold one. My name's Addie Smith. I've worked with some of you in different capacities over the years, and some of you are new faces. I'm really excited to be here. Some of you have been stuck with me on numerous Zooms since January as we continue to move forward, and we're going to bring all that work into the room today. I have a JD and an MSW both, and have done a smattering of work around that. So my first sort of way back in the day was I worked residential inpatient for 6 years in Boston, Massachusetts, way back when, sort of deep in, and bumped up against barriers that I'm sure some of you still face today, which is gross and disgusting and frustrating. And that's when I sort of took the path of I want to do systems change work and I want to be sort of embedded in that. And so moved towards the JDMSW program, where I then really focused a lot on also child welfare and juvenile justice. And I worked at the National Indian Child Welfare Association for many years, where I did government affairs work and technical assistance with tribes and states. And after that, spent some time in our governor's office and our legislature doing systems change work around criminal justice, juvenile justice, and child welfare pieces. So worked on some bills you guys have probably heard of and facilitated a whole lot of work groups and task forces. I think that's sort of like the thing in Oregon that people call me for as a work group or a task force. So that's why I'm excited to be here and have continued in the last 5 years to do primarily this type of work with tribal governments and with state governments, looking at how do we get the right people in the room to have the right conversations to actually make the change that people have been stuck on for a while. So kind of unsticking is something that I really like to work on. And you're going to hear me say a lot today. We're going to focus on doability and we're going to focus on impact, because we want to be picking things that we can actually do. I was like being a huge dork and reviewing some John Lewis and some Saul Alinsky and some Willa Mankiller over the weekend. That's really dorky. And getting some wins and getting some things rolling is super important to make that big long-term change. So that's where I'm coming from and what I'm thinking about and what you'll hear me get excited about. So
Yeah.
So want to just hear from you a little bit, but there's so many of us in the room that we're not going to go around and do introductions in the traditional way. Some of you know each other. If you don't have a name tag, I would ask that you try to get one with your name and your pronouns on there. So as you're talking with folks, they've got that tool there to use. There's also table tents is really helpful for us to see and for you to see for each other. But instead of having everyone do introductions, we're going to do a raise hand. So you're going to raise your hand if the thing I say is something you identify with. And if you're comfortable with, you don't have to raise your hand if you don't want to. So if you are a person with lived experience, be it family, youth, folks impacted by systems, in the broadest sense, would you raise your hand so we can look around and see, right? We got lots of lived experience in this room. Great. All right, put your hands down. If you're somebody from a community-based org or basically a non-government agency, could you raise your hand? Great, got a few there. If you're a state staff person of any kind. Great. Okay, if you were raised in Oregon. Cool. If you've attended a legislative hearing before. Great, love it.
Love that.
Okay, if you identify as more rural frontier. Great, about half the room, cool. More urban. Great. Are you a morning person? About half the room.
Save the coffee for the rest of us.
If you're a night person, yeah, same. Okay, the last one, but really important. Are you an introvert? The introverts are like, are you an extrovert? All right, so we're gonna.
Extroverted introvert.
Yeah, somewhere in the middle, that's right.
Ambivert.
Ambivert. So there's a variety of you in this room. We have a lot we have in common, but also we have these differences and it's kind of a 50-50 split. So just keep some of that in mind as we move through the next 2 days together. We are not the same people, but we do have a lot in common. And I think one thing we all have in common is we care about kids and families. And so we're gonna keep moving through that. I think the flow goes into the agenda next, unless Anne can do someone.
And I'm gonna be super quick. We don't need to spend a ton of time. Great. I know some people like to know what's coming. And so just really quickly, here's what our agenda is gonna roughly look like today. We reserve the right to be flexible. There's gonna be some PowerPoints today. We're not wed to the PowerPoints. I'm not gonna be standing here doing this as I stand here and do this much at all. But some of us are visual learners, some of us are auditory learners. So we've tried to create some visual cues for folks in addition to all the conversations we're gonna have. You're gonna see lots of cool stuff, but we're doing intros. Next, we're gonna level set. Then we're gonna do some really cool mission and vision exercises, which I'm excited about. We're gonna take a break and then we're getting to the strategy. Like the hard work begins, but first we're gonna plan Elliot's birthday party. You think I'm kidding? We're actually gonna plan Elliot's birthday party as an exercise. And then we're gonna work our way through the goals. Here during the level set, for those who are new to the room, we'll talk about how we got here and where all the information you're already seeing in the room came from. So you're not feeling left out and you know where we're at. And then we'll wrap up and then we've got some debriefs for young people and for families that are optional but available spaces specific to that. Okay. It's all you, Anna.
Are we gonna do like a little orientation of the room and that kind of thing?
Yes.
Should I do that?
You are welcome to do that if you want.
We've got some in the slides still to count, but.
Okay. Just because you've all been sitting here for a minute, if you need to use the restroom, get up and use it at any time. It is out that door and to your left, there's a little sign. There is food out in that hallway and beverages. There's juice, coffee, and tea. There is some gluten-free food. If you can leave it covered so that it doesn't come in contact with the glutinous foods that surround it, that would be appreciated. Be thoughtful about using your utensils and things, right? Like just let's make sure we're not contaminating for people who may have allergies.
The bathrooms, there's men's, women's, and there's a single user restroom as well, all right in the same place.
We have masks out there if you would like them. We have name tags out there as well. There's coloring pages over here if you're the kind of person who pays better attention when you're a little bit busy. Feel free to take those. And Joylene, did you bring the fidgets?
There's a pile of them in the
There's
back.
a pile of fidgets over there by the Wi-Fi sign. Also, the Wi-Fi password is back there on the left if you need it. And then on your tables, you will see a bunch of different materials. Lots of them are just for your own, just taking notes, making stickies, however you feel like you want to be able to use those. There's some data sheets on there. We also have whiteboard markers, I think.
Yeah, they're on the back table.
On the back table, if you want to make notes on those little data sheets, they're sort of placematty, so you can like draw point out things that strike your fancy, right? We're just trying to make sure that folks have access to some of the information. The amount of information, which we'll go over, is pretty overwhelming that we've been pulling into this. So no one brain is expected to understand it and put it all together. But for the sake of transparency and because you may see things different than we do, dig in as much as you like and let us know what your thoughts are. These big sort of binders that are on some of the tables are the data report that OHSU released recently that goes through sort of system by system that we sort of co-generated in terms of what are the questions we know about the system. And then you should have agendas, and some of the feedback from our youth strategic planning work that they did together is also on your table. So just sort of an orientation to what's in front of you. And then if you need support, Elliot is here. They're very good at peer support. And Joylene is here. Most of you know her. She's in the back. Feel free to text either one of them, whichever suits your fancy, whoever you feel more connected to. You may also text either of them to say, I think we need to do a racial equity review, but I don't feel comfortable calling that out. Or to ask any sort of like, when are we going to get to this? How are we going to do this thing? Right. They're here to support you, help you feel confident so that you can participate in a way that feels comfortable for you. As you all of the folks who come to SOCAC meetings are very used to hearing us say this, but these are the shared group agreements that the System of Care Advisory Council has used for a couple of years in terms of how we treat one another and how we show up in our meeting spaces. So you are asked to be present when you're in here and participate. If you need to go take a break, walk around, that's great. Take yourself outside. If your phone rings, you need to go, just try not to distract everyone else and go take it outside. We try to listen actively. That means not talking when other people are talking to us. Sometimes you get excited and you start talking and that's fine. And just like, oh, sorry, hold on. I didn't mean to talk over you. You can raise your hand. However you, oh, hi, Kati. However you, demonstrate respect, avoid interrupting. We also, and we haven't done a great job of this so far, but we'll try and do better, using acronyms. So if you use an acronym, try to define it when you say what that is. So, JD is a Juris Doctorate. That is a law degree. Not everyone in the room knows all the acronyms that we use. And so we do our best. If someone uses an acronym you don't know, please feel free to ask, what does that mean? Different acronyms mean different things in different parts of our work, our shared work. For instance, a SPA might mean a state plan amendment or a special purpose allocation. You can have an hour-long conversation about that, thinking you're talking about the same thing, and have wasted everyone's time. I have done that. Huh? Or you could just go get a pedicure. Yeah, and you're better off for it. So do try to define your acronyms and make sure you understand the acronyms that other people are using. Feel free to ask questions. We're not in Zoom right now, so you can't use the chat box to write definitions, but use your verbal chat box or text Joylene or Elliot. Varied and opposing ideas, of course, are welcome. When we disagree, I would encourage you to ask curious questions and challenge that idea. Where is that coming from? What do you know that I don't know? Rather than attacking the person who you disagree with. That does not make for a very collaborative conversation. We use the names and pronouns people introduce themselves with, people have on their signs. That is one very easy way to demonstrate respect of other people's humanities. We honor those with quieter voices. We've talked about this quite a bit. If you're a person like me who's like, oh, I'm so excited, I have a lot to say. Try to just for a second and someone else will step into that quiet space that you have just allowed to exist. If you're the kind of person who doesn't speak up as much, challenge yourself, say what you came here to say, bring your expertise to the table. We invited you here for a reason. If you're not comfortable doing that verbally, you are absolutely invited to write it down with some of the materials on the table. You can text it to Joylene or Elliot. They will say it out loud for you. There are lots of different supports that we can put in place for you. So if you have a preferred communication strategy that you like, let us know what that is. And we have plenty of staff in the room here to support you. We avoid solving for individual situations or crises, especially today. We are at the 100,000-foot view today. If you are struggling with something in your personal life and you need a referral or support, we have lots of folks who can help you get there. That is an out of the room conversation. Feel free to let one of us know. We can try and connect you to somebody who may be able to help. Our purpose today and always is improving the system of care in Oregon. Just maintain sort of a focus on that. We're not trying to solve housing. We are not trying to solve food access. We are trying to solve the systems that provide services and supports to children and their families. We do our best to be mindful of power dynamics in the room. That can be challenging. Different people see power dynamics differently. But one of the big ones is that folks who represent state agencies, governor's office, people who have a .gov in their email address in general, are often seen as having a lot more official power than everyone else who's in the room. And so for those of us who do have that .gov, be really thoughtful about what we say and how we say it. For instance, if you think something can't be done, rather than saying that's a terrible idea, dig in and think about how might we be able to accomplish something like that? Is it calling it something different? Is it using a different strategy than what the person is providing, rather than just sort of using that maybe perceived power to sort of tamp down an idea that might actually be a really workable one if we dug in a little deeper. And as best we can, rather than admiring the problem, we all know there are so many problems to solve. Let's focus on that solving part and proposing solutions wherever possible. The GARE analysis is baked into the process as best we can. So far, we have been doing that analysis as we've been walking through. You will also see each table has the GARE questions on them to remind ourselves to kind of be doing that 3-part analysis. Who will be impacted? Will they be positively or negatively impacted? What unintended outcomes may occur for different racial populations in our state, and what can be done about it? Again, at any time, if somebody's like, we need a racial analysis on this, please let us know. They take a lot of time, so Cody will do his very best within the resources that we have. And we may need to pause on that and get back to you with that analysis after these 2 days are over. System of care, it means a number of things. It means the coordinated network of services and supports that we're all here to sort of solve. It also means sort of the model and the philosophy of integrated services, person-centered care in the community wherever possible. And then it also means just that infrastructure of the SOCAC and the regional systems of care, right? So when we're talking system of care, if you're talking about one of those specific things, be specific. Are you talking about the philosophy? Are you talking about the infrastructure? Are you talking about services and supports? That way, again, we don't have an hour-long conversation where we're actually talking about 2 different things. Youth is an individual who is 25 years or younger, so up until their 26th birthday. That is our population of concern, who have chronic behavioral, emotional, physical, or developmental conditions, and is under the supervision of or engaged with 2 or more systems of care. We have historically used this is at increased risk of developing, and I'm just now noticing it's crossed out. I'm guessing that is a recommendation from our strategic planning consultants to
That
make
came
our
to us that
work
way.
doable. Oh, I've never seen something like that before. All right, well, that's still in the law, or is that increased risk of developing? So we're not crossing it out. It's ORS 418.976.
Yippee.
We already talked about this. It's just a visual. If you can flip back for just a sec. For those of us who are visual learners, this is what I meant. Philosophy, infrastructure, services and support, system of care covers all of that. Let's try to name which version of it we're talking about when we're talking. Next slide. And I already covered this. By the systems that the SOCAC is responsible for, we're primarily focusing on intersections. There are system-specific advisory bodies. So Chelsea Holcomb is here from the Child and Family Behavioral Health team. They have an advisory body of people with lived experience who are single system focused. They don't need us to do that work. They're already doing it. Child Welfare has the Governor's Foster Care Advisory Commission. They don't need us to tell them specifically how to do foster care. They're already doing that, right? We are focusing at those intersections of disability and foster care, and we're respecting the expertise of those folks who are at those other tables to do their jobs. We don't need to step on their toes. Remember the pop quiz? Many of you were there when we had the, is this in scope or out of scope? And we didn't even all agree. So that is one of the big.
Never happens. What are you talking about?
With this group especially. So we're gonna have some of those hard conversations. What's in scope? What do we decide to focus on? 4 years seems like a really long time, but to make meaningful change in those cross-system intersections that we're really trying to focus on is challenging. So being thoughtful about what can we do? What do we have the authority to do? What do we have the buy-in from our system partners to be able to do? The leadership from the governor's office to get that to happen, partnership from the legislature, right? Like it's pretty complicated to do big systems change work. So being mindful of what's doable in 4 years, both internally within our own infrastructure and externally with the systems that we're trying to impact. And then this is one for those of you who get the gold star for coming to the pre-retreat meetings, thank you so much. We've already gone over this, but so many people didn't come, so we have to do it again. So every participant here is an expert. You were invited to this table because you have information that is valuable and necessary. Some of you are bringing expertise in lived experience. Some of you are bringing expertise in system management, system oversight, financial controls, data evaluation, right? Every single piece of expertise at each of one of these tables is necessary for this work. And just as I cannot argue with a young person who tells me what their experience was like in foster care, or a parent who really struggled to get their child access to the services that they need or continues to struggle with that, there are people in this room who know that Medicaid won't pay for that thing, and that's true, right? They're not messing with you when they tell you that's not coverable. So let's do our best to acknowledge we all came to this table because we care, because we want to solve the problem, and we all bring different levels of expertise. Again, if someone says that's not possible, let's ask curious questions and figure out why. There's probably a way around it, but it takes time to get to figure out what that path looks like. Perfect versus good. I know you all are going to put this on my gravestone when I die. We are not striving for perfect, y'all. It doesn't exist. What we are striving for is good. Oregon currently has one of the worst behavioral health care systems for youth in the country. We can do better. We spend roughly the same amount as most other states do per person. Something's wrong. So instead of aiming for perfect with all of the work that we're doing, we're really looking for what's the good next step we can take. Similar to the above, we're not wordsmithing today. If there's a word that offends you, that's fine. Let us know that word is challenging for you, but we're not trying to get every single thing that Addie and Elliot are putting down on paper to be the perfect version of that thing. We're getting the ideas. We can wordsmith later. This plan isn't due until January 1st, 2026. I've already talked about lean back and lean in. And then again, scope reminder, we are just focusing on those 2 or more systems and those collaborations between systems to make services effective. We are not trying to solve every problem. We can't fix housing. That's not in our scope. We can't fix food access, transportation. Those things are important, but that ain't us. The primary duty of the council is to create a strategic plan, and we're doing it today. So thanks for being here and helping us do what we were created to do. And then this is, you've all seen it before, very specific details of what needs to be in the plan. You don't need to memorize these. We have consultants to make sure that the plan addresses those things. If we don't get to all of those things in this work that we're doing over the next 2 days, again, we have until January to make sure all of these boxes are checked.
And we'll talk a little bit about how we're going to check the boxes in a second for those of you who need to know to feel comfortable.
And if it sucks, Addie's fault.
That's right. 100%. 100%.
And then I think I am done, but I will be in the back if you have questions for me to be
It's our turn. So some of this is going to be repetitive and some of it is like bathrooms. I put it on their annex. I wanted to make sure we covered it.
so long.
I know. So we've talked about them. I want to talk about 2 other tools we'll be using that go with the text messaging. I know everyone is super tech savvy but me. Elliot made me use ChatGPT and it was a nightmare over the weekend.
She lived.
I don't know how to use it either, if that makes you feel better.
So we're gonna be using a lot of the room. So just get used to sort of swiveling. The chairs have wheels and we're gonna get people moving. Along those lines, if mobility is not your jam or not something, you can raise your hand and we will bring things to you and arrange around that. There's no problem for us to do that. Or, perfect segue, we have a secret messages and anonymous feedback board, right? Secret. So to the extent that you don't want to text because that might be identifiable, I don't know anyone's handwriting. I barely know everyone's names right now.
Real.
So by all means, feel free as we take breaks, et cetera, to just sort of slip something on here and move by. I'm not going to be like watching or paying attention. There's going to be commotion. It's just another way to get to us if you're feeling like, ooh, I want to flag something for people to be aware of.
And you can bring it to us too if you want to. Just make sure I know that it's a secret anonymous feedback and not like, this is great, but I don't know what to do with.
Should I read it out loud and say, thank you so much, Zafir, for handing this to me,
Yes.
for example?
Feel free to note it.
Just made that up.
He's like.
Similarly, we're gonna be using a parking lot in Oregon. I often hear this referred to as a bike rack. Sometimes when I work with tribal communities, it's a hatchery. It's just a spot where we're like, whoa, that is such a super good idea, but not today's conversation. So we're gonna keep it, and the plan and what we hand off as consultants will include things that land in the parking lot, but it's a way for us to capture cool stuff without going down that rabbit hole. Again, something this group never does, I'm aware. But it's a tool, and try your best to not take it personally or be offended. We have a boatload to get done. And I'm a little bit of I'm a north, which is an activity we might do, which means I'm a make decisions and get moving kind of person. And so that's what we're gonna be really focusing on in the next 2 days. This is like my favorite word of the week, an iterative process, meaning lots of times to come back and come back. So we're trying to get to a first draft. And that's what you're gonna keep hearing me say. It sort of reflects the perfect, the enemy of the good. It reflects what I was saying about doability. We're moving towards something. We gotta get somewhere before we start to then go back and really admire what we've done, a word that this group likes that I'm really taken to. Please take space. You're all, we're all responsible, thoughtful young people and adults. If you need a minute because you're bored, if you need a minute because you're feeling overwhelmed, take a minute. It's all gonna be the same to those of us in the room. We're all just gonna assume that you're headed out to check in with your mom on the phone because you missed her on her call last night. No one's gonna take assumptions. If you need someone to go with you to take space, you can send a text or you can tap someone on the shoulder, totally fine. If you just need to use the restroom, please don't wait for a break. If you need to stand at the back of the room, if you need to do squats every 45 minutes, Sandra Santos, by all means, feel
Let's do it
free
with you though.
to do
I
that.
should do group squats.
We can, we can talk about it. We're going to, as needed, do some pauses to do this last thing. I know it works really well when you schedule in fun laughter and enjoyment, but we may actually schedule in some fun laughter and enjoyment because it's not often that we're in real life together. Okay, so I want to do a little extra orientation. You're gonna see these bad boys all around. There's 3 sets of them. These are our, that's always a really hard combo for you to say. OURARE are our values for the strategic plan that we have developed. Everything we're doing over the next 2 days gets screened through these values,
And that's the
right?
same thing that's over there.
That's right. Everything's the same except for this one right here, which is a GARE reminder. So to the extent that I'm asking everyone to take some responsibility, and tomorrow we're gonna do some formal GARE questions. That's what I mean about sort of being baked in. They're here for folks to be keeping top of mind. As we said, I'm super old school, so you'll see me write something down and then look up and be like, does this fit the value screens? 1, 2, 3, 4. Yes. And they're on the table. Thank you for that reminder. Also on the table. So lots of things for, again, different learning styles, different engagement styles to keep you clued in on what we're up to. Gentle reminder, as cool as it would be for me to make these up and just give them to you and say, these are the values I've decided you should have. That's not cool, actually. We created these together. So at the last time that this group met in person, we ran through a values exercise together for those who were there. I took sort of like we're gonna do today. You guys gave me a whole lot of really valuable information. I simmered it down into this reduction, which is our 5 values, brought it back to the group, and this group validated them. So centers children, youth, and family, increases awareness and reduces stigma, promotes sustainable change, prioritizes community care, and advances equity by improving access, affordability, and quality. Gentle reminder, not everything we do has to touch all 5, but everything we do needs to touch something in here, right? Otherwise, we're creeping, meaning we're falling off our own values. These are our bumpers for people who like bowling or bumper cars, racer cars, right? So those are gonna keep us moving forward and funnel us together. I already said this, but we're here to get some stuff done, right? We've got to have a plan. It's legislatively required, so we really got to have a plan. but I also think this group could use some wins. It's time to start to pick some things and get some good movement rolling. So you're gonna hear me asking some tough questions, right? A really good example is, as I was going through the literally thousands of pages of really awesome rad material you all provided, a lot of what came up was something along the lines of, create a diverse workforce, which I think, right? Yes, we all want that. I love that. We are in a 3-year strategic plan. So what I want, 4-year, strategic plan. What I want to know is, what is the step we are going to take to drive towards that? So what's the thing we're going to do? I'm going to make this up. This may be a terrible idea, but we're going to start working with the admissions departments at some of the universities, or we're going to start moving for more peer support work. So we're going to turn to community organizations that already have talented individuals working for them and talk to them about how we can offer grant programs to get people the peer support training they need, right? That's going to push us towards a diverse workforce, but that's like a thing we can do. And it's like a thing we can do, maybe not tomorrow, but 3 months from now. That's the theme of the next 2 days, is me saying absolutely yes. How? What is the how? And that's what I mean when I'm like, we're here to get some stuff done. We're not gonna solve racism by 2030. That's a little bit of a joke to last night's dinner. But we can take steps that make things better tomorrow or in the next 4 years for Black and brown youth who are in our systems. And that's what we need to do, because it's not good right now, and better would be nice. Because I know a lot of people in this room have talked to me one-on-one or in small groups about how tired they are of not even getting to better, let alone to ending racism, right? So those are the types of things we're gonna do. Part of what we're gonna try, and I appreciate everyone being super brave today, because change is hard. I hate change, I hate transitions. As some people in the room know, I moved last week, so I'm like in a little bit of a transition ick. But we're gonna try some temperature checks, which means we're gonna do some things this group isn't used to, where I'm gonna say, hands up if this works for you. And if the majority of people feel like it works for them, for now, we're gonna go with it. Because we are gonna have a plan. That plan is going to have a consensus process to approve the full plan. But to keep us moving, we're gonna try some new tools. There's gonna be some sticky dots. There's gonna be thumbs up, thumbs down, thumbs in the middle, maybe. There's gonna be a, can you absolutely not live with this type questions coming your way. Let's see how it goes. We've got check-ins at the end of the day and the end of tomorrow. There will be evaluations, whereas Jesus said, you can be like, I hate Addie. She is the worst. Wouldn't be the first time I'd gotten that feedback.
She's great when she's here, but when she leaves, then she sucks. We can build cohesion.
I love this.
Can I get you a name tag that just
That's
says
totally
Addie
right.
Hater?
And if you bring a challenge, and I know Anna hit on this, but this is like one of my big rules. If you bring a challenge, I'm likely to say, what do we think the solution is to that? And it doesn't matter if it's like not the best solution ever, it gets us talking about those solutions, those ideas, right? There are a boatload of barriers in the system. I know this group has a lot of expertise in those barriers. I read your notes from the last couple of years. That's really valuable. And again, can we make it better? Like, we're not gonna get 3 miles, but we are gonna get 3 inches. And I think we can actually do that. And that's what I'm gonna keep pointing us towards. And then the last thing I'll say before I hand it off to Elliot, who will actually say things that are meaningful and thoughtful. If you leave today and tomorrow feeling like, okay, I got a little more than I thought I was gonna get out of this. And you feel a little bit like, oh, I had to concede on a few things I feel a little frustrated about. That's it. That's what compromise and collaboration is. Like, that's the sauce that gets us moving. You're getting some wins and you're feeling like you have to relinquish some things to keep us moving. That means we're doing it right. And you can still hate me for it. That's okay. But that means we're moving.
Yeah. And relinquishing things doesn't mean you're relinquishing it forever. It might be
Correct.
for now. We want to talk about language. So like we all have terms and things that we either prefer, that we use in our communities. We don't want to get stuck today in the debate of the language. We want to hear what's right for sure. But even Addie and I were talking yesterday about Indigenous, Native, tribal communities and how that's talked about differently in so many ways, and what is right versus what is the context that I'm in, and getting stuck on those things. Lots of examples of that, but basically, I don't want you to lose your day if we get stuck there. We definitely want to respect though, if someone says something inappropriate, let's talk about that. But I don't want us to get stuck in the sort of, what is it, enemy, perfect is the enemy of the good? Yes. Yeah.
On his gravestone.
On his gravestone. Yeah.
Hey, are you saying like it'd be a bad idea to make empty streets crowded?
Yes. That's gonna be on Caleb's grave.
We're gonna go from Wyoming to New York.
Yeah.
Ah.
Yeah, now I need to come up with one.
Hoping you will stay curious. I think curiosity is a really powerful tool for like, I hadn't thought about it that way, or I wonder what that looks like, or maybe that is possible. But the curiosity factor is really important because we don't actually still know what the right answer is. And so we need to stay curious about maybe this other way that I hadn't considered might be the path forward. Let's try to stay in curiosity. Microwave and crockpot thinkers. Some of you are microwave thinkers. You're like, I know my answer right now. I can spin off 17 answers. Some of you are crockpot thinkers, and in 2 days, you're going to be like, oh, I have the thought now, and it feels too late. It is not necessarily too late. What is too late is us finalizing the plan, and you're like, oh, wait, I have this big thing that I want to change entirely. So you may have other ideas, but please stay like in touch as we finalize this plan so we can bake in things, but really do your best to try to bring stuff forward today. Even if it's a like, I just don't know if I feel certain of this, let's hear that today, not in a month. And then we're like, oh, that's really tough to bake in now. Lastly, for me is some lessons learned. I mentioned, I was on the Governor's Child Foster Care Advisory Commission. That was a really hard group. It was both the start of that group, so it was a challenge, and in addition to sort of the voluntary government committees that Oregon runs under, it's a challenge in bringing different system partners together and figuring out, do we have agreement on what the challenges are? If you have a group of folks and there's like the devil's advocate at every meeting, and so you're like, oh, we're always so close, but we can't get there. That stuff can feel really hard. And so what I hope is that we can get to a place where the frustration of feeling that there's not forward movement sort of breaks open either a conversation to figure out why is that the case and how do we move forward and what does that look like. But if we get stuck there too much longer, it only gets harder to do this work and for you to do it cohesively as a community of people who care. It also really sucks when you like leave a committee and you feel like, did we do anything? Right? That is a really tough feeling. And so I want you to find ways to plug in and figure out how are we going to make an impact, because children, youth, and families need help like yesterday, right? And so if we can do that, let's do that. I think that's the things for now.
Yeah, okay. We're gonna be really quick because I promise we're not gonna talk at you much longer. We're gonna start the fun stuff. Not that this isn't riveting. This is a really unfair timeline in my mind because it should really be like, we've done this much. We have this much to go, but here's how PowerPoint made it look pretty. So we're here. We have developed the framework, drafted the values and goals. We've done the community-based organization engagement. We have had each of your subcommittees provide us input, right? You all got the strategy catalog. You're gonna see the strategy catalog plus the community-based input, plus the youth and family input, all reorganized and sticky notes soon that look like on the back. It's gonna be super exciting. We got a lot of information we're funneling into today. And this isn't something I do a lot, but we funneled it in. We're gonna open it back up today, and then we're gonna funnel it back down, right? Because we didn't necessarily get everything, and we didn't see everything thematically laid out. And that's what these 2 days is gonna be. How do we process everything we've gathered, fill in the gaps and missing pieces, and then move towards a draft? I want to remind people, I've said it a couple times. I will then, with Elliot's assistance, actually write you a strategic plan. It will be your plan that you own. I'll just be the one that puts it all on paper. And then we've got a couple meetings with the council where we will come back and you will say, oh my gosh, Addie, 86% of this is super brilliant. 14% were you even in the room? What the heck is this? Please change it. And that's exactly the process. Or I'm a crockpot thinker and I thought A was a good idea, but now that I've had my 3 weeks to simmer, I really want to do A+1. Totally made up. So there's gonna be that chance for feedback. And I want everyone to feel as good as they can with it. So if we need to, I'm gonna tell you a facilitator secret, we can have a second meeting. I would love not to, that's not the goal. And if we need it for the group to feel good, I'm not gonna force something that folks aren't ready for. We do have to move on pace because we're gonna do some validating and vetting. All this should look really familiar, right? We started at the very beginning with me being like, here is the process. It'll go out for public comment, and then we'll have some time to think about, all right, we've got a rad plan. How do we want to see that it's working? What are our outcome measures? And that's going to be its own fascinating conversation. We're thinking we might kick that to the data committee for a first pass, and then also bring that back, of course, to the full group. But using, like we were talking about earlier, expertise in the areas where it can be most helpful. That's where we're having to. Then we'll finalize, then we'll deliver to the legislature, which will be really fun. And all of you who have been like, I've been to a legislative hearing, will get to go back again if you want. And those who didn't get to raise your hand, it will be your big opportunity.
I don't remember if I had.
I don't want to. I don't want to be a politician.
All right, just really quickly, I think we all know this, but just to like focus us in, because who knows what your weekend or last week was like for you? Maybe you moved houses all in one day. I don't know. That seems really fun, like a great plan all by yourself. Okay, so it's a document that outlines an organization's long-term goals and strategies. That's great because we're going to talk about goals and strategies today, so we're on the right track. But this is where it gets really important, right? It's the roadmap. So for the next 4 years, when this group is doing things and making decisions, one of the things that you're going to start having table tents on your tables say is this in the strategic plan? Does this fit under our goals and strategies? Because that's, again, how you move towards getting stuff done. So it becomes the roadmap. And then it's where do we want to go? You guys are awesome at where do we want to go? And it's how will we get there? And that's what these 2 days, you know, you're already a broken record and we're only an hour in. That's what we're going to keep talking about. How do we get there? What's that 3-inch step, not that 3-mile step? Next slide. Thanks for doing the slides. I feel like fancy. I really want to use that like old like nurse ratchet voice. Next. So this is how your plan should flow. Your vision and your mission to your goals, your strategies, and your action steps. We all know this. Again, we're putting everybody right in that frame of mind, and we're about to move into a mission and vision exercise so that all of us walk into the next 2 days, both feeling the warm fuzzies and grounded in what we want to do for children and families. Woo! We've already done goals, check done. We've already done value screens, check done. I love that. This morning, we're doing a mission and vision revisit. This afternoon, we're doing strategies and action steps. We are moving through it. We talked about outcome measures are coming once we've boiled it down to a more digestible plan.
No.
That's what these days are going to look like. I'm sorry the words are so small. I was so excited about these graphics. I just couldn't bring myself to change it because I really liked how they matched each of the words. So I appreciate your patience with my goofiness. All right, let's do something fun.
All right, you just have to press the arrow and it should go.
I'm happy to.
So we're going to talk about mission and vision. You've probably seen a lot of these all over the place, but when you're actually in the group of people making one, you start to learn like, oh, we might not actually have a mission. We have a statement or we have a thought, right? So vision statements. What is a vision statement? This is a statement. The statement is a dream, the big idea out there for years into the future for state and local systems of care and services and support. So we're thinking about the vision as where do we want to be in 10 years? What is our vision for the future? And where do we want to be in a perfect world? That's what the vision should actually equal. So billboard image of what you are working towards, it gets your ideas across powerfully, accurately, and quickly. Versus a mission statement, and sometimes they end up getting a little crisscross when people make them, is defines the present state and the purpose of state and local systems of care and services and supports. So what are we doing? What is our mission that we are setting out to do? How are we going to do it? And who are we doing it for? So why the system of care exists or should exist. And we can always bring back this slide if you're like, remind me the definition again, because I want to get it.
I got it. I have a multitask.
So example visions and example missions. So we pulled these from a few places. So as I read through these, I would think about, is there language you want to pull into our mission and vision? Or does it sound similar to where we're trying to get to? So North Carolina's system of care says that their vision is children, youth, and families are healthy, safe, and successful at home, in school, and in their communities.
Yeah.
We're already liking that one, right? So that's North Carolina. Sweet. Ellistock and Clackamas, Multnomah, Washington County. Children, youth, and families are empowered and well-equipped to achieve their fullest potential and realize their dreams through living independent, healthy, and productive lives. They are supported by a seamless, sustainable, comprehensive collaboration across systems and communities, which leads to generations of healthy adults. It's a long one, right? But it is definitely thorough. And then Cradle in Bedford Stories, I'm gonna say the last.
Stuyvesant.
Thank you so much. In New York, Brooklyn, their system of care initiative, we envision a future where all children and families we come in contact with can access coordinated services that contribute to their social, educational, cultural, and economic development within their neighborhood. We are working with communities to create a city in which people and systems with different strengths and perspectives work together for the safety of children and families. So again, their visions are what is the vision for the future we're trying to create into a reality. In Massachusetts, for their mission, they said to strengthen, expand, and integrate Massachusetts services into a comprehensive system of community-based, culturally competent behavioral health and complementary services for all children with serious emotional disturbance and other emotional and behavioral health needs, along with their families. Again, with Clackamas, Multnomah, Washington County, the mission of System of Care is to ensure that youth and family services in our region are community-based, youth and family-driven, and culturally and linguistically responsive. And then lastly, Ponca Circles of Care. The Circles of Care program provides the Ponca tribe and community with tools and resources to plan and design a youth-voiced, family-driven, community-based, and culturally and linguistically competent mental health system integrated with other child and family serving systems. So there's some similar words they even use or phrases that I'm sure we've heard, but I want you to sort of take in that this might be some of the language you use because we're about to move into an activity where as groups, you're going to be drafting an idea of what we could have for mission and vision. So this is what yours are right now.
Can we just pause and notice the colors on the screen match the colors of your name cards? I'm really excited about that kind of thing.
Was that on purpose?
I did that on purpose.
Addie.
I even let Addie keep her 90s PowerPoint instead of making it 2025.
Details, right?
I'm gonna start with vision because the other slides went vision
Thanks,
mission,
Elliot.
but vision for System of Care right now, your vision is a future where young people from all backgrounds are healthy, safe, learning and thriving at home and in their communities. Your mission right now is accessible and equitable systems transformed by the lived experience of youth and their families, right? This is where we're starting from. These aren't necessarily wrong, but they're not necessarily hitting the mark either as clearly as they could be. That's where we want to get to. And again, as we get into this activity, if it's helpful to go back to the example versions, we'll pull that back up. This just getting you to sort of, this is your high level view of the system. As you're thinking about the mission and vision of this system, this is the tool that you have to sort of zoom out and think about it. You're good. So now it's going to be your turn. Yeah. So you all sat by your friends, but not for long. So we have you in tables of basically 8. So you back there, you might have to find a chair for a bit just for this activity. But tables of about 8. You're gonna start drafting in your table a mission and vision. There are no wrong answers or bad ideas. You can put it out there because we're gonna end up chopping all of it up to find our final answer. You could use each other. You could use the internet. You could use ChatGPT or you
I don't know
insert
how,
your
though.
AI tool.
Don't use ChatGPT
You
for a
can-
human-based draft thing. Just don't.
You can use the source documents that we've had for all of this work, vision screens
So
that
many
we've got
issues I have
here.
with using that.
There are
phrase.
kind of no rules, just that you are working on a mission and vision would help. Remember the scope, combo, the statute, our goals, right? We don't want it to be so big that it is like far beyond even what we could do. And so we'd like for you to get up and find a new seat for this activity so that you can meet with different folks and chat. You're gonna have, I think, about 30 minutes to like draft this and we'll be floating around. So please, let's see if there's any questions really quick. Was there any questions?
Are we focused on the ideas or are we focused on the wordsmithing of how it sounds?
This is the one chance you get in the next 2 days to wordsmith. This is it. Put all your wordsmithing energy into the mission and vision. And remember, shorter is better here. less is more with mission and vision. Holly.
Can we move back to the?
And I was okay. And that new. Really charming. I don't think Holly.
Just try to find people you maybe don't.
Meet some of these.
It's like some places getting together.
I know, I have noticed. I'm like,
Less PowerPoint.
Just like maybe another one of them.
Did you want to say?
Okay.
No, this is.
Just, yeah.
Yeah. My name is Cindy. I work at Yellow Hawk Tribal Health Center and I'm just, my official title, tribal. Liaison or, you know, yeah.
Like the one thing.
I know the stickies were like anything to bring color. We're just cracking into it.
Not together. Yeah.
Vision.
It's
Beer, I'm one of the two.
Committee.
We've got lots of
I was
conversations.
gonna out myself too, and I just stole it from her, because you were like, think of a creative way, and I was like, oh, I was gonna say.
I need to get
Yeah, we are, right?
Oh,
I haven't seen it printed.
So anyway,
I use
feel free to raise your hand if you want us to move, but we'll sort of cycle through so you can see the new one, the examples, the definition.
I'm gonna have to stay with my brain a little bit and not really just microwave, but sometimes pop.
I was asking.
And I would just say one thing I noticed,
I think what's
looking at
my box.
your mission statements and then looking at ours, that equity was front and center.
Other.
And I didn't necessarily see that
About like.
equitable is the word used here. I didn't see that necessarily as prominent as some of the other examples. And that just struck me as in my support. So we do a good thing about the way.
People like build their.
Yeah, so I mean, you said it really well. It's just like about.
I mean, the mission is a little bit. Ecosystems, that's what we are coming together. But. Yeah.
Be nice
I
to see
think
those other
it's
ones.
missing,
It's great, so it's a future where.
Yeah. I just asked to have that put back up so I don't.
Oh.
Starting off strong. I can do chat
Like our mission.
That's how you say chat GT, chat GPT, that. It's a really valuable resource just to get your basic, like what you're thinking and then clearly from a heuristic.
I would ask just from a youth peer perspective, if we could not use ChatGPT, because we're doing a plan for people, and it feels a little disrespectful to use this AI. So that's how I feel.
You were wearing that out.
seeing that vision is true, but it's the things that are true, or like that they've true. I would like to see us, the council.
Child has one.
I don't know how this.
Much more likely to do well.
It's called.
Child connectedness.
Exactly.
Some of the experiences, you realize
at a higher rate. And so that is
prioritize.
at the same time, how the vision directs responsibility for those outcomes. How do we balance, like,
That was my favorite.
Yeah.
And I agree with that.
maybe it's like, we're all young people.
I don't know if it's crazy.
That every young
I feel like
person envisions
you'll feel
for
like
themselves is
better
supported
almost.
to become a reality or something like that, right?
I
Where it's
see.
really
Yeah.
centering around what children and families
I don't know exactly how
want for
to change
themselves
that,
and their
and
future
or
and how
I
they
feel like
can
we could do
but
something
that the responsibility for that is on the
Could be
system.
like Ann Oregon, where young people with
And
background
support
and
services.
and remove that future and move it.
As you were saying that, I was like, oh yeah, we do need to flip back the slide
I mean,
because
like healthy and
Some of the
safe,
others?
it sounds like we're in
because the
agreement on.
tribal
I like all
vision, I
those.
think,
We
didn't
want-
try to approach it that way.
Yeah.
It was opposite.
Right.
I did that.
Yeah.
Anytime.
You know, we know that some things always leave people behind.
The assets of
Is that
the
kind
business.
of the one on the, it's under, I know we're saying vision, but if you look at their mission statement.
Does anyone have a preference as to whether or not they want it to be like short and sweet, or if they want it to be like extensive?
Yeah, like Ann Oregon instead of a future. Right.
Speaks to
Yes, I just
how we
table.
You guys found, oh, you found that.
Happy,
Perfect.
healthy.
Very, very fancy temple photo reel.
Hutchie, did did that sentiment, that framing of program provides.
I like that last.
Youth, boys, family driven, community based. That start getting from, you start with.
Our goal is not to
Where,
That to me feels like.
did I hear you correctly, family, or
happiness to
children in the family drive? That we hold the system accountable for the outcomes.
Yeah, I
for
mean,
boys.
and to say that people,
Very well
and to
said.
say that people should be happy, then provides instant tools, resources
They're not.
to families and communities.
Don't belong
Here's my entire
We're
class.
not working with them. Like, some people
Plan and
just, they're
design,
not.
youth, boys, family.
Dysthymia is in the DSM for a reason. And blah, blah, blah. We'd be really pushing people out.
Like moving
we
the,
use the
because
word
that still
happiness, we're saying,
reads
like,
that someone else is making the decision about what the service is.
And I
gonna be.
entirely
Instead of the youth, like centering the decision making.
Even somebody with dysthymia, really doing well for themselves and not
Kind of the way
what
that I'm seeing it is that the mission is like what you want to do, the vision is like the perfect outcome, right? Perfect outcome.
because everything.
Um,
I'm wondering, is that a
I
product
think
or is
it's
it like
real.
a vent?
It's great for like,
Jackie.
straight from the
Job.
road.
I just want to stop a shout out for modeling the
About
perfect
how to
example
lead
of here's something that doesn't work, but here's a solution. What works is happiness and feel good.
handwriting is literally just
This is
perfect.
our day with the high five.
Thank you. I'll
take the cake like the official cake.
But we'll give you
I
one.
love that
It's
solution.
also-
Thanks for doing that, Jackie.
Okay, so that
Right,
doesn't
with
help.
the like how it shows.
Yeah,
it.
So that's not gonna.
So somebody who has
Tic Tac.
actual limit myself can be.
Thriving is really happening. People are thriving.
No, yeah.
You know, it's life living in the pursuit of happiness. That's
You wanted to focus on vision first and then kind of like look at mission afterwards.
I'm open, but that's the way. For me. So in terms of things, I would say beyond our value of
I was just looking at
centers, children and youth and family,
Are we drafting?
something like driven or
System that is aligned
when I'm such a literal.
body.
Yeah,
Mm.
basically.
Nothing about us without us.
So we're three part of it.
Something about
Happy
decision making.
What I wrote down was as designed by.
Or do we need?
Our current vision has,
And then
you
I
know,
was tacking
safe,
on
healthy, thriving
but all those things need to be designed by or decided by.
So I see like culture.
So I feel like safe, healthy, and thriving is an outcome of like positive systems change.
Oh, no, that's fine. Yeah, no, I'm okay. Like a future where all young people are healthy.
It's the angel on the hill.
Straight
Yeah, in Oregon.
What was that was, yeah.
Have
If young
in the
people
data,
don't
one of the worst
Like that too.
children's behavioral health problems, but we make similar or larger investment. And I'm just thinking as we were looking at the vision and the mission, what is specific that we could say?
Which, yes, like,
Access
the way that
to
my
care.
brain works sometimes.
Yeah.
Yeah, and I see that it says accessible, but, and I'm curious, yes, we need accessible care.
We also, there's so much data that we got. I remember there was one that was like, oh, like of any state, we have the most resources per person, and yet one of the highest rates of like everything bad. Which is like, I think people don't realize, especially people that didn't grow up in Oregon, they don't realize how rural Oregon is. There's like maybe 4 major cities and the rest is farmland. So it's like, I think people, you know what I mean? Like, not every city is Portland, right? Not every city is Eugene. Like, Corvallis is not like a massive, you know? And I think that, especially after going to DC and having to explain that to people and them being like, what? There's farmland in Oregon? The #1 timber state? Like, yeah.
And mint and hazelnuts, thank you.
And like berries, it's like, yeah, what do you think goes on there? I can't think of a single state that doesn't have some sort of farm. Anyway, so I think one of the big issues is just I mean, when I had for the youth orientation that me and youth are working on, I did a resource list that's extensive and one I haven't seen before. And there were so many resources I never heard about. And or like, I found stuff in like Malheur County. And I was like, I didn't know that this was a thing you could find, right? Like, I was like, I didn't know this was available in Malheur County. And so it's like, I feel like a lot of the things, accountability are there and there's still to be more.
I was gonna wonder.
But there's no emphasis on getting people to them in a way that is equitable, affirming, and respectful.
Whoever we
I think just like
Access to resources is definitely a area, but I also think there's some that we're like accessing care, because that's where I see. Make my life easier.
I'm here in
Position.
Portland,
One was
in Oregon, where we're all youth and family.
and we had, but I had short hair, we were at $10,000 sign-on bonus. We were
Those
our
kind of things,
32-hour
maybe
work
that's-
week, and 4 days a week. We were like thinking of every way we could to promote and to bring folks. Still, but it's Eastern Oregon, it's Pendleton, Oregon, it's Mission, you know, and so it's kind of like, how do we get folks interested in the field, and those who are interested in the website, was maybe working in college or have already graduated, how do we get them
to say the
do
appropriate
this?
level.
You know, what is that gonna look like? So I think definitely a huge focus has to be on a skilled workforce.
Well,
maybe that's-
that would be a
And then,
Cameron.
because like you said,
And then
once we have, then we can
there's a
open
way
this
to
program.
describe
and
what our service.
Training and acquisition.
Absolutely.
Oh, and retention is a very important one, because it's so especially with a workforce with like a high turnover rate, or not a lot of people in general, it's very important to maybe incentivize isn't the right word, but it's the only one I can think of, to incentivize people to stay.
Burnout's huge.
Absolutely, like caseloads are insane, as someone who recently had to unfortunately deal with, you know, caseworkers and stuff like that, like it is upsetting to see how much they have on their plate and how much they kind of have to shrug off in order to make room for other families, other children, and it's ridiculous.
I don't know how we work that into our
Why do we spend
vision.
so much money? Is it that we're trapped in crisis care and everything's not? And
I think that's a really good question. Like, I want to dive deeper into that with data, but I know whenever,
Something.
you know, we have a CCO, behavioral health director, and we meet pretty regularly. And I think some of it is what you said, which is some of the system is sort of built
Bigger words.
out there, but it exists. In theory, if people don't know how to.
And people don't know it exists.
They don't know how to get to
What other? Time they're like, oh, well, we can give you the service, you have to go out to Portland. We can give you the service, you have to go to Salem. And it's like, I'm 4 hours away, I'm not doing this.
Or there's telemedicine, you can come in there. I will say, as I'm, and this is something,
Underserved.
a theory, it's not
When you're saying that, I was like.
fully baked idea, but what I'm sort of sorting through is that.
That's one
I
word.
would-
Yeah.
I would-
Wave a Samson
And we-
I'm on a nonprofit.
Of meeting people where they're at in their communities. We just have a pretty robust case management. And case managers around it, which has the pluses and the minuses of that, right? You come over to the medical model.
I mean, I'd like to know what,
that-
So-
I mean, I just know.
Yeah, they're veterans too.
And
was at a
so when we say care coordination, I don't.
Makes me cringe. I don't like
This
it.
might be a
But
controversial.
We're still getting.
They're doing what
And
it
figure
is.
out how to.
But that's different than that deeper, when I hear over and I look and I understand why the child's
Like way before
that, like, exactly what they're seeing as. And so we've got almost like these two cultures, and what I think we're kind of missing around the behavioral health system is this.
Fake
Well, you know, we, so like what I think, when I'm trying to translate these languages is really calling for getting on the table for is for our behavioral health system to have almost like personal navigators for each person, and then that's the medical language. But over here, it's called, well, more like you have.
Someone who. They make their own, make sure you and your family have transportation to that intake.
Like a route service coordinator.
Yeah, except in medical models.
Someone did graduate.
Particularly, there's been some attempts.
You have to go take a nap afterwards, like, all right, I'm done for today.
Even with the, like, one layer deeper, it's not quite that. Like, maybe they're connecting you with this one service over here, but you don't have this person you're developing something with. So you're gaining trust in, that then is working with you regardless of any.
If you're doing one and then moving to the other, now would be a good time to make sure you've moved on to the other. If you're sort of doing them simultaneously, just know we're at about half
Write down
time.
everything that we're
So you can
saying.
manage your time in a way that feels good.
Are like, this is what we wanna do.
You can the parking lot. And you go like-
Transition to.
You know what I'm saying? Cause when you were talking about service, I've never.
And it's managed care, and it's coordinated care. But we all think about a case manager being this person who almost advocates for you, who figures out what your needs are.
And I think
creates
it's
a relationship
figuring
and
that
helps.
out.
In coordinated care, it is.
Understand, especially someone.
Maybe this person's come up in the system, okay, they need a psychiatrist and a
They
therapist.
let us taste
All right,
everywhere.
we made their, we helped them with some referrals. It's up to them and their family to figure out if that's gonna work and how to get there. And if they fail out of that, say la vie, because.
That's really what was in like traditional health worker care. In the behavioral reality of those are folks. I live closer to them. They have lived experience and they know.
So there's no.
And so we link every one of our youth who are engaged in outreach services. And that here helps that
I got
family
hired as like regular staff, and then today, all the other staff got cut.
to resources and to services and also.
So they all got fired.
Yeah, I agree.
So I think a lot of what you're saying, while there isn't a specific
specific.
Like Emily downstairs.
There's a word for it. One of the systems. are probably-
Yeah, we're like in there, she's like.
Relationship and
So-
support.
Yeah,
Exactly, and it's from somebody who's already navigated the system, so it's somebody who also knows that we're limited.
That's why I go back to, I know I hand up from all
They
back.
kind of have that lens of, okay,
What if we said
We've got
a
full
fair-
safety.
Could be
this is what I learned, so they take that.
Or they're like.
Karen just covers.
I know she got her copy in her car.
Also, I'm.
Let's talk.
Like a little.
Like, I know how I can fix it. Here's this, and this.
Never be healthy.
Right, yeah.
Like,
really
I just got a.
I think that's where they can have you out of like how it appears. Right, no matter what we put down, it's always gonna be someone who's.
I know I've heard people are against.
So Jacob's dad, my husband dad just did that.
Is,
I don't see it.
Driving, I think, is a really
the
good
system,
Yeah.
the system is working on. And
Make some.
it was like at the bottom of one little tiny slide, and they rushed through up to 25, you know, and I think,
So I
and
didn't
I don't know
catch
if
that they
that's
want us to move to
important.
the other,
It
but like,
seems that that
just to
vision
tag, yeah.
level is much broader
And
than
work
this
in-
society.
You know, is a
But
part
in
of
the mission, it says here, and I don't know if
without
that's
disparities,
important
because then we
in
can,
terms
it
of
does get away from.
I mean, I think you should ask them, like, do you want?
care is serving.
Yeah, it's multi-systematic. Youth is considered a person under 25 who's multi-systematic.
Yeah.
And is
Yeah,
it
they-
really
you see
a vision and mission for that to be a part in terms of
Whereas like,
subconscious?
actually, I'm talking about the kids who live in the
Or
trailer.
is that just something that's?
I think it's more so to like keep in mind that this definition of youth is the one that we're serving.
Yeah.
I think it's less like define it in the text and more like keep that in mind.
So in some of the missions, it comes out more in terms of CBHI, it does sound right. You know, is it something important to
Is it in the
Yeah,
bring
they kinda spell it
forward
out.
in the mission? Because I do think that's part of DOCAC's problem with defining the work, because it's so incredible. And so to think about who this work is.
Yeah.
representing.
Yeah, it's that how.
You know, it's those, why are we doing this?
Okay, I mean, it's already.
Identifying terrible system gaps.
I just, I kind of feel like that falls in the same trap of being too specific.
Large populations.
Does anybody, let's say, like,
Additionally, I think they might have a different definition of what it is, because they don't use youth at all in the CBHI when they use children with serious emotional disturbance.
well, you know, that's how they see it, right?
Yeah, I think I see what you mean though, of like, you don't want to be too broad.
So that's where like, my brain was, I was trying to like.
Right,
get
there's
words before I said anything,
a.
or that'll like-
No, you're right, and I was thinking my way. I'll show you this.
Would you guys like
Mission.
wanna do stuff I wrote?
I know, you got a lot.
What did I say? What did I say?
You better write it down
It's not
fast.
exactly what I was.
I have 20 years.
Where I'm going right now.
So what I wrote down,
Oregon without
I wrote
disparity.
down under vision of succeed, done, forward with.
No, I like
I wrote down training, acquisition and retention, slash, access to care, culturally competent care, which I don't know if we specifically touched on, but I heard culture, I was like, oh, that's probably a good one to think about. And then direct personal support slash peer support. Those are the four that I.
See where it goes.
Assessing resources. Yeah.
Right, and that's what the like. Status.
Medical.
You're like, yeah, they have it. It's possible for them.
System.
No, this is where I get tricked
I-
up.
Like the grand thing that they are.
wanna do that.
I think that's too specific. Yeah. If we did, sorry, if we did mention like specifically medical supports, then we have to mention multiple types of supports, like medical supports, health supports. Otherwise, it's just one,
Cropped it out.
locks it down under one specific vision, it would be for medical or for this versus
Yeah.
for all the, you know what I mean?
Yeah, guys getting at there, like, we had a fairly big conversation acknowledging that, like.
That is a good response.
What about like a
Well,
multi-systematic
we don't-
approach?
Something,
I like
like,
that.
I mean,
that not all parts of the system are sort of
Ooh, I see some excitement.
equally.
Oh, no.
I love that. Everybody's needs are gonna be
But a
different.
multi-systematic
Yeah,
approach.
so I think
I mean,
not just
I guess I'm
medical, but
confused
also
about like
social.
different.
Even if they're not.
And
that's been problem.
It's been people need to know that.
The
words
have different needs.
The words too in my brain are, they might not be the
I
right
fully
words.
understand that, but I'm just.
Transparent,
Without disparity.
meaningful access,
Where youth and
um,
family are.
clear navigation. I don't know. I'm not sure how.
How's those back here? Are we getting?
They would hint at steps we could take later as we develop.
Rather than like.
How we're going at it.
That and sort of like.
As you get
maybe
closer and
education,
you have
I don't
what
know,
your group
something
sort of
driving your
generally.
home.
Okay, so
One of you will be reporting.
in Oregon without disparity,
Just
where
figuring
youth
it
and
out, so
family
you wanna
needs
figure
are
out who
being
wants to
met
do
and
it.
thriving and
Oh, okay.
community are being met.
Okay. Are those bananas?
Yeah.
They're adorable.
I love that shirt so much. My partner has a matching orange one that he got on accident.
Oh, that's so cute.
Right? We always, we never wear it on the same day. He'll be like, please wear the banana shirt. And then I'll just have like a t-shirt on. He's like,
Belonging.
we're not cool anymore. Now we look like a bunch of
Those are
nerds
not
with
a term
an orange shirt on.
That's a good
I
one.
also took.
Yeah, that's really.
Connection and belonging
Yes.
really go together.
Yes.
Tell me this.
Yes.
I think
Couple things
belonging
in
would
there
fit
that
well
I
in the
think
mission.
want you to say like
Belonging.
remaining in their
Right,
homes and
system.
community from a system
Yeah.
that is one of.
Scope.
I'm giving like an 8 to 10 minute warning so folks know it's time to start wrapping. I'm hearing lots of good ideas. Don't be afraid to put those down on the page. This is the perfect chance to practice. Let's get to better. Let's get to good. Let's not try and be perfect just yet. We're gonna come back to this tomorrow.
Thank you, Addie.
I make sure we're young people
I
from all
think that-
backgrounds are healthy, safe, honored,
I agree.
and thriving in a transparent system of leave some space for that work that are remaining in their homes. And we don't do this work because it's just tweak just a little bit. Right.
The only thing I heard, I liked what Tati said about holding the system.
In Oregon without disparities, where youth and families needs are being met.
And I wonder if there's one little
Driven by and for.
where the
That
outcome.
could also be in the
These are
mission,
math.
because one thing in the mission was there was no like action person, it was more just like a statement still, and so I feel like you could say who's actually taking the action.
Could you read that to me again?
It's telling it, and also outcomes are met, like then you build them specifically, like how do we measure that that's happening?
Why was I handed this? That's what we
That's
want to
really
write,
good.
like what you're gonna
You're
report.
saying-
Okay, I guess I'm writing it.
Yeah, you wanna, I mean, yeah, she
Read it?
Yeah, I was like,
It's good to
I'll-
get something down.
thank you. I'm like,
In my head, it doesn't sound right.
I saw your hand.
I write my R's and my S's, my R's and integrated fonts in the same sentence.
Like, you know, Patty said, it's good, it's better.
Which one? Vision?
Better word than options.
And right there.
Correct. But you pause and we can tweak it as a future.
As far as
All
building,
background.
And I can look too.
Yeah.
Even when I was like today, it's actually
With the like white skin.
bigger,
Yeah.
have a child. Better.
What is that?
Sorry.
Trying to hide it. You read through some of those.
healthy.
Safe.
Well, brighter tomorrow. I mean, I was thinking like, what is the Amazon?
Yeah, so we have like 6 minutes left. So like really.
Sense of belonging, connection, and it's like very clear and a transparent.
You think that should be in the vision, like the mission, right?
System of care.
Yeah.
I added that.
Cause the vision is just like, it's-
Everybody needs.
And also when you're getting into center, you're talking about design. Guidance.
Yeah, it's
Yeah.
right. Or signed by and for, right?
So I think that, you know, right, it just starts with accessible. That's how you can get to that vision.
You could even say,
So
buildings are accessible and equitable
And
I love that.
I have like tears pricking in my eyes.
I think that last part's also super important, not even like talking just about like out of state care, but like, I feel like, yeah, a healthy hours, so weird coming for me. It's like, I feel like because of like social media
Current mission is
and
accessible,
like,
and
there-
equitable
there's
systems
such an
transformed
isolation,
by
I
the
feel like,
lived
with a lot of
experience of
people.
youth.
Because I mean, there's nothing wrong with like just sending your mom a message on Facebook and then like that's, you know, my mom interaction for the month. But it's also like,
Only if we're applying for federal.
you know, and I feel like, especially for people that are systems involved, it can become very, very isolating. Like people that are socially awkward, myself, it can be really hard to
We're doing it now.
go and do things that otherwise would get you like person to person, in-person interaction. I walked into this room like, this is not gonna be a good day for me. And I'm doing okay, I think.
I've been in the community quite early.
5-minute warning. 5-minute warning, even if it's imperfect, let's get some things to start with tomorrow on both pages.
Be nervous.
It's actually the preventative.
Whatever the extra words are.
Especially in rural communities. One statewide facility.
Knowledge for.
So I started one too.
Okay, it's over there.
Thank you.
Let's go.
I love it.
Doctor handwriting, are we good?
Because like, the system's mission should be to move, I would build space and
Accessible,
right, like, yeah.
equitable system as designed by
Like
you
cultivating
and
it, but not
families.
always.
We are touching multiple systems.
Okay.
The families not in
Action centers,
Children.
It's so sweet, right? Like
But it's
oftentimes with
missing the
like
accountability.
youth
Yeah, I
that
think it
interact
needs to
with
say
getting
something about
involved,
like the systems.
like a lot of the stuff you do now is not gonna like bear
Could
fruit.
I
by the time
see
you're
The system of
what you
care.
wrote?
Create accountable to the families and their outcomes.
The system of care is accountable.
Notes like.
Continuous quality improvement.
This is like reporting out notes.
To drive,
That work. So the SOCAC would exist to continuously quality.
Collaborative.
there's a whole.
Shared design by and for.
Don't show it to me, I'll make you just.
Cody, I'm
Selling.
about
All backgrounds.
Coordinating enough.
Yeah, I appreciate you starting to block
Okay,
out.
how about this? SOCAC seeks to
They need to figure out the payroll on the back end.
I think of
transformation accessible. Systems.
Have a sense of intentionality
Designed by
that I
you.
don't.
Lived
It just makes it
experience,
important.
touch multiple.
So do we wanna keep
Okay.
the cultivating?
I like
community part
transformation in
and
this
also
because
include,
clearly what we're doing isn't working,
Yeah.
so that allows us to make things.
Smaller is good too.
Yeah.
SOCAC.
Sometimes it doesn't require
I mean, I think that
like.
covers all.
Correct.
By
Yes.
centering.
There's no reason I'm looking at you. You're in charge. You're the one, you're the one.
From the scratch page to the official. Love that.
I saw Holly around here, so.
No, but.
How we doing?
It should be.
Got it.
Be careful, right? And I know like.
Sound yep.
Our system.
I had no doubt. And no doubt.
Children, 100%. I mean.
Yes.
You can like give the kid what they need, right?
Yeah,
And then-
that's what I love.
Trying to.
Good
choice,
Come up with.
The vision was easier.
Yeah, cause like the vision is just so like, it's so far up, you know, you wanna make
I
sure.
find it the
that-
hardest one for times, right? Like, I'm excited to be like,
I'm like, that
It
doesn't
does
sound
take a ton of energy.
like what happened right now.
I feel like. terrible.
That's just what I was
Think of
thinking,
it.
Cameron.
So,
that's fair.
If
That's,
it
I
makes you
totally get where you're coming from. I'm the opposite. I'm like, well, I get to step out of reality for a second. Give me that.
Yeah, that's right.
As designed by you.
Experience.
Yeah.
All right, I'm
Final
seeing
ending.
folks are starting to wrap, so let's give it just 2 more minutes and then we're gonna do a little reporting out. So figure out who at your table is gonna be your spokesperson-y person. And I appreciate people taking their time to write these clearly because I'm gonna collect and get this before.
Literally, I'm not right anymore.
If it's accessible and affirming, equitable, I'm doing that transforming, we're trying to transform it like to that. I think that in their home.
I think it's board that created it.
Anne, I was hearing Anne.
A.N. or I.N.?
Oh, Anne or I N?
In.
In Oregon. Anne. That's what I thought.
Yeah,
too.
to work. I knew there was something.
Oregon as a
And
thing,
Oregon.
as a.
Oh, wait, this is the one time we're
supposed to.
allowed.
Yeah.
Anna.
And
Oregon.
Oregon.
Seeks to drive continuous transformation toward accessible, affirming, and equitable systems as designed.
In Oregon without disparities where all.
When we had that team meeting where we had to do all.
The very last just kind of sounds off.
We were like pushing each other out of the way.
So the first part of it.
Yeah.
Needs are met.
Damn.
Or is that to?
All their needs are met in health and education.
Uh,
I was like.
So you were so right the first time.
Oh, yeah. I just want to make sure.
That's what I was like, I think it's.
Okay, so you're gonna report out and like your earrings.
Yeah, that would be useful.
Yeah, well, and this is just a solid, just
I'll be the
total first draft, I mean,
Really.
The meeting.
Could be nothing wrong with a solid. Strive continuous transformation for accessible, affirming, and equitable systems. By youth and families.
Last minute, time to add the little star on top of your eye.
And families with lived experience.
On top of my eye.
Send your children.
That's fine too.
Did you do that? Did you ever do that with your name? Remember that girl?
Because lived experience.
I wanted my name to be Tina and I wanted the eye to have a heart over it. Yeah, it's so bad.
I love being a copy editor for like.
No, I wanted to be Tina.
I should start writing.
I think I just, it was like.
One of those people that are like, oh yeah, you were an acrobat for 2 years. I'm like, yeah, I wasn't.
I want to be her when I grow up.
Like, I already know that.
A bunch of weird jobs. All of them octos, I'm like,
I think like 2 jobs that have helped me most in my career overall is waitressing.
Yep.
And being a tour guide.
I disagree.
Everyone should be mandated to work at least 1 year in the room. That's how I feel. Like, I think a lot more people would be humble, like respectful, and glad.
I like beg to go to
board. Don't have to. Someone who has recently worked in research. She like after 2 years.
We never have enough like resources.
Oh, there it is. That's
just no one else can, but I'm hearing this.
Okay, we're gonna frame this
Oh.
up.
We're gonna make this work? Okay. I used to work at Willamette View
I
in
used to get really mad when she would give me.
Milwaukee. It's like
And so
close to
Really good.
Man, it was great.
They're really good at making you.
People were most lovely. I actually, one of my high school teachers' parents.
But did you ever get good at
So they would like email him and be like, yeah, your student is hanging out with us today, just so you know. They gave me like their card, which they had.
All right, let's bring it back in. Please and thank you. I just am very impressed because I think every table got up on paper. Is that right? So in 30 minutes, you guys accomplished what sometimes takes organizations like a whole year process. So I just really want you to feel excited about getting us there. Woo! Ellie's gonna facilitate some reporting out, and then I'll share with you what we're gonna do with these beautiful pieces of paper.
Do we have a group who wants to go first? We'd like to hear it. Oh, yeah, Annette's group says yes. Did you volunteer yourself for that? Are you reporting out?
She's not even the one sharing.
That's what I thought.
You got it. You got it.
That's really fun.
Okay, someone else.
We'll go
Okay.
second.
We'll go
We'll go
second.
second. All
You
right.
can do it just to get out
All
of the way.
right, this group's gonna go first.
Alrighty.
All right, let's listen to what they've got.
All the youth are presenting. This is fun.
Vision.
Nice.
heard talking. In Oregon, without disparities, where all youth and families' needs are met in health, safety, and education in their homes and communities.
I wanna live in that Oregon.
Yummy.
Mission. Creating coordinating systems that cultivate belonging in communities. That's it.
Yeah.
Used to be nicknamed like brevity is the soul of wit, right? Like really short and to the point. Oh, I'm so sorry.
All right, group 2, are you ready back there now? Cool. All right, Cameron, let's hear it. Either, you can start wherever.
The mission is building accessible and equitable supports and breaking down barriers in a way that centers lived experience to create brighter futures.
Cool.
And the vision is a future Oregon where young people and families are empowered via a system where everyone can thrive and be healthy at home and in their communities.
Yeah. All right, this group? Yeah, let's hear it.
I have to be cooler than you. Do I have to stand up?
You don't have to. We just want to hear you.
Cause I can. Mission! The SOCAC seeks to drive continuous transformation toward accessible, affirming, and equitable systems as designed by youth and families with lived experience.
Okay, who thinks Zafir should be like a radio?
Yeah, I'm a professional voice actor. I do this for a living. I'm not joking. I had to record lines before I left this weekend. Vision! A future where young people from all backgrounds are healthy, safe, honored, and thriving in a transparent system of care designed by and for them while remaining in their homes and communities.
Yes.
All right, last but not least, this group. What do you got for us?
Today.
So, vision. SOCAC envisions a prenatal through late adulthood full continuum of support that offers swift, responsive care that is aligned with the needs and desires of youth and families we serve with proactive and appropriate levels of support services. In addition, we tried to weave in the values. SOCAC drives systems change by prioritizing community care, centering children, youth, and families, family voice through collaboration, system accountability, advocacy, and policy.
Nice. Yeah, you got the value.
Big brains over there on that one.
Okay, so Addie's hanging up your.
Yes, so. We won.
You're all winners.
We win.
Okay, so what's gonna happen is Addie and I aren't gonna sleep tonight because we're gonna work on everything more when we leave here. So we're gonna be really fun tomorrow. So we're gonna go take your mission and vision statements and sort of do a mashing together of the words and the thinking. We are going to continue discussing that when we bring it back tomorrow because we actually can't have this many separate missions and visions.
That's who.
I know. It's
Democracy manifest.
So what we're gonna do is take your great ideas and see if we can bring you back something that's tying these things together. But it is certainly not the end of the conversation. But we wanted to get started and make sure that we have thoughts from you all and some good language to work with, which this is gonna be perfect to get us started. So any other thoughts there, Addie?
No, we are gonna take a break, and as we take a break, you've used all your wordsmithing skills and you're gonna shake that off, because this afternoon, we're doing the opposite. We're gonna be big picture. Not every word has to be perfect.
Right.
So in 10 minutes, come back and we're gonna do a
12:10. No, sorry, 11:10.
short exercise, and then we're gonna begin the strat planning. Thanks, everyone. I'm really impressed by these. Really. I often get them that are like 7 pages long.
Go eat snacks.
Going next. Nice to have the way before lunch get here.
Yeah.
Yes, which is perfect.
I was making a joke with Sophia. I'm like, here's my vision.
Like that. Bags and bags.
The number
I could
4.
not read what she wrote. I was so
State of Oregon 4. That's it.
Not you.
See?
I would have seen there more. Yeah.
You just put your sticky note down. You're like, good for Oregon. And I'm like, this is,
Oregon 4 kid.
there was numbers in there.
Nope. Perfect, get straight to the point.
We have all the words and you had.
Yeah, you guys are like big brain
Yeah.
people.
It looks like it's amazing.
license plate. I see TV plays one.
So we're, I'm gonna be all day. Well, so kind of.
It's like they day. There's still hope for the United States.
Exactly. I do dramatic conversations with this and Cameron. I'm like, oh, maybe we're gonna be able to.
Yeah.
Hopefully.
Well done.
What's new in your world, man?
Oh,
Did you say
I got my phone.
Yeah, for my emo.
Oh, when they hit the turf on them, the.
Yeah. That's what it's called. It's an emo.
I don't, dude, I'm old. I like how the skank recently, does that make me cool?
And then people are like, we need to know what it means right now.
Yeah.
And I'm like,
Yeah, there we go.
yeah,
That problem.
take a while. I can give you a disingenuous or top frame, which is
catch that.
for many things, right? Like, this Oregon, we're gonna see.
Yeah. I think that. Anti-drug PSA, I got it. Tackling our day trade.
Thinking about it, but because I'm always the first one to do it.
I did get compliments from the
I
chef.
decided to not say those words to most.
But no, I was just
See if
thinking
someone
that's
else
what
say
I
it.
what about a sales tax?
I don't, I think that's a great
If
way.
I paid to do it again, I'm there like
I love
anything.
moshes.
So here we go.
Oh, so we like, I am like, my businesses.
Oh, don't you just get like.
About that.
Like trying to sandbag.
Oh.
Yeah.
Along it like really.
This allows me to do that.
Yeah, I actually had alcohol or making them. Yeah. Cool.
Yeah, yeah.
I do.
Yeah.
Whatever.
I've done it, but
That would be a mistake. I made that money. Bad.
Yeah, still a lot, yeah.
You know, I kind of think about those things very quickly, and I'm glad you asked that.
And then everything.
Have to be. They're just like, I'm so. And then I have Annalise is already. Like, I always say it all the time.
It's like Marilyn Manson.
For that, right? Right. But I will more have out their phones that I basically.
I used the gel and I was like challenging and everything.
Oh, I have, and I hated it. And it was like definitely not pick on.
There's pain now that I'm like.
I think they drew the short straw who was gonna like call me. Sorry.
Yeah.
I was like so apologetic.
People.
You gotta stop.
People.
And then I basically was not involved with some of the other efforts at that point. Then got really messy in session, and frankly, I didn't follow very much.
Yeah.
But I think to come back, and I think there are people in our legislature that they have.
More of that?
So I could not have done that.
Industry, like it wouldn't have been pure public health good at all. It would definitely have to be shoring up these.
You're trying for.
Because what is true is they're not. That's
Oh,
So I just like in my
Yeah, it's like weird.
And the now this type of time was the only way to ever bring that. But I'm like, would be when.
That when it like.
Yeah, because it's 20.
But again, no,
Right.
I was really bored on that before. Oh, I agree. Sleep apnea, she'd be a good one to see, yeah.
But
she. Wow. And if she's doing it, it's probably realize why, since I did not succeed. I wouldn't be the first person that you would approach with that, right? So.
You got it in the ARB.
So it's not that far. That's because everybody I worked with, you know, it was more my own connection.
You're making me anxious.
We needed to do more. And I knew I was
Right? You're like, protect, you're your safe space. I'm so strange.
But yeah, I would imagine Annalise is very.
A handshake for like a hug.
Something's gotta give. And I'm so ready for a sales tax.
Already seen my house.
Yeah, we're besties. Sorry.
We've already been.
I think it's
It is. All day. It really is.
That's too bad.
And it's awesome that people can make connections and maintain relationships that feel close.
Make yourself
And
at
they're
home.
not even in the same state.
Remember all those things
Best
that we
countries that
real core Republican vote for
Yeah.
all those reasons.
Yeah.
Yeah. And right now, when everybody's been experiencing.
We got almost done because it was all blowing the other direction. So like even
That means that we can boost their
Yeah.
safety.
all kind of blowing up and
Not find a water bottle in my house. We have like 10
Part of
children, not too much.
I hate it.
Of course.
That was the government's plan.
Yeah.
I mean,
And
they're all
and-
because like
I have 5, but none have 5 lids, but none of the lids match any of the cups.
Getting ready to play out, but yeah, I can't stand that. That's what I like. I'll like right when you're rushing to try to do it. It's all under sort of.
And then.
Yeah.
Well.
I think some of that's.
Probably.
Okay, how are you? For us who are.
Which I'm kind of okay, I'm okay about that, yeah, right?
Well, who it really sucks for is children. And seniors, whether or not you voted for it, they are going to bear the burden of the debt.
Yeah.
Oh, that's probably still.
Black and brown.
He's probably half people.
exactly.
And it's
Yeah, so hopefully.
I don't
We just
crash.
do both? No?
We didn't even get I think there's some definitions around how behavioral health is gonna shake out.
Yeah, it was a win.
I was
Dragging.
department law.
Yeah, okay.
Abigail's
Severe persistent.
the best.
Yeah.
The Yellowstone, you see every pretty
Hard,
part.
and I was like,
I wasn't sure.
Yeah, no, I believe it.
that I'm gonna need.
I like that there's
Downtime
volunteering.
on the drive, but she didn't think
They're
that was
doing
nice.
Yeah, right.
To go back at it.
Well, maybe we can stop our schools.
You don't want me, I don't want you.
I was thinking about things we have success in Tati, because I have to, so I would say.
It's a lot better.
I know,
I took a 10% pay.
I've done, I think a damn good job across OHA and health services, and we keep going. That is the things, I think HCBS we're improving, and so far it's hands off. It's kind of a bummer though, because sleeping in, give it like this.
But she's houseless.
Right now, it's like this. 'Cause we
Oh,
didn't get-
it's BRS.
It's behavior rehabilitation. So right now, it's supposed to, any eligible child in the state should be.
She's watching online.
Unfortunately, chronic
Yes,
illness,
I know.
understaffed and unfunded.
2-minute warning, which makes no sense to say the people in the
It's in
room.
the
What was
juvenile,
that?
2-minute warning.
which means that we have parents who have dropped their kids off at the ED and have been coached to leave them there
Mhm.
and have them under the child welfare system. Behavior rehabilitation services is also not supposed to be behavioral health services. It's supposed to be like muscle coaching and skills building and emotional support. And I look at it as all the things that we think probably should be in place for the extra for kids who are facing structural problems, structural racism at every level, you know, all of the ism.
I want
We should grab that gives with all that extra that VRS could allow.
Yeah.
To me, like, and it's kind of, when the behavioral health system is built appropriately, I think
It's frustrating because.
that's right. That's right. It's kind of also
Some people in terms of equity.
like that. But when that is in better shape, that'll help us right size VRS. But right now, we are not in compliance with CPAS because we're not providing this to all. We're trying to do it with again, like a shoestring.
Why some people, like, why on the other hand.
You know, like I'm scrappy at every
So
level.
where is the money going?
I think that's a good Chelsea question. I mean, Medicaid gets just general funding, and then we have some earmarks for things like expanding CCBHC statewide.
And I think a lot of people.
There's been a lot of energy into IIBH.
And that's part of it too.
Yet being. But it feels like it's on the verge with some structural changes that this needs to make it work less. That's why I have a little. I don't know yet. Yes, it would be interesting to hear. Some of us. Principal Archer. Yeah. I would have her answer to that question would be, I don't how I don't follow. And DCO.
My experience has really been.
Things are not.
Not necessarily that behavioral health.
So some data that shows that they're filling more hours for less acute populations. Never really said. I think that I was really nice, but we're also paying them the same amount. Someone who is operating within the COA or operating with.
That is like one of the biggest experiences.
Both things to be like, how are you?
I asked the good. I just sat at your spot and I was like,
I saw you.
But.
I'm trying to get Jesus to help convince everyone that we're doing activity.
I'm here today.
And that's funny.
They're actually not seeing what is
It's
that
that pillar and failure.
What I do.
I think there are things we need to right size.
I'm so sorry.
You know, maybe the rates are just too black to stand in the middle of that, and we need to get out.
They're gonna go stand in the middle over there.
Try to convince us to do it in a way.
Worst case.
I feel like they have this kind of really.
They're on the planning.
Conversation we need to write. I appreciate.
All right, I'm gonna bring everybody back in.
Later.
And then you
I'll see if I can find
somebody else, and then you gotta get to it right.
Yeah.
Need to work.
I know.
Okay. Anna, where's your sign? You're gonna stand right there and hold your sign.
Only seen in electronics.
And have I lost my south?
Yeah.
You have your south sign? Okay, so
Oh, wait, yep.
we're gonna go north in the back, west, east, and my lovely, lovely south.
Yes.
Okay.
South. Work it out.
I'm gonna read the overall synopsis,
God, I got so frustrated.
and you're all gonna giggle because I think I placed the staff in the correct spots, which kind of makes me happy. Then I'm gonna read then we're gonna move to where you think you belong. And then I'm gonna read through some qualifiers, and then you get a chance to reshuffle if you're like, whoop, got that wrong, okay? So, our Norths, they're acting, they wanna do it, they wanna get done, they wanna plunge in, they make decisions by moving forward and getting going. Those are our Norths, just listen all the way. Our Wests, all about the detail. They like to know the who, what, when, where, and why before acting or doing anything. Our Easts are speculating. They want to look at the big picture. They want to know all the possibilities, and then they want to drive towards change. And our Souths are caring. They like to know everyone's feelings have been taken into consideration and that their voices have been heard before acting happens.
Did you do this on purpose? Abby?
Hold out. How good did I do, staff?
You just typecasted us.
It can be wrong. Everyone in the room move to the direction. You're gonna have multiple, but the one you most affiliate with.
Surprise.
So you just gotta pick the best possible one. We're exercising the good is good enough muscle. Elliot, where would you go? Okay, so listen up, I'm gonna do some more qualifiers. And if you hear the qualifiers and you're like, I'm in the wrong spot, feel free to move. So my north's up here. I'm gonna give north a lot of love. I usually land north to south somewhere. Right. Okay, this group, you take charge, you run the daily operations, you have a list of things to do, and you need to get started and you need to get them done. You get the assignments in early.
No.
You don't have to ask questions, just, you can move. You don't have to ask questions to begin your work or assignment. You want to start, you drive the work, you get it done. And you will stitch the mosaic together to keep things moving. So that, remember, you can move. So these are our norths.
Or the North Star, the guiding.
We need all of these, by the way. None are better or worse. The balance is what we need. Our wests. You ask the hard questions. You live by inquiry. You challenge us all to identify the details. You don't start a project until you're clear about the details. You have to make the picture complete. You lead by inquiry and engage in all the thoughtful discourse. And you like to fill in all the details of that mosaic.
And your name is Alicia.
Cameron. We got a mover. We got a mover. You have the big picture.
Cameron deals with
You have the frame that needs to be filled in. You need to see the final product, but you'll work with the end in mind, driving towards the end. You like to work backwards, understanding by design. You won't get a project started until you're clear about the final product. And you know where the mosaic is going to be at the end. These are east. And then our souths.
You can be wherever you want to be.
Small group. This is all the emotional labor that everyone should be thanking you. Okay, you take the information and you slow us down and you make sure everyone's voice is in there and has been heard. You include everyone and make sure the human side of the decision is nurtured. You take care of us and bring up our effective domain. You make sure the emotional side of the work is a part of the work. And you, ooh, this is really good. You add the beauty to the mosaic.
Yeah.
You not only make sure everyone participates in the mosaic's creation, but you keep us all comfortable while creating it. And staff, if you want to move, I was mostly teasing. You can hand your sign off if I was wrong.
They're all the same.
Okay.
Where do you want to be?
I usually,
Come on, Addie.
I usually am like right between north and south.
You can't, you can't.
I know. I'm coming on over.
Let's go.
Okay, so what I want people to think about, and remember, this is really big picture and it's imperfect and it is some typecasting, which was a word I heard. But we're about to move to some decision making, right? And it's going to be hard stuff. And so one of the things to think about is, for example, as a North, it's really helpful for me when Elliot is like, hey, also, this is about real people, not just a decision, right? But can say things to me like, slow down, you're being too North. And then I can say things to Elliot that are like, I really want everyone's voice to be heard and we got to get moving, right? So thinking about how you're interacting with people in the room based on where they're standing
Because, for example, Wests can be super hard for me because they're like, I gotta know every detail before I decide. But if I know this is a person who's a little bit of a West in my head, I'm like, this is just their process. It's not about me. It's not about the decision. How can I meet them in the middle and say, here are a couple details. Have you thought through these to keep moving, right? So not perfect. We're not gonna like solve all the problems, but this gives you a little context of where we're headed in terms of how to engage folks in a different way. It's also another opportunity, like we saw this morning, to see things that are common and shared across all the different people in the room. And it's a whole new way to start to group people and think about them when you're feeling frustrated. All right? Okay, you can go back to your seats.
No, yeah.
We're all Tauruses now. We're all Tauruses now. But I don't wanna be that. I need to like perceive myself, but I don't wanna.
I'm not and that was the one, that was the sentence that like made it go, like, you wanna get people's feelings.
People around me are like,
But also.
Hard-headed, right. All right.
stubborn beast.
Thing everyone in Oregon says is like a very Oregon thing. Let's all roll up our sleeves. We're gonna get to the work. The moment you've been waiting for. All right, we're gonna go through this in a couple different ways. It can be tricky for those of you who don't spend part of your full-time job strategic planning to get what we're going for here. So I'm gonna cover it in a couple different ways, and now's a great time to ask questions because this is really what we're doing the rest of our time together. We have our goals. Overarching long-term aspirations. I've got them on the wall in this cube of 4. I'm going to cover them in just a second, but that way they're always there. Again, I'm like really a kinesthetic person, so I'm like, I want to look to them. I want to look to them. So in this cube of 4, our work in the next 2 days is strategies and action steps, right? So the steps necessary to move towards the goal, and then the tasks intended to accomplish the strategy. Right? So we're gonna talk a lot about those, and I'm gonna give you a really fun example. Next slide, please. All right, value screens, we already covered that. They're on the wall in like 700 places. The value screens, I think next, we're gonna go 2 slides because I did it in the wrong order. One more slide, this. The value screens, this is really visual for me. They cut across everything we're doing, right? That's how they work. Everything has the value screen that goes through it. They're not built into the triangle. They're on top of the triangle, that strategic planning triangle. Now go back and I'll do a better order next time. Ooh, one more. Here we go. Ooh, I'm dizzy and we're all in the room together. Okay, these are our goals, right? And here's how I'm thinking about them because I think that's going to help us as we move into the afternoon. Like I said, Elliot and I spent a lot of time, especially recently, with all the work that you all have already done. And we worked on these collectively as a group through facilitated exercises. This is what I'm thinking. Goal 1 is the magic, right? Goal 1 is none of us think the system we have right now is working very well. We want it to be totally and completely different. Okay? That's not a 3-inch step, right? That's the 3-mile step. If not the 30-mile step.
End goal.
It's an end goal. But we want to start building towards that now, right? We can't tomorrow be like, hey, CCOs, let's turn it all upside down and do it completely differently. That's not going to land well. It's not going to go anywhere.
We'll lose our jobs.
You're going to hit a wall.
You have jobs?
But we want to start the motion towards the better, totally different, more improved system. And we're going to break down the last thing we're going to do today because it's going to be the most fun. Those steps of how do we get to the future of what the system should be. Goals 2 and 3 right now are how do we fix problems in the current system, right? We're not going to transform it, but there are things we know that need to be working better. 2 is really about, access and integration for services and service provision. And 3 is really about the policy and the infrastructure of the system, right? So how do we improve the policy and infrastructure? And 2 is how do we improve the services and the service experience, right? Super important goals. these are like the 3 mile, not the 30-mile goal. We can start taking the 3 inches, the 3 steps easily in the next 4 years. And you're gonna see some cool examples of that you all came up with that I don't get to take any credit for. And then 4 is, there is a boatload of work that has to happen to support 1, 2, and 3 that's related to the system of care infrastructure itself. The staffing, the data dashboards, the relationships between the LSOCs and the statewide SOCAC, right? So how do, yes,
What
please.
does LSOC stand for?
Love that. So I just learned it on Friday. It is the local systems of care that feed into, in some ways, but room for improvement and growth, the work of this statewide system. So for 4, it's, we want a foundation to support goals 1, 2, and 3 that has staff and capacity to make it happen. 2 and 3 are, we want to do better with what we're already doing. And 1 is, we want to talk about how to overhaul the whole thing. Like, we want to go deep and have fun, right?
That's how I'm.
In my opinion, maybe it's just fun for me. So that's the goals that we've set. I think it's a really nice balance, right? We are going to get to start to frame out and move things towards a totally different way of doing things without ignoring the problems that exist right now and need to be tackled, and without pretending that Anna can work 24 hours a day,
Yes, she can.
365 days a year,
What do you mean?
right? So you guys have done a really good job, in my opinion, of setting those goals. We are gonna dive real deep into them in just a little bit. Next slide. Remember, I'll say it a million times, these values through everything, which is super cool. I've never facilitated a strategic plan like this with the value screens designed and screening through everything. And that came from you guys really pushing on me to think differently. So I really appreciate it. Now, we're gonna plan a birthday party because this is the real work. So here's our goal, right? We're gonna celebrate Elliot's birthday. The purple, this is how we're gonna start to learn, are our strategies. Right? There are lots of ways to celebrate Elliot's birthday. I want to be really honest about that. But we've picked 3 strategies, and by we, I mean I've picked 3 strategies because I know the things that I think are doable and are going to have a big impact. These are going to make Elliot feel really celebrated, loved, cared for, and they're things that I can do that are within my control, except for the one about Chapel Run, which you'll see. So we are going to host a party.
I think we
We're
think.
going to start a social media buzz. And we're gonna coordinate a donation drive.
I
Now
get
you
this.
can see how these funnel up, right? All 3 of these things drive us towards celebrating Elliot's birthday. All right, next step, it gets even more exciting. Dun, da, da, da. Here is the strategic plan for Elliot's birthday parties
I
or birthday
love
celebration.
this so much.
Me too.
This is how I do parties.
Really, I think Andrew gets some of the credit for this because he
Andrew!
really pushed me to think about how to
Andrew.
do something less serious because I'm always so serious. I was like, I'll use goal 4 as the example. It's just about staffing. Anyway, celebrate Elliot's birthday. You're gonna have 1 goal. We're gonna strive for 3 to 6 strategies. I'm gonna be really honest, going for 6 strategies is gonna stress you. You SOCAC staff.
Sure.
But that's what we're thinking about, again, because we're gonna start doing this with our real goals soon. So you're gonna have 3 strategies. The strategies funnel towards goal. Then you've got the action steps. This is the GSD portion of our planning and preparation. What are we actually doing to get there? There are 1,000 ways to host a birthday party. I could have 87 action steps in here, right? I've picked the ones that I think are gonna work, that are gonna move us that 3 inches forward. So I'm renting a roller rink. For those of you who know Elliot, that is a win. Roller skating, roller blading is a big favorite.
Let's go right now.
I'm gonna ask one of Elliot's sweeties, favorite restaurant right now. Where should we order from? I'm gonna have some separate steps. Somebody's gotta order that catering, and I'm gonna ask a roommate to pick up that food because I can't be everywhere at once. So I'm really thinking, how do I get this done? We're gonna send invites to Elliot's 50 Best Pals. I'll be there to answer questions. There will never be questions. Then we're gonna set up a Venmo so people can chip in if they want. They don't have to. And then I'm gonna get 50 pairs of matching hats because I think that would be fun at the roller rink, right? You can see those steps get me to birthday party. If I do all these things, we have a birthday party and they're doable, right? Like I didn't decide that I was gonna I don't know. I'm
Sway people. to
right. Or like get Beyonce to come sing.
But you
That
could
would be
try.
cool.
You could try.
That is foreshadowing.
Crazier things have happened.
So, creating a social media buzz, same idea. This strategy helps me celebrate Elliot's birthday. How do I actually do it in a way that's approachable? I'm gonna remind Elliot's 5 best friends via a DM, I now know what that word means, that it's their birthday. We're gonna post happy birthday on Elliot's Facebook page, because I know on Facebook, that means a lot of people are like, oh shoot, I should post it, their birthday, da, 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 da. I'm gonna @ Elliot in my Insta story with my favorite bestie photo, which will never happen, because if you know me, I hate photos.
I'll post it, she'll repost.
That's correct. And then this is the fun one. I'm gonna @ Chapel Roan with a clip of Elliot singing her songs to try and get her to say happy birthday. Who knows if it'll work, but I can try. It is doable. I didn't write in here, for example, Chapel Roan will wish Elliot happy birthday. I can't do that, right? So I picked something that I can do that is possible that drives towards the goal. Because either way, Elliot's gonna see themselves singing to Chapel Roan with Chapel Roan added and know that I was trying.
I know this is like supposed to be, you can get a cameo from Chapel Roan.
That came up when I was practicing.
I'm sorry.
That's in the budget, right?
Yep.
But that is actually like a really perfect example of the types of conversations that we're gonna be having really soon. I'm proposing as a action step, I @ Chapel Roan. Saphira's proposing, what if we do a cameo? And then we get to have that conversation of, okay, instead of, renting the roller rink because our budget is $250, which is way too cheap for Chapel Roan probably, but I'm making this up. How do we want to use it? And which strategy feels better, more doable, more important, and which will have a bigger impact, right? So that's exactly the perfect example. And which is in budget. Perfect example of how we're gonna be choosing these. Because again, there are a whole bunch of other ways I could get to a social media buzz. We're picking some that work and move us forward because that's what we need. That's what we know Elliot likes. And last one, really similar, coordinating a donation drive. I'm gonna create a GoFundMe page for Elliot's birthday for the national bailout. Gonna donate to the kickoff fundraiser to get it going myself, build that momentum. Woo! Post about it on social media, include a link in the birthday party invitation, and then bring a little QR to the code to the birthday so people can snap it, right? Really doable things. What I don't have on here is something like, Ensure. Wait till we get to Ensure. We're gonna talk a lot about Ensure, not the beverage. Ensure.
I was thinking like, what
Right?
are we talking about?
Ensure, like that, that people donate somewhere for Elliot's birthday. And that's a no, because what does that even mean? How am I ensuring people donate?
Ticketing, don't let them in unless they pay.
Exactly. So that's the perfect,
That's how you
again,
turn it into.
exactly. In your word, as we go through this exercises, I want to ensure the question you're asking yourself is, what is the how? Because ensure doesn't tell me. The how for me here is I'm creating the page. I'm bringing the link. I'm getting the action moving. We can't just ensure. If you're ensuring because you want more accountability, are you doing some kind of check-in? So am I then checking in with 5 people and saying, hey, did you donate? Did that happen? We had a goal of $50. Did we get there?
Also, Addie couldn't make this without knowing me pretty well, right? The strategic plan that we're already down the path with is this conversation, these goals have come from all these thousands of pages of documents, conversations, meetings. So you all are in the position to create the strategic plan because you know the system and all things, but you also know it well how to create this if we listen to everyone's voices in the system. So that's a key feature of like, yeah, I trust Addie to do this because Addie does actually have an expertise in this, right? So
I have an expertise in Elliot.
you did great.
This did actually create a social media buzz because Elliot posted it on their Insta.
I was just surprised to learn Addie's gonna be in Wyoming in September.
Great. All right, next slide. Any questions on this? Thoughts? Yes, please.
We are all experts, not on Elliot though. We are experts in our own little like sliver
Yes,
of what we're
yes.
doing. And I'm just like, my strategic plan and what I would want is gonna be different than maybe what somebody else's is. And I know that we're gonna be working through that, but I think it's just, I guess that's my thought right now.
Yeah.
is how are we gonna do this? Where
Well, I
everybody's got
think-
their own vision, their own views, and we're gonna try to do that in a 2-day span.
And this is so much bigger, right?
Yeah.
that I think it makes sense that we need everyone with separate expertise in the same room to create it. Mine is a super digestible, small person task. This is why we need all of you in the room and all that input, because it's so big. And why there's pieces and parts, and even Addie's piece earlier of, I'm gonna get some of what I want, and I'm gonna have to give up some of what I want. Not forever, but to get us on the road, so.
And part of what we're gonna do, which we sort of level set at the beginning, to use one of my like favorite facilitator words, is we're gonna be trying some different decision-making tools, right? It's not gonna be every micro decision is a consensus. It is gonna be a document that we get to consensus on. And so that's where we're all gonna have to stretch our muscles, maybe feel a little uncomfortable, maybe do things we haven't done before to try to get there. And hopefully, and we'll see, we have lunch plans, so if it bombs, I can totally recreate a new activity. You'll see that we've got some stuff to help us work through that. And all that pre-work you all did, I've already baked in. So we've already got a big, huge jump start, and we're gonna talk through that in a second.
So when we think about strategic planning, the words are important in the sense of action oriented, clear, measurable. We were just talking about, right? You'll see this list is also right there forever on the blue. Blue as in good, red as in bad. And so and that's not a political meaning.
Hell yeah.
These words.
Blue is just a cool color.
These words helps, it also smells good, it's a Fenty marker, so there's that. These words help set specific, achievable, and trackable goals. We have these meanings here to help you understand why might we use these words and not the others. Obviously, I haven't written all that out, but for example, implement implies action and follow through. Develop suggests creation or advancement of something. Launch clearly indicates a start or rollout. So these terms are going to help us stay action oriented and actually be able to measure and do the thing. So that's some of these words: launch, build, strengthen, increase or decrease, support, advance, establish, facilitate, promote, coordinate, expand, create, train or educate, measure, evaluate, align, and engage or prioritize. We even had the example earlier of, I think you had added an addition to an ensure that made it more possible, right? But still, we want to stick to these types of words. And this is not an exhaustive list, but this is to help you get on the road.
A good example of that is like develop a curriculum to ensure folks are trained on. That's okay, because what you're doing is developing the curriculum. It actions the ensure. There's a thing we're doing to get to that piece. Sort of
We're
like-
not
like-
borrowing the use of the word ensure forever, just
for today.
And but. You use but where you have to use but, otherwise you use and, because it's just makes people feel better.
words to avoid, again, in the strategic plan sort of thinking. These are vague, unmeasurable, or passive. Sometimes I think they end up with these words because we're like, yeah, that sounds great. We all did a strat plan, let's go, right? But then it doesn't actually happen. So ensure, it can overpromise control and not always actionable. Promote awareness, it's vague, without action or a target audience, and how am I gonna measure this? Empower, it sounds good, but often is underdefined and unmeasurable. Foster is passive and open-ended without any specifics. Support equity, sounds great, right? But unclear unless paired with how it's going to support that. Encourage, lacks accountability or clarity on the method. Address is vague and it doesn't say how. Strive implies effort, but not actions or results. Improve is broad unless it includes the how and the what the improvement is. So this is why we just wanted to keep that in mind as we move into this, really getting into the strategic plan, thinking about why we're using the language we're using. At the same time, as Addie said before we went on break, we don't want you to get so lost in language that we're wordsmithing to the death of us, right? We will figure that out too, but we want to be action-oriented, measurable, achieve. Does that make sense for everybody? Any questions about that? Okay.
We're finding out about lunch, don't worry.
Oh,
Okay,
wait, what time is it? Oh,
so time flies when you're having fun.
I miss being in school.
So this is goal 4. The one facilitator change we're making for today, which shouldn't feel like a big deal, but we're gonna work backwards. We're gonna 4, 3, 2, 1 instead of 1, 2, 3, 4, because I thought it'd be more fun to end on transforming the system than how do we get capacity for staff, which is also very funny, and don't worry, I'm excited about it. So.
Probably like 10 to 20.
10 to 20, okay, great. I have a sense of what we'll do. So here is how I'm gonna talk to you about how we're gonna run things after lunch, and then we'll break for lunch, then we'll come back and start running things. So this is the goal. We know this goal. This looks familiar. We're excited about it. Now, your question to me is, the purple is strategies, right? Remember, goal, strategies, action steps, goal, strategies, action steps. Addie, where did those strategies come from? Why, let me tell you. Yeah. I reviewed all of the documents. And then
You guys would be friends.
and I took them and I looked at all of the recommendations that came out of them. So all of the action, all of the push. Now, I'm gonna tell you right now, I'm not perfect. And that's what today is about. So if I missed something, you're probably right. And let's just get it added, right? Like, it's super fine to be like, ooh, we talked about this really important thing and it's not in here. I'm happy to apologize for that. I was managing a lot. Elliot was managing a lot. It certainly wasn't on purpose. And that's what today is about, getting them in. So if I miss something, let's focus on getting it in where it needs to go. Because I want everyone to feel heard and every voice to feel heard. And I don't want to lose all of the good work that was done. And that's just collating a lot. You guys have the biggest strategic plan possibly in the state in some ways because of the intersection with so many other systems. So we're going to do our best. And I did my best, and I'm human and I'm failable and I'm happy to take accountability and apologize. But the place these strategies came from is I took all the action steps, one step lower, and I looked through where are the themes, right? How do these bundle? What are the buckets that they fall into? And then once I found those themes and those buckets, I drafted what looks like an umbrella, a comprehensive strategy that we're moving towards. These are not set in stone either, right? Like, these are just me saying, let's get some stuff on the page, just like we did with mission and vision, so we can start to have the conversation, and we're going to start to have the conversation this afternoon. So I have created strategies that capture all of the action steps. I have also captured as many of the action steps as possible. So I'm going to walk back here and explain to you what we're looking at on the board, because these are our tools for this afternoon. Right? This is how the sophisticated, super sexy strategic planning work actually gets done. Woo! Not pink sticky notes.
Yeah.
So if you, well, the purple is hard to read, so I apologize, but
I just texting Dan, I didn't want to interrupt you.
purple,
Yeah.
number 1 up there matches goal 4. Like, there's no secrets here. Goal 4, you see G4, goal 4, purple number 1. This is strategy 1. These are the action steps I collected from all of the everything that you all did that drives us towards this strategy. Same thing. Goal 2, all of the action steps, or goal 4, strategy 2. Man, I was really trying to be clear and then I messed it up right away. Goal 4, strategy 2. It's lovely to be reminded how human we are. Is going to have then all of the action steps that match. I bet you're getting the pattern. Goal 4, strategy 3. All the action steps I've been given. Goal 4, strategy 4, goal 4, strategy 5. As you can see down here in the wings are the other goals. It's going to look just like this, so we're all familiar with what's happening. This afternoon, we are going to have a chance to play with these. So what will happen is these will be on the tables. And we will do what's sometimes referred to as like a world cafe, which just means you get to move around and meet with different people. You're going to get a small amount of time to mess with every piece of the strategic plan. So you will have had input on each piece today. Then we get tomorrow and it gets harder because then we're making some choices about where does my expertise best help us move forward between the 4 goals. So just start to think about that today. Today I get a little bit of everything. Tomorrow I'm going to have to use my expertise strategically. And then the next time we're all doing that 1,000-foot view. So you know what's coming. We are going to have some dots and we are going to have some markers at each table. Groups will go to the table, and as a group, there are little dots that have hands on them. And there are like red, yellow, green, blue dots, like the standard dots. If you think one of the action steps should be cut, which is perfectly acceptable, right? You can think as a group it should be cut because it's not that important. You can think it should be cut because it's not right now. You can think it should be cut because it's too big and we can't do everything. You can think it should be cut because it's outside the scope. You can think it should be cut because you're just like, I don't like that idea. But as a group, and there will be instructions that are on the board and we'll go over this again. You will put one of the boring dots. That means cut. But that way the next group will be able to see the step because they might disagree. If you put one of the handprint, that says keep. Then the other thing you'll do in your 10 or 12 minutes with each sign is there will be a pack of sticky notes and you will say, what's missing, right? What do we need to create policies and procedures that build capacity and promote sustainable membership and staff that's not on here? Now, here's the tough thing. We are not, just like the birthday party example, going to be able to do every action step that completely checks this goal, right? At the end of 4 years, we're gonna have made progress on this goal. We're gonna have taken steps on this goal, but it's very likely some of these goals will remain. And each year, you'll reassess, do we need different action steps to keep moving us? The only reason I say that is, if you think in your 12 minutes, you're gonna be able to perfectly fill out every single thing that needs to be done to get here, that's where we're gonna get caught up and hung up and stuck. So you're thinking 2 things. What's the impact and what's the doability? And what we're really striving for is high impact and doable. Now we can have a couple things in the plan that are what I would call reaches. Big impact, really hard to do. I would argue your goal 1 is gonna capture a lot of those big impact, really hard to do, because that's the systems transformation. So if we have a whole plan where everything is really hard to do, we're not gonna get anything done. So some really good examples of things that are doable. It's like I picked this magically because we just talked about it today. Host conversations with SOCAC to reconsider decision-making processes, right? We're not saying it has to change, but we are saying host combos. That's a verb. We can do that. We're gonna dig into how did it feel at the strategic planning retreat to use sticky dots? How did it feel to have level checks, right? And the impact of that could be pretty big if you think about it, because one of the things that's gotten held up is consensus making is really, really important and sometimes leads to walls. I'm not making the decision for SOCAC, just to be really clear about that or not. I'm saying one of the things we may want to do is start that process. Now, you might disagree with me and put your red dot right there. You might be like, oh, I've been waiting for someone to say it out loud, and put your hand raised dot. You might think to yourself, I don't want to host conversations. I want to, drum roll please for the joke, take a vote on that. You can write a different sticky note and put it on top if you want to suggest something that's a little bit different action. Or you might say, I don't really care, fine, keep it, don't keep it. What I really want us to be doing to create policies and procedures is X, I'm gonna write a new sticky note. I'm gonna pause for questions because a lot of instructions. Yes, Emily.
So we've got red for no, and for keep, and then what was the pause? Yellow?
Oh, there's no pause because these are either in the plan or they're out of the plan. If you want a different version of it, you can write a sticky note that shares it in a different way.
So then my follow-up question is, this is a 3 to 5 year plan, right?
Yep.
So what if we're like, that's really awesome, but I would rather prioritize this thing and this be in our next 3 to 5 year plan?
I don't want you to, in my mind, I'm like, I would walk it over to the parking lot.
Okay.
So why don't we just like write a P on it, and that will signal to Elliot and I, parking lot, that there's a vote to parking lot it. We don't want to lose it, but we don't want to do it right now. Does that sound okay to folks? And in the lunch break, I'll change the slide to reflect that. Yes, Holly.
I'm curious on this. So here's our goal and here are the 5 strategies. Are all the strategies weighted the same in achieving the goal? And is there any sequencing?
Great. The way that this plan has been designed, these don't have sequencing. You will see tiny stickies on bigger stickies. Those are action steps that have sequencing or multiple elements to them. That's how I've denoted that. So for example, if I can think of a good one, to create orientation for members. The way that might look in the final plan is draft orientation for members, roll out orientation or pilot orientation for members, make adjustments based on the pilot, like these are capturing the essence, but we may have some sequential stuff that helps us take those action steps. Right now, none of the strategies. The other thing that you can do or suggest when you're at the table is there will be the big yellow sticky notes. You can rewrite the strategy, or you can put a red dot next to the strategy. You can be like, we don't need any of this bucket of work. Or you can say, I would phrase it differently. Do not get lost in the wordsmithing today, team. We're gonna come back and wordsmith, I promise you. But if it's like, strengthen statewide SOCAC membership and member relations, and in your head, you're like, we don't need to stay statewide, and SOCAC should be SOC. I'm making this up. Feel free to tell us what it is. Or if you don't like the word strengthen and you want to give me a different verb that better captures, that's fine. Remember, you're only gonna have 10 minutes though at each space. Okay? Yes, Alicia.
Okay, so now that you had mentioned the whole SOCAC versus SOC thing.
Yes.
Okay, so for those of us like myself who've been like doing SOC work
Yes.
since like 2016.
For sure.
SOC refers to the local system of care. SOCAC is specifically SOCAC.
Yes.
These strategies are this goal, and the strategies underneath them were only looking at SOCAC, right?
Great question. So this goal says SOCs on purpose. The staff and I hashed this out, and Anna, you jump in. This is about
The whole system
role.
of care infrastructure, including the locals, because they are our most key implementation
So-
partners.
Yep, you'll see on here for a
For how the
really
work
good
actually happens on
example.
the ground,
It's the
right?
strategic
Okay.
plan for the SOCAC for the SOC.
And this is where they really fit in. It's not the only place, right? So a lot of different things to be thinking about. Remember, you might be like, oh man, this is missing something really important. Yeah, 3 other goals we're getting through. And this, frankly, I don't want to say it's the most boring, but this is the most like technical goal because it's about the staffing and capacity. So when you look at this, you might be thinking, wow, this really isn't enough on youth and family engagement. It could be that we do need to add it here. It could also be, remember, 3 of our other goals dive deep into that. Now, that should be a part of all of the work. And it's okay to remember, if you look at our 4 goals, this is about staff and staff capacity, et cetera. Again, doesn't mean it shouldn't be here, but we're gonna have to constantly doing the zoom in, zoom out, zoom in, zoom out on this. Anna.
Just a recommendation, if you're feeling like that, as we're working through any one of these 4 goals, write it, stick it in the parking lot. And if you end up going back over and finding your parking lot sticky later and sticking it on that big pad of paper, like just, if that's how your brain works, feel free to sort of use that strategy to kind of make sure that you're not losing track of the like, I need to make sure this is on somewhere. Maybe it doesn't fit on these 4.
Love that. Other thoughts and questions about how we're gonna roll through the afternoon? Is lunch here?
I saw the van.
It's okay if it's not. I'm just trying to decide. Do we bring?
That candy?
I don't know.
Lunch is here, let me go pull like lids
I only
off
did
this
that
thing.
once as a
So
kid.
what I'm gonna suggest people do,
It
and we
almost
talked a
worked
lot
on
about
me.
this in the pre-planning. So hear me out, and if you can't live with this, you can come find me. This goal, because it is so technical, this plan on the backboard is a little bit more baked. It's a little bit more ready. We have different goals that we're spending the afternoon on. You will get a chance to get your hands on this tomorrow in depth, because tomorrow we validate. Tomorrow we come back. So what I would ask for folks to do, as timing allows, because we got a lot to get done, is walk by these on your way to lunch or on your way back from lunch or in the middle of lunch as a break, and take a look so you see the kinds of things we're thinking, doing, and feeling on these goals, and get familiar with the method we're gonna use on goals 3, 2, and 1. Okay? So take a peek at this, get some lunch. We're gonna come back at,
Is that right? 30 minutes?
yeah, 12:30 will be fine. At 12:30 with lunch, but digest this and start to think, and if we wanna move to the instruction page, that might be helpful. Next. Oh, this is the wrong version, I think. There it is. All right, and we'll add a dot about the parking lot P. Over lunch.
There was a question of if
Oh.
we got the goals document.
The goals document, it was part of the packet that went out with the strategic planning prep meeting, so it's in that PowerPoint. So we'll break for lunch.
right? Like
Right.
our approach.
Go eat.
Oh, shit.
Me when I get my hand on the.
Don't all charge at once.
I got
Too excited, it's everywhere.
Processing a lot.
Marinating. Oh, I just have silly putty. Getting it everywhere.
I know, that's not a bad idea. Dude, I'm not trying to get rid of you.
Frustrated by having to go in.
Those words are very difficult.
And he's like one of the most inspiring leaders.
Yeah.
Oh, yes, he's going now.
That aren't getting those opportunities, but would like to use those gently fall into that category.
Dang, she won't listen.
And so it's like, not necessarily like.
She's not listening to your voice right now.
Okay, we are gonna do this thing. And it's gonna be fun because I said so. That always works, right? So we've got 3 tables. We're gonna go to goal 3, please, Elliot.
It's changed.
Boom, goal 3, and we changed it from purple, so it's more visible to those. All right. We've got goal 1 and goal 3, sorry, strategy 1 right here. Engage with youth and families.
I messed up.
You've been talking.
Oh, yeah, okay, we're good. Engage with youth and families differently, which is a synopsis of what you're seeing on the screen, because that's a lot to write on a sticky note, right? So that's here. Goal 2 is, or gosh, shouldn't have eaten lunch. Whoever told me to, now all my.
Sorry.
Sorry, I did that to you.
Perform culturally and linguistically appropriate goals, policies, and accountability throughout the system. And 3, strategy 3, I got it right. Improve integration and coordination and efficient data sharing across the system. We are going to break into 3 groups. You are going to get to touch all of these, so you don't need to like run to the one you're most excited about. You're going to get to rotate through all of them. And we're going to go back a slide because we're doing it for the first time so that you can see the instructions again. Dun, da, da, da. Any sticky colored dot is fine. It doesn't have to be red because they look very different than the hand dots. And I'm worried I don't have enough red because Home Depot sent me these teeny tiny dots. So cut, keep, a P for parking lot. There is a bevy. There are many markers all over, and you've got your own lined sticky notepads to add something new. All right, we're gonna get 13 minutes. You're gonna work on mini consensus, right? The little group that forms around this is gonna have to decide together, sticky dot or hand dot. And then I'm gonna move you to the next one. And you'll get the same thing that I've been doing, halfway warning, 2-minute warning, so that you can make sure that you get some time with it. Sound good? All right. Let's go ahead then and try and be as evenly split as possible. So it's gonna be about 10 people at each of these 3 tables. These tables were only chosen because they had the most empty room for me to fit a big piece of paper. So please disperse. Swim, fishies, swim.
We need 5 more people.
Folks might say.
Join us.
Get that a lot?
Join us at the table.
Yep.
Dude, I love it.
Oh, wait. Yeah.
Say 5.
I know, right?
Around.
You don't take 5, right?
Falling over my pants.
What? It's how I say 4.
Yeah, goal 3 is. How's one more?
Yeah.
You're got 3 spots. Take a minute to digest. 3 spots.
4, 5, 6, 7.
Hold
So this is strategy 2 of goal 3, and goal 3 is the infrastructure.
Actually, that's a good idea.
Brownie was very good.
Mission actually is, it's not exempt from all of the.
A huge part that I see in the community is that
I actually already took yours.
don't
She wants us to.
that out in the community. And so then when community is asked to come to listening sessions, that's where the data is dumped. And it's not as much listening
For the
sessions.
Understanding the data.
Yeah, and so it's like, and the rationale makes sense. It's like, well, we want to hear what you have to say, but we want to make sure there's context. So here's all the data.
ones that are on there.
Things that we have actually can add.
Absolutely.
Okay, cool.
It says where the data is, not just under document, but where it's under, access to the data.
You have sticky notes though?
There should be one pack when you do a big sticky.
Get out there.
I think that's like published.
Way.
You actually are.
Literally.
So it's like on the website, and so I think a lot of the systems are like, well, it's there. I think a lot of folks are like, I didn't even know.
It's like, oh yeah, we took, we're like, oh, we took an internal survey like 3 years ago. Where's that?
Like what?
Does that mean though, like going to where they are, like going out to?
Wait, I like that. Going down, like, where did you gather?
Meet them where they are
Where
as
did you
far
gather
as
everything?
what their emotional needs are and things like that.
What are some of the
Oh,
other?
okay.
Okay, so ours is improved integration and coordination and efficient data sharing.
Would it be appropriate to have like
First,
you know,
conduct an
to
ongoing
say,
assessment
or
of
have us,
CLAS
you know,
related
underneath that it
activities.
says-
Remember what that stands for.
Class culture and
Thank you. We collected, maintain reliable class demographic data to
And I
monitor
think they're, not
impact,
that you have to,
provide
because we pull it, but they're on the big sticky notes if that
provide-
feels easier. No, one of my.
something, technical assistance. Yeah, funding, legislative documentation.
Another sticky note.
The bureaucracy dance, you know, that's.
I think those.
I think we put something in there. In terms of that, what's written on the yellow thing versus the.
Whale and
That's here. It's the same goal, and it makes more sense the way it's written there.
Integrating
Names.
Right. And they're not, none of them are talking to each other.
Yeah.
And so there's.
Well.
Yeah. So there's, you know, like, I would just say coordinate.
To
get to the strategy
Oh.
system.
Okay, right.
Those could actually be independent of the family.
I want to say existing projects. So like
Example.
there's the OKID thing that's
OIA,
happening
performance,
at the Center
right,
for
the-
Space Policy. There's all kinds of data, they do these analyses.
Yeah.
And then we learned that we're
Out of
in
curiosity,
our chief information officer state is trying to integrate data. But nobody's
That
doing
too.
it.
There's a warehouse and there's like all these other.
Jet lag.
We just have one library of data. Why is
That the things that are happening
Or data
are
dashboard.
happening over at OIA.
Yeah, like I don't understand why everyone has
Those wouldn't
different
necessarily
data.
be
There
part
should
of
just
the
be
family
one.
engagement plan, because like, that's not something that like families.
Yeah, it is in here.
I'm
not doing that, Judith. I already did the last one.
But
This is your
Oregon
job.
has a really strong, it could, but like,
it's not- I
there
mean,
are
it's
some
not-
family engagement.
No,
It's just that word.
Just the word,
Just the word.
because of what came
And I don't
out of
totally
the
get
OIA
it.
situation.
Like
I would
by.
say
Does that
a
make
lot of
sense?
what I would
Is
notice.
this like that one, but also
That-
is that for this?
There's so many places that either A, don't track certain kind of data, B,
For me,
honestly,
feels
able to
like
give that information out to the
that
public.
facilitate.
Or C, haven't done an actual analysis of the data.
Needed on.
Are we creating a guide that would
Why?
use?
We get a lot of like, what was it? It was like, we don't have enough data to do, and it's like, how?
It's not data analysis.
I love that. Let's
Data
like
collecting.
stick a sticky note on top that clarifies that so we don't lose that great idea. Does that make sense? Which,
Is that real?
or, you know, like, they're keeping it real. You can just make me a note that says both for local and larger. If that's what feels good.
The thing that I hear everyone saying that I definitely resonate with, is like before we share, we need to make sure we're actually all.
Cause I think I understood what you were saying, that you felt like that was kind of incorporated with the two, and you were trying to see each other when you thought each other, like, the family.
And we have put forth that.
Engagement plan and the
Like a
youth.
Like one thing that we found a lot is like.
Base.
I feel like we want to go farther, it's like, okay, we.
18, so when you're trying to.
Yeah, what's the next step?
Or just.
But also it sounds like identify
It's been
objectives.
done.
No.
I like this,
It's like McKinney Vento versus the other community definition.
There's necessarily a plan.
It's like, I'm
Visiting that over there.
maybe it's something I just don't understand because I'm not on the data side, but I'm like, I don't.
It's one of those things where as issues come up.
Similar
Data class, well, you don't wanna do it.
Or some could.
I think it's
Was
also
it just
like,
too much?
there's different requirements and usually
Facilitate those.
administrative or billing or like whatever. So they're set up in a way that supports.
With
Or something, there's a whole redhead conference in the world.
Right, which is
Sort of analysis.
Once again, that's too.
It's like, here's our data dashboard, here's the providers, and it's all the same data, but it's specifically like what you're authorized for.
If you work anywhere that requires reporting, typically you have your internal bodies.
OARs or.
I wouldn't prevent.
So I was like, what is the red hat?
Give me 2 years of full-time.
Administrative.
I could not do that myself.
Too much.
There are rules that like agencies have to, I mean, that's just one.
Yeah, like, yeah. keep-
Whether this is its own thing or whether this falls under
Add
the
on to.
family engagement plan, does that include a regular facility-based or community-based engagement, or are these separate goals in one
On the clinical side, and we're just having that too, it's like when together, whether there's so much forced to get one focus to the part, which, yeah, is something a barrier, but it's like.
So you have engagement
As we go, which I think also would be helpful.
And also just communicate
That's
that.
very-
Hey, the reason that we're doing all this is so that we can help other people with the situation versus like, okay, they're giving me all this and then we'll get to you in a year. Like, get to like,
Approximately 3 to 5 years.
relationship with community-based organizations.
So do we feel like these are all
Facilitating those conversations. And then it might eventually come back to the larger SOCAC, but that's why I feel that's.
Anybody have any
Does anyone have any,
strong feelings against?
does anyone want to step aside?
Yeah, we haven't talked about that.
Yeah.
On the freaking mountain.
Yeah, we can definitely clarify that.
Oh, I
or
guess
we
that
can-
this is kind of.
That yet is what I'm saying,
Like,
yeah.
pay for
I think it's
by
fine.
funding, training, and legislative support.
At the very least, if they don't wanna hire like a specialist, they can hire someone to help them build a system.
People don't agree, that's okay too.
No.
Yeah.
I'm-
How dare you?
Make a note. Is it like camera?
I've seen it.
At least have like a passing.
I think like my concern there is, how is this gonna be funded?
Times have a staff of one.
SOCAC.
So if they're
Is
only
more.
responsible for the local system.
And then if we have anything that's missing.
How are they supposed to also act as a youth
We're,
specialist?
get these.
So what's the solution to that, right? That's a barrier. Is it increased capacity of local systems of care so that youth and family engagement can be prioritized? Because I'm not sure we can use systems of care without that engagement. If the barrier is a resource, this plan should really be thinking about that solution.
State enterprise, this feels like an action that
Figure out.
come out of.
And more family
a
rep.
system that's.
So that might be something we want to add on here.
So the increased capacity for local.
But how many people
It's in scope.
And maybe it sounds like to sort of specifically.
She had it, she put in the different menus and she
I don't
was
want to
like.
simplify it, but have a joy Lee.
Providing access.
I did, yeah.
Right, just like that. Family rep or family rep?
Sure.
Oh.
Coordinating is a red though.
No, it's not the,
I mean, I feel like, yeah.
Should be.
I don't know.
Minimum FTE for local system.
I understand that, and I also feel like it's not too succinct. I feel like there's still,
That's happening.
I don't know, I feel like it's still in scope, because it's just broad enough, like we're not going and collecting the data ourselves. We're overseeing that piece.
Can't we as
Still stuck in the mix.
Then even if it was something that we undertook, it would be to support systems, so it still wouldn't be a single system.
What's the now active things we wanted? Yeah, so I don't, off the top of my head, when you say, what are the?
Done.
So it's a yes and no, so the
to, and I can only speak for the family, for the family engagement.
To see an early
That's where we were, or where I was. But, so the family engagement plan, we have the family engagement plan.
So is there something about
Right?
The data that
One of the pieces within the family engagement plan does say
And so then like,
continuum
look at the
facilitation
data,
of
like, oh, who's
community
being left behind, like, how do you,
based
you know, capture who's
engagement
being
with
left behind,
families.
and then who's being left behind from
So,
the data of who's
in a
being
way,
left behind, you
yes,
know? So
that
it's like,
could
if they're
fall
truly
under
being left
that.
behind, we might not even like consider
However,
them and gender.
One of the things that I just
Of course,
mentioned
so.
is
It's like
that
if it's an issue of like who can collect what, then not necessarily, it's like, hey, here's the
At the
things that
same
need to
time,
be,
if
that
we
need to be
have
done. What do we
something
think?
come
We
up
all agree
like
that starts to get collected
the OIA
versus we just won't
situation.
collect it because
so
we
here's
shouldn't,
Not
can't, we're not going to.
necessarily
It's
feel
also like
specifically
how
called
you
out
collect
in the family engagement plan.
Got it.
So if there is something that comes up.
Every color of a handle.
Then.
Yeah.
Just put all the brown hand.
Plan wouldn't actually say,
I don't
hey,
think-
go into the
I
community
don't think
and
they
reach out to
can,
family members.
right? Like, I
And
feel
get their
like,
input about
especially if they're receiving federal funding, you can't really
what their
include like
experience has been.
gender data on
Is it
there.
fair to say,
Federal funding.
is it fair to make this sticky note a little different and say something like, through federal
Yeah, if we
funds?
Through federal
all.
funds.
Act as a resource
Is it?
to state agencies and providers.
Well, it depends on the funding
community
source
engagement.
actually.
You might
because
not want to play that
Some of
role.
them,
If that's sort of what you're
if
suggesting.
your organization,
Or
from what I
you could
know,
even
if
just
your
consider it,
organization, like,
consider being a resource, because your answer could be like, no, forget that, we don't want to
like
help.
some groups will
So
come
I'm
with
gonna
individual
say,
funding, and some groups you just can't use that funding for that.
This is a reality.
All of our programs, we engage 129
Yeah.
And what they, one of the things that they accurately said a lot was a
Well, that's why a lot of
resource
like the
because they don't
workshopping right now is around how can we hide this work inside
Yeah,
the work.
right,
we're
that's
doing.
the key.
I think a part of that
This
is
can
just
start
the partners, because it's like
This one is culturally.
county.
The only reason that
I'm thinking about like suicide.
Sort of parking lot, but that is your
data,
way to
when
see
it
that
comes
come
down
up.
to the counties
Tax
collecting different
strategy
data
come
than
up
like
later,
ODE
but that doesn't mean
does,
it
than
can't land
OHA
on here
does.
too. So maybe
And then
instead of having this sort of outreach, it's that resource guide or that resource portal where
way, but
pick
they're
your
not
favorite word of the
connecting
day.
with each other.
Explain.
We could be the ones to
Yeah,
bring
this say
folks
gas,
together
yeah,
and then
definitely.
de-identify.
That's a little bit different than sort of like
Also, like,
having.
Yeah. In rewriting this, it's like, I feel like we're talking, maybe I'm just misunderstanding it, but we're talking a lot about like.
And I think these
Feeling to
should
me
be
like we're
It's
not
like talking
coalescing.
about integrating, coordinating.
So this should get a
Yeah,
dot for
efficient,
no.
you know,
It
not
may be that it
necessarily,
needs to be a different
SoCal
sticky note.
being
Is
on the
that what I'm
collection side,
feeling
more the, like,
as I take the temperature?
Yeah.
I'm wondering what you want to get from that. Do you want to get youth and family voice in the SoCal?
Well, just more so
I think the
like,
question is, what would you all get?
partnering with all the different agencies and
You're the
community
ones that
organizations and
offered
county
this up as a
groups
tool,
to
right?
be able to coordinate the data, so to share.
I guess I'm asking you
that
as
which
a
might be
representative
missing.
of.
So that might be,
Incorporating
so that might be
it.
implementable.
You're not mandating.
We're
I think you're.
That's very solution.
Okay.
If
You're
like mandating.
This is our,
All throughout.
not like
Statistic or
the system
information.
cares and then you
different
guys
ways,
over
and
here,
then it
like
becomes
it's our.
inaccurate when you try and like.
So what,
combine those two
we
data
had
sources.
conversations
way are you
in
thinking?
prior
Responsive
times.
services and
Thought behind
You're talking
it.
about like,
That's
like maybe one person on their forum, they have like Black, Jamaican, African American, and then versus another one that just has.
Who haven't been there.
I see.
And then elevate those folks
in
helping.
Yes, and that's different than
Different than
family
this.
engagement and different than the youth engagement.
Yeah, with one form you have the option.
Community engagement. Well, now I feel like it has to stay. Now you've convinced me. Hand sticker.
And that's what, yeah.
Well, if someone needs to multiple
Yeah,
boxes,
give us
say,
all the
if someone chose to actually like
I know, but that's,
the
but
family
some.
engagement thing,
some-
then
Someone would still have to clean.
it'll be a little bit
But
more
that's,
clear
but that's also the thing
in
is like,
terms
do
of
all
why
people go
that
into
is
the
different
same-
from this.
Yes.
The
Yeah.
idea that can still have a standardized.
So they all go
or
into,
it-
yeah, so
so
like,
everyone's reporting
actually,
back the
so in
same.
some
Depending on what you're looking
Systems are
at.
so-
That's the note I would.
Depending on what you're looking at, sometimes
Yeah.
it's only important that they're of mixed race,
No,
right?
because we already,
Oh,
this
mixed
is
sort of an
what we
existing-
did. Yeah, that's what we did, over the last few.
Who are we serving? If
Yeah,
it was
so
in-
we- why it's important for these.
2 questions.
Policy changes to be made.
Real quick.
Maybe at town halls or-
But you're still individualized
statewide
campaigns for specific
Counties,
communities.
yeah.
You have to talk about it different in our community. And
Wherever
we
it's
don't
happening,
think
yeah.
about like.
Locally, regionally, we want that.
I love that, and that's
That's why.
I think that what you made me think
And then
about
I think
was,
language and.
I wonder
I
if
would
it
love
might
if
be
your
helpful
motivation, not to be like,
really
really
focusing on
talk
like
about great
getting
creative
everybody on the
says
same page.
should inform.
Social media's
training us.
But what
Because I think
about
that's
ways
where
that
it's
so
tied
that
together.
can help
Yeah, makes sense.
system partners sense make the data together?
No, it's
Minutes
actually
without me.
quite
Helpful. Behind, like,
How we doing?
how do we look at
Thank you.
data
And I
from
sure hope,
ODHS, ODE, and OHA for kids who are in all of those systems
I'm giving the
together, and what
2-minute
sense do we make
warning.
of it, and how does that shape system change?
Does this one need to be changed?
Regardless of how it was collected.
I love
I
this.
think we
because
kind of
this
talked
is
around
a fully
Yeah.
system
So
of
doability.
But also like, I don't know, I'd be interested
And
from
this one,
Cody's perspective, on
engaged.
just like our data guy, cause it is really hard.
Engaged families
You
and
are like trying to
communities with
coagulate different
multilingual
data sources and they're collected
social
differently.
media
and
content
like
and.
impossible or just inaccurate, you
Yeah,
know,
but
so
we're
like,
not talking
I
about
understand what you're saying.
analyzing. That's what I'm saying is like, let's leave it.
I love you.
The official high five all the way across the table. Ugh.
And we have that requires school districts.
Clear black and white.
Health survey and the student educational equity
Sure.
adoption survey.
That is
Zero expert.
I am north, I'm making the decision. That is just
Make it
for you all.
Executive.
I love it.
Survey, elevating equity survey. So we're working together.
We just got a
Say, okay, instead
legislative
of
session.
like.
All right, last 30 seconds.
ODE talking about this.
Remember, you'll get to revisit tomorrow also.
Anyone who goes out from here.
This, oh, that was a
talk
keep, I'm
about
sorry.
all three of those
And,
together in a way that districts can have
think so.
one
Because
thought
the
process
intent
for driving their policy.
You can do all this, but then when you change, have them all like sit together and figure it out.
That I think is.
Yeah, okay, well, there you go. Yeah.
All right, ding, 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 ding. So we're just gonna rotate.
Like how I view it.
This table is gonna move over here. This table here, and you guys are gonna cut all the way across if that's okay.
How about the policy implementation?
Welcome down to standardized.
For the data.
So wouldn't that be,
Very like
wouldn't that be co-create?
frank.
Do we have
I've
right?
lost any filter that I have.
We're rotating clockwise.
Standardized data.
So this table to this table, this table all the way over.
Yeah, I think, yes.
This table to
My little.
I was thinking about that.
Reading more of
That's
the
like,
policy.
The main thing we could do all of this.
Right.
It's just be like that.
We're over here.
To engage people. Bring people to the table.
That has a little, you're asking us to implement something.
What is this?
Perform culturally and linguistically appropriate goals.
Yes, we're gonna migrate. You'll stay with the same team for this goal, and then we're gonna shake you all out for new teams for the next goal. And we moved clockwise, this table to here, here to here, here, all the way over.
Implement.
And then just dig on in. The time starts now.
They were not with it.
Come go.
Am I right?
Oh, co-creation of equitable software. I haven't heard that in a while.
I wanna say strengthen, but if they're not there already, there's nothing to strengthen.
How about basically anything?
That's wild.
We didn't, that means our systems.
It seems like othering.
It says promote the co-creation of equitable policy and systems by
Providers and the youth.
They've already put it, so now we're adding.
Yeah.
These eyes. Still got it.
About data integration, and it's the,
I was gonna
part
say
of the
this
challenge
is
during data integration systems is that everyone uses a different data sharing agreement or data sharing platform in order to share
There's already so much
information with
information.
other government agencies. So, for example, we're working on CCO connect with carceral settings in order to do the reentry.
You mean outside the council?
Or everyone has to say where they're at,
So
it's not all you.
like what I would want.
Goal 3, you got it. All goal 3.
This may be
Take a break before we
possible
move
or
to a
not.
whole new goal.
Is to create a model data sharing, a data sharing agreement between government agencies to allow them to share information together.
Like one.
One, at the system level, yeah, at the system level,
I'm gonna
at the
go out on
system
a
level.
limb and say, I have a lot of
Shared
information.
data sharing.
Families about what they want differently.
It's just different ways to accomplish it, right?
Systems
Like, I think-
data sharing to.
Right? These are strategies and
Yeah.
this goal, so there are. Another uses and all the information.
Maybe.
Where's in the system.
Oh my God.
No. Another marker, no. I mean, this one feels out of mind.
Bread butter.
This one. That'd be great.
Right, it's just that all these other.
How many more? But it must have so much of it.
Yeah.
Like I need to.
Right, it's not like all.
Yeah, I mean, it's, and all, like, there's really not much to say.
My
right?
comment for this is just like, think about this as we do all this.
What's this OAR policy and some of the
Administrative rule.
It's like a lot.
Sure.
do we add a
I
uniform
don't know.
thingy to it?
Behavioral health. Oh, there it is.
I love it.
Let's do it.
Oh, that's mine makes a
That's the one that
difference.
pops.
Yeah, mine makes a difference, yeah.
It used to, the tongue used to pop out.
Oh, yeah, mine.
And then go, poof, and then it pops.
I was about to say, what the ADHD is happening next to me? I hear squeaky sounds, I hear excitement. I'm like,
That would be a system.
I guess I'm still wondering what, like,
I don't-
their objective or goal as far as like.
do not give this to a toddler.
Treat them differently, but like what is being intended outcome of
I
their.
think the engagement is what's supposed to be different, but I wonder if she did a shorthand and more. What's the broader strategy?
We're
struggling with
separate.
strategy.
I would love to think that, but it's never included and then it gets left out.
I think
Because like, for example, I don't even think our system had screen readers.
Broader strategy and you guys can rewrite it. Remember, like all of this is a
That's kind of been done with them. Like, are we?
Yeah.
Totally different. Should we ask that question here? Yeah.
Changes?
Thank you.
Apart
Pulling
from
Medicaid rules for nonsense, and they're trying to
So if
do
we want to
super
rewrite it, we should rewrite
like the
it.
follow-up.
I think the circle of policy is you
Big pieces.
develop it, you implement
These
it, you
plans
evaluate.
implemented.
I would also say that what I've
Um,
heard
And
from
that
some
the
family
way
members
it's been
is
done
that,
hasn't always been successful, so thinking about coming at it in a different
Based
way.
on.
especially the real.
Innovation is a great word.
Which part hasn't been.
It's not
Makes
What do
sense.
you guys broad as it is.
Started as
It's
class
not
and we
necessarily
want to revise
inclusive.
it to real.
That's where we all get to take collective.
So
ownership.
there are some, you define what either of those were on the sticky note. So is it?
Policy and heard, is it always been like that, at the table, or enough voices at the table? This one tells me going to youth and families where we are, that it's been, you come to us.
Said over last
Where you're at, literally and figuratively. Those type of things.
Of data, so like,
Right.
race.
I know being.
or over here.
Yes.
I don't, these are like my friends.
Possession of those don't necessarily.
Yeah.
It's like days with youth and families in one meeting
system.
over there.
Love
Something,
that.
right?
I don't know that I saw the word in our system.
Marker.
No,
Such a
Some of
You're like, it's not strength-based enough. Let's
in a
be
more
more.
meaningful and a.
What'd you say?
What's the chart? What's the
Yeah.
chart? I know exactly what that
Everything on the
means. And then
dashboard's
I'm like,
de-identified.
no, I don't.
I love that.
Well, I don't remember the language,
Yeah.
though. Well, but
Are you still? You are welcome to Google.
Still super small.
Are you-
font.
Yeah.
Yeah.
Good language.
Like,
Causes
and
harm.
it's 6, it shows-
Okay. The top of it is.
Yeah, for.
The use of it and
terms
then
of
where
like.
it came from.
It's important. I mean,
information.
got it.
That's.
Well, I think that's.
I remember
I
the
think
video.
You created a new model
saying-
too.
Yeah.
That cycle, but I'm assuming
What's the
that
next
that
step beyond honor?
is.
Honor and affirm it, and then you have to.
it's baked in.
Say
I think
think you gotta
I think
say
it
it.
is.
It's like, it feels pretty.
So those are the
I
action
just wanna make
steps.
sure that that was in there, and that I wasn't.
We can also look at what are some of the action words on our board, and use those
The
feel.
things that we would add here, we already added.
Right, that's what my thinking is. This is just one strategy changes would match that so that it was.
Side of the
Okay, we can specify that. Then
So
we
that's
get
why I
to
wrote it
specific
here,
actions.
should I just say, like,
She's got
so
it.
have like.
Tapping out.
So how do you wanna rewrite? Number one, engage with youth. and
Well, I think
families.
since they're all part of the same goal, there's no really.
Yeah.
Just-
That's what.
Yeah.
I think identify data
Something about
points that
restorative
indicate the
measures
health
too. I
of
think
the
that's
overall
part of
children's
engaging
systems.
youth
And
and
then
different.
track that over
Try to
time.
repair the harm.
Yeah, like our
Already been caused, and that would be engaging.
Yeah, I mean,
Across data
in Senate Bill 1, we're required to like
The
have data
relationships
on
between
who's getting served.
There's so many families that
Is-
we're.
oh, yeah.
That point, what I see a lot in data is we'll do
It's like so-
statewide, but then it.
Which is
I'm losing my
like, you're so far from there, like, yeah, like that.
Nothing is gonna happen.
I don't know.
What's different this time?
That's possible. That's kind of what you're asking.
Maybe there's that's a different, how to say that, cause this is just.
This is the visually in my mind, I think data like a heat map.
You know what I mean?
of
So you're
I'm curious if like an action step is like
I think
time tying into what we did over there.
It distinguishes where
All
each
these
area
listening
is like
sessions.
ups and downs are instead of like
But-
putting it all on an average. Which I think is what ends up happening a lot, like
Community's voice or
I get
something
really
with family
weird about
with
people saying like, well,
they
statistics say
do
this.
the care
Well, yeah, but
review.
who's the
Right.
predominantly,
Policies.
predominant person that statistic is, here for?
Rated child data set, is that?
Reviewing that, their
Where.
Yes, yeah.
Oh,
Thank you.
for that.
Yeah, is that
Our
Is that something that needs to be?
Like to revise, like
Accountability for
That's exactly what that would be, right?
Yeah.
If there's a cold spot on that
Here's
map,
what I
like,
did.
you know, we have these
Like
goals.
we heard
but,
you, we took
know,
your voice, we heard it, it's written
when it's, like,
down.
really cold and we haven't
And
talked
I
to
don't
them
know.
or
New
haven't
suggestions
sat
that we
and
don't
talked
have the
together.
funding, right? Cause I think about, I'm gonna come back to the mini grants that were done.
We have the goal, but they're not getting the data from it, whatever the case
Hear
might be.
the youth and the family voice.
Part of it too is like, sometimes they do have like
Some of the
resources, but they don't, like, there's not enough outreach or there's no accessibility or they, you know.
Well, we know that getting.
Don't want to, so I can't pay for it.
So we can't really just get a
The
community.
way that I
space.
wrote
measure it all by reading.
Drop and set.
The way that I rewrote it was, implement culturally accessible and linguistically appropriate goals, policies, and accountability practices and systems.
Like how, so what do we do? Like,
It's a little more broad.
I don't know, I just feel like we get so stuck here.
Any data request should have an
Yes, we hear your voice.
related to it,
But
like what is the
we're-
thing,
I feel like
what is the
we're
thing
not
that's
getting
needed?
Like this, right, from behind your back.
Behind it, it's almost a continual data cycle of like, when you turn this again, you wanna see it result in something.
Really hard
So it would be almost a data cycle of report back.
Yeah.
We don't track, so we do
You need
maintain.
to put that down and just sort of like, I think.
Actually,
We don't track it. There's no measure, like I can't go back and be like, wow, of all the IVHT.
Students from different backgrounds, I mean, so we could have.
That was community.
And then what happens
to it? You know, convene.
We didn't track it that way. So like if a youth came to me and was like, well, where exactly
Social service education.
show up in these roles? We didn't talk about it that way. We could say we
Just here's
changed
some
it.
data.
And strangely enough, I see a lot of that for like trade, like so I don't know, there's something about us having an accountability that like documenting all of these set you up to have a job and then being able to demonstrate how that impacts. And I feel like for
It's
the
like part of the
why,
campaign that we
kind
talked
of have to
about.
figure out.
Your point is really
like,
good. When we found
Here
it,
is exactly,
like having
because
kind of
that
like,
was another
not even
theme
like a
in the
roadmap, but
grant
just like
specifically
access.
was like, well, what's the
So
many
of our social work
I wanna know what you did with my.
Yes.
There's zero, with all the stuff, there's no PR.
Data points.
Zero
Bad PR.
PR.
Very
There's
bad.
46% of the PhD graduates in health science and the
Changes the lives.
That's why I don't want to get my law degree, because I can't do that.
Here's what we accomplished.
And I already have, and I had to stop because it was changing me to a worse person.
I think
I hear about
that is
things.
so meaningful. That is meaningful.
I hear about things that change, I'm like, we'll never filter down to the Oregon. We never heard about it.
Right.
Are actually shared.
Because we also just had a question of like,
Because
That
a lot of
create
times
benchmark,
when it
because
comes down
something
to
else
it,
or
specialist expertise is on all these councils and been giving.
Like, even if it's under
I'll ask you.
We don't document it there, but like as an agency, I don't know if anyone does.
No, that's great too, or that being said, even policies written by you
was
that
saying,
don't
like,
ever get, I guess, credited to them.
To them, yeah.
That means, like, not only do they have the ideas, they will do the work.
Because our whole purpose
It's
is
discouraging because
to
not
like.
only do they not get credit or, I guess, it being honored, but.
Yes, welcome to the table.
From wanting to, I guess, continue advising. because
What to do is this how we should go about it. So when I think about the goals that we set for SOCAC,
trying to help
I
us.
think it's like, oh, this is what
I
we're
think
doing.
again, there has to be
But again, there's no accountability in this. You don't.
Using that to do this.
But it's also a
acknowledging
from
the
agency land, like,
participation,
There
not
are balls, things we gotta do.
taking the ideas and say, I have an idea that's not.
and we welcome a
Like,
table that adds capacity to think about.
Saying.
What does it mean for OHA,
There's this rulemaking advisory committee, you know,
Matters on
there's
the
always a write-up
here. You can
in
really.
addition to the actual public rules.
And a system.
Maybe we should add a section. Is there a section to document it or changes?
So you're gonna be moving on pretty soon.
Do we feel good about?
This is where the data work. Like, great idea. Maybe add it to the form. Eliminate like some youth and family or what. Yeah, like this policy.
How we're eliminating
So, okay, so I have a question, yeah, specific,
Cause it said like right access.
from this.
Just a little bit of friends, but also,
There's
not, again, that's a big, like, that's not happening in 4 years.
I think that would be huge.
Coordination,
legislative gap in
right, it's not, again.
So we can at least take a step towards it, right?
Our suggestion could
Yeah, I'm like,
be.
that's not happening,
Exactly,
sorry.
Type of rather than saying provide access.
Yeah, because that structure goes together when you're doing a gap analysis. Tell us where you see.
sorry, we didn't move on. Make hands.
So we added to this one.
Okay. We should add again. I like that.
That's why we look at it.
Central reason is to get systems to
That's
work
when you guys say,
better.
wait a minute, we moved, take it back.
If somebody moves it, like, sharing it, it's like step towards this. That's a
It's not gonna happen, but it's a nice idea.
I'm assuming implementing strategic plan.
So
that one's gonna.
For non-speaking.
Two hands on that one.
Two hands.
Oh.
Draw strategic plan with elevation.
About.
What does this go to, do we know?
Kind of tight.
Oh, yeah.
I like these, how these ones are more tied to like. this,
God.
like,
Oh, that's what really is.
Codifying people of exactly what's
Thank
like
you.
access made.
Create some.
Yeah, because they could see, oh, that.
Coordination.
Did I do it right?
Ooh, I love it. You're getting youth-led advisory.
I can tell.
I'm gonna put everything more like that rather
I'll do it.
than-
And
Do
then you
it.
put that
But
to
it's
council.
still, we still do it.
Round table. Look at all these things.
For all the council.
I love review.
Like, there isn't an organization out there
All right, last minute.
that is like.
Last minute on this one. Lot more to go.
Struggling to share data.
I'll tell you what,
Me personally,
Dude, no.
It's a level I don't know.
Nice idea. I think about it daily.
But to me, like, I like
think
the
that
type
the
of
places we're saying
legislative.
systems work better together.
And I'm not saying this, but I sometimes go like
Go create a family engagement policy.
Yeah, but
systems that aren't disproportionately serving white people. Will there be at some point, well, we're gonna like. limit
Under the guise of, under the guise of
We're
first,
gonna like.
like,
there's
nobody's
gonna be-
really explaining why and for.
Now.
One of the issues that
I mean, they're all for affirmative education, so maybe that wouldn't matter. I'm not gonna lie, sitting here, and maybe depressed, I'm like, yeah, I don't know, is it even safe to have like
mostly
disability?
white folks will hit your
They're
metrics.
trying, you know,
And again, you have
autism.
brown folks still getting the same inadequate level of care.
If you're homeless.
All right, same thing. On to your last one. Just a little bit of forewarning. You're gonna report out on the one you land at last.
Really.
So start thinking about who's gonna share and how you wanna share. Just a summary of what you're gonna gonna address next? The same way.
The attention.
Smart table now.
Been assuming that I had a good picture of where the gaps were. But as I'm in the conversation, it's like, no, we don't know. Community. It's like, wait, so that's not even helping us this whole time.
Get your ass over it. And I'm like, they're like, who are you kidding?
I hope I wasn't out of bounds, because I saw you laugh.
Oh, no, it's totally me. Yeah, like there's no denying that. Absolutely not. I'm very.
No, I love it. No, it's helpful.
In an affirming, honoring and.
Lots of data thoughts, huh?
Great.
You want to know it's
Differently.
different.
And, no, I agree. Yes, I get what it's saying.
Really like us.
I agree with what it's trying to say.
Oh, here's the. There's the. I don't know what that one.
No, that's culturally and linguistically appropriate services. It's a federal. Seriously, and this one came out this year. So we have somebody hard. Someone wrote it out.
So weird seeing.
I already have it.
Yeah.
It's all about.
I don't know if this is what they meant, but I feel that, I'll be honest.
So, and or non-traditional speaking.
But for me, I think from a disability perspective, this could be like neurodivergent or
Nonverbal?
Nonverbal.
I see.
That's what it
know.
means, but we
Yeah.
don't use non-verbal because verbal is a big for me first thinking, so we say non-speaking and non-traditional. My son speaks in metaphors and repeating things, but he communicates really well.
I see.
I like that.
I just use different terminology.
I guess if we're trying
As an
to
autistic person.
kind of take from like, what are we actually gonna be able to do?
Right.
Like, we're really talking about Spanish language services.
Exactly. Let's say it.
Like,
Let's
Very
say it.
organized.
like, I mean, if we're talking about doability, right, like, I doubt we're,
Organized exactly how it should
Should we read them out?
you know.
So Kati, 'cause I think you're
Except this one's a little.
No, you're fine right where you are. Okay, so we've got review and implement family engagement plan. I'm gonna just use it like a big one. Capacity for local systems of care. Ashton, have a joint lead for local say, who cares? Co-create an accessible.
Use things like Linguava,
Course
right?
and
Like
training
family concerns,
guide on
right?
youth and
Support
family
training
engagement.
centers. There are services, but to expect that like you're gonna
Policy handbook.
be
Yeah.
like,
Do and implement engagement and exactly, no, I'm community-based engagement to meet families and youth where they are, individuals.
okay, so, yeah, I mean, I think ASL.
Yeah, so that's like one of the things that like.
I would like to see something more dynamic than this, like
And
a
affirming,
ongoing community of
honoring and
practice
restorative
around youth and
The dots
family
are supposed to be to
engagement.
get rid of it.
Name
You
them.
use are actually working. You're actively.
Red and blue, those are the ones. I thought
Specifically the
color,
youth.
red and blue.
But if it's-
Yeah. Good, red.
I get the list.
I agree with
Because
the, I
she said
think
she
it's
didn't have
get rid
enough.
of, I agree with the sticky
Take the
above,
red
but I
dot,
My
and
team.
then affirming, honoring, and restorative manner.
Fun.
provide access, TA, training, funding.
Well, they were going to.
Yeah.
I think the.
That too.
Well, it's provide and assess, I think.
Create an accessible family engagement. Yeah. No, it was your idea, you do.
I believe it is, I don't know, we couldn't decide.
I think it says act, but I like the way you
Bring
said
it
it.
in
It
memorable
says
too, in case you
better
need
word.
some language.
Yeah.
I
Training
think
and
the
technical
other
assistance.
part of this is like,
Nice.
all this sounds great and
Funding,
good.
this was funding.
But so often these things get created and then
Or
the systems maybe don't use them.
Yup.
And so what is there where there can be
Meaningfully engaged,
accountability towards the from all the
What is-
systems?
What is attainable accountability? Because the one over there, we added a lot of things. That one we kind of like edited.
Because for example, the yes, we did this.
No, go ahead.
The community
But it's
engagement
for
goals that was
this, for
created
data
by
sharing.
high with.
I definitely already.
He has, but then like other systems and groups don't know it exists. And it was really well created, but other systems also should be used.
Well, I was stuck on the underdocumented.
Is that gonna?
Wait a minute. Yeah, white supremacy.
Recommendation shows up in the next movie.
Yeah.
Are you thinking from like an are you thinking from an accessibility piece?
I think it's more
Or
like, that way it's
like
not
a-
just tokenized, like, we're gonna have a listening session. and we know when the last one's gonna go.
Firstly,
I think
what are some
that's
uses?
perfect.
I think it was two.
Yeah. Sitting at the tables.
And so.
There's always, there's this one really cool tool that says always has
Different conversation.
Like our
Just start with insurance.
Exactly, well, like linguistically appropriate.
So our Medicaid data.
It's all nice.
Yeah, I mean,
Maybe Arabic, right? Like,
That would be.
Here's my question, maybe I misunderstood you. Is it a strategy to spend $1,800?
Data, but it isn't always attached to real data.
In our legal system. For some of them.
Interactive.
And there's this value under that, right? Like you don't have value until you're
really problematic.
a certain age and own property. and like
You can vote.
have these marks.
Why isn't why can't you collect? I know that you belong.
Right? So is there something that needs to be done to tie them with tangible tools that starts to push that reexamination?
yeah, so.
Narrow down.
But is hindering engagement with youth in a.
What is that rooted
in?
What is rooted
I hear what you're saying, and I'm not.
The
saying
data
it's
doesn't tell us who that.
We want people to self-report, but
it's not.
You know, this person has an IQ
It's
of
not.
X, and so we couldn't possibly fill in the blanks. And I'm like, I don't know how many 8-year-olds you know.
Why is it not?
But they sure really what they want. So how do we address
I don't know if it's not optional or if that's very other.
I think it's action step
It's
would be.
presumed incompetence? Is that what you're getting at?
Yeah, but what's the real tangible way that we do that? And so what came to me trying to stick with the bluebird was like build the value, like we need to really intentional about not just doing this, but then when we talk about what we've done, that we say we did this. We didn't see this until later.
That's why we have a lot of
This was the way to.
And
do
for
it.
health
And
equity reasons too.
like, something that really starts to demonstrate over and over
I
again.
think what I'm trying to get at is like, is it rooted in white supremacy?
Not just validate lived experience,
right?
step
But if the data
beyond
was
that, you
actually
can't think of
accurate to
how to
show
write it
the
out.
population of youth, is that a Oregonian?
And then that way we don't have to decide, oh, you're out, you're in.
Right? There's a lot of what you're saying, it's like,
We're not gonna focus
what
on
is
these.
the way? in
Where I'm
which
going with that?
Does that make sense?
We actually.
Right, if
make
we
the
first
decision.
Sticky note that says include everyone.
Being
Folks
done
wanted to
at
share.
It
90.
makes sense.
The impact
I
of
also don't think there's been a social
It's like
movement in
building,
Have to
has
make it matter.
has
But we
a-
don't do that.
let's use one of the
So-
words.
But
Strengthening
I
or
understand it. It's
building,
gonna be left behind, even if you say.
investment
It's fine.
around
Bigger systemic change.
youth-led work by
Right.
connecting outcomes to.
Yeah.
Probably
Right
bigger.
now,
than
the
what-
biggest thing.
I like that.
Yes.
I think that goes really well with your.
The other
Assessing,
That's what it feels like.
You wanna
We
try
saw it
to-
earlier with the, with the.
But assessing and naming where that's happening.
I just want to
might
excuse you
start
to
to,
this is
You
bad.
know, like start
Yeah.
digging at what are the great.
Half the,
Well, we talk about going upstream,
you
but
know, was
how
like,
far upstream are we?
yeah.
I think the pain that I have is that like, we'll even saw this with summer. We'll even get. We'll even get impact that we're able to create, but then when the funding conditions change, like some of those
So
things
for
that we
under
spent years
assess and name
proving
where
that
data
this
is
is most important.
underdocumented,
You don't have something like in after school programming, like violence goes up in some communities and things like that.
That is what
but
I
that's
have
what
been
focuses
Oh,
right now.
fed back.
This
Oh, not
is
fed
just
back
just
programs.
past.
Idea of.
The
That's why
classes
students
don't-
cheat.
And so it's like,
It's a step.
it's also even like,
To me, this all feels the same.
like trusting even the data that's created.
This one is track where
Some kids, that's why you see that there's a higher rate of system involvement when people are out of school.
So some of these, so this one's like performance analysis of all
That
legislative.
goes to like, spending on that, the need for third space.
Administrative burden.
Maybe the
ones we want more data, we ask for more data and we
I
get
thought
a
this
lot.
fit into this, don't you think it does? Exactly what you're
So
saying?
great when I was like a younger teen, ask for the stuff for coming out for mobile crisis, when I could sit down and be like, oh, yeah, it's a lot, it's a lot to ask, but
Look at the SOPAC, look
something
at
to
that.
consider, how do we
All these
do it streamlined enough that it's
Empowering
that
lived
it's
experience.
again, and that there's people are able to describe accurately why they're asking the
Yeah.
data that they're asking for. Maybe that's the basic.
So tell me what you guys think about my organization. I feel like I'm putting things in the right place.
So can I just say that we've probably organized all of them in the right.
Yeah, I know. I think that's what this is trying to get at, is in an action step and crisis support. Get a committee together that pulls up. Well, it's community counseling solutions. Tell me where the problems, like where do we know? And so that's helpful. Me, middle class. I think it is, and the way they're asked out of questions. Exactly. You can ask. So what I would add to that, sticky note, because it can be longer in real life, is performance analysis in partnership with.
So this one, somebody added right too,
Right?
align data coordination and sharing across existing projects. What about data?
And I think that's why these don't.
Amanda, give it a look over.
Over there, there was like.
I felt like folks who need to be at the data time.
We gotta put more
Appropriate for your data set.
as its own which I'm super happy with, super sad.
Oregon Health Science University.
I love this new one.
So I think sort of exactly.
Yeah, I think this is where it's important, because I feel like one thing that like we're finding in our report,
But is it gonna be added?
sure, we get tons of feedback from these families, and it's kind of like that.
Yeah.
And like, they're
Right
getting
in
it
that.
top families in the room.
added,
Experience.
But I think.
What does CIO mean?
Data sharing across.
CIO.
I feel like connecting the outcomes to, I feel like the engagement.
Oregon CIO, I wonder if we're data sharing.
Some of it might have been an earlier.
Yeah.
Agreed.
Equity. That's what we want to
Beats
hear.
me.
Andrew, wow, we're engaged.
Andrew, so did you already high five the rest of
Because CIO on the sticky note. Yeah, what does that mean? CIO. Chief Information.
You got it right.
I think we need to strike it down.
David Andrew, no acronym.
Who's Oregon's chief?
All the other ones. That's what I think.
So maybe an action step is.
So is I would give.
This is where
Like compliance.
Identify.
But I don't know. I think striking it makes sense right now. I support you getting in there, and making that argument.
Qualitative.
Morning, good morning.
And some of my circles, like, we'll talk about the numbers, we give us a list of like, where do we want to go find out, so we have shared.
So I think
What
Drop.
if we had a standardized way of qualifying, now what is the word? I'm not a data person. How do, yeah, because everybody's doing a different analysis of qualitative data to come out with like their X of what was said and then try to transform that into policy. What if we tried to standardize that?
I mean, that is for everybody.
So you're doing listening sessions, you did a quiz, you did a whatever. It's the same conversation we had. We want you to go through that qualitative data to then share out.
Again, you created this problem. You hired me 15 years ago.
I know I did. I'm responsible for this. You're welcome.
You created it. educated. Yeah, I mean, we're just gonna wear ourselves out if we start accountability and we get.
I like the defining.
I was gonna ask, Dan, you might know the metrics for children right now. I'm blanking on the name.
What's a C word?
Curator, 0 to 5 population. Yeah,
Best
CCR metric, but it's the children's system. Maybe they use data sharing from all the different measures for that. So why can't, yeah, why can't we create those? Why can't we here, where we can use data sharing in the same way?
Yeah,
that
like-
allowed it to create that metric?
The community practice piece about that might have.
All right, last minute on this one, last minute.
I mean, not as deep as they did. That's okay.
And I think there's something.
Because
of data.
People didn't know that.
So there was concern, but it is.
To hold people accountable.
I love that. Isn't numbers, that was something great as I got this.
Okay. Stay exactly where you are.
Several.
They can't hear. There's a lot of them.
My leggings out of the.
All right, can you, I'm gonna ask each table to just give me the high level synopsis of where it ended, right? Because this will be fun, because if you were there at the beginning, you're gonna get to hear a little bit about where it landed, but very high level. I don't need you to read every sticky note. Right? I would love if other combos could go to the lobby, because I'm having a hard time hearing. Step on here.
And then a clap once if you can hear Tiffany. Or quiet coyote.
I usually do. I know, flashes. All right, yours too. We're gonna start with strategy one. Strategy one, high level overview about what's going on over here on this sticky note.
Okay. All right, so this is engagement with youth and families differently. And so one of the quick pieces to look at is that we high five the in an affirming and restorative manner. We love that.
Differently.
So we know which table did that.
I think the big picture thing as well is that we wanted to connect all of this with local and SOCAC work.
Oh, that came up in group one. Continuity.
We really built on the strengthening accountability to incorporate feedback into the system work, building investment in youth and family engagement by connecting outcomes to youth engagement, connecting that with tracking where and when youth and family voice is impacted.
Yes, sir.
I think were some of the main pieces there. There's a lot of reorganizing it to like make it make sense together. Is there anything else I might be missing? Because there's a lot of sticky notes. I don't want to read them all, but.
Super validating to Elliot, because I was gonna write all the strategies on here and Elliot was like, people are gonna want to move them and visualize them, so.
Go team.
All right, we are gonna send, I'm gonna literally send this out to be typed up to be a tool tomorrow. Dun, dun, dun. Thank you, Christy. How about this goal? Where did we land over here? The high level report out. What do we got? Nobody cares about data and there were no changes made.
We didn't
No?
Oh, actually, no. Suggested action.
There's no wrong way to do this, just high level summary.
Sonia's starting.
So we have strategy 3, improve integration and coordination and efficient data sharing across the system. Which is a lot. There's a ton of stickies on here, but high level is we want to make sure that in all of this, we center the collection of data in an honoring trauma-informed way. People should always have the choice because there's some safety issues. Yeah, just conducting assessments across the class standards. There's a way to integrate that.
We really liked the new idea on here, align data coordination sharing across existing projects. Lots of different examples, what that could look like and create.
Those are things we can do.
Yeah, so CAC could be the hub for doing things like creating model data sharing agreement that centers that trauma informed honoring thing. And we want to ensure that qualitative data and story is in here, not just quantitative.
That has come up a lot. One of my big themes in the notes was qualitative stuff. I think it's on some of the sticky notes in the back on data too. Love that. All right, we're sending this one out. We're making it official. Dun, dun, dun.
They're all going to Christie?
These ones, the next ones will go to someone else. All right, what do we got over here? High level summary about where we landed. We're almost having too much.
I would even do her. Give it all to her.
She's like, what was that? We were north?
She's what do we got? Who wants to report out? No wrong answers, just that high level.
Christy, so
Making
it's
sure we're
probably
all sort of
Nike.
tracking.
You're making the detail-oriented person do a high level.
You should have heard the.
I know, right?
Right? It's like,
I saw
why?
you were in the room.
Sonia goes, now you'll have to get me an appetizer.
She's practicing out of her.
You can pay attention.
Okay, so there was a lot of conversation about, or actually our strategy was perform culturally and linguistically appropriate goals, policies, and accountability throughout the systems.
People
throughout all
love perform,
systems.
right? People were like, yes, that word.
Yeah, the perform was scrapped. And I think it's now, there was an addition of implement culturally and linguistically appropriate goals, accessible. Culturally accessible and linguistically appropriate goals, policies, and we suggested that we scrap accountability because we can't, how do we hold people accountable for being culturally and linguistically appropriate, I think.
Sable gets a high five for doability. You're doing exactly the thing. Is it doable? How do we do it? How do we measure it? All that stuff. Thank you.
Perfect. So then there is some agreement, definitely agreement around measuring these goals by region, because things like cultural and linguistic responsiveness is gonna look, or appropriateness is gonna look different in different regions across the state. And one big thing that we talked about is actually going in and evaluating and defining what culturally and linguistic and accessible responsiveness and appropriate means. Because right now it's kind of all over the place and a lot of subjectivity around it. And then there was a really good one that talked about forming a gap analysis of statutes and rules that talks about equity, accessibility, youth-centered family, and family-oriented compliance. And that gap analysis should be done in partnership with family and youth, and then the folks that are that are responsible for whatever statutes or regulation we're talking about. Implementing the strategic plan, or this strategic plan, with youth and family voices, which we're doing. So yay. And creating a subcommittee to review and prioritize SOC look back strategies. There was a note to add youth-led advisory accountability review board. And then we did a ditto for families.
Love that.
Definitions for Real D and SOGI. What else is there? That's it, right?
That's great. Thank
Okay.
you. All right, we're gonna send this one out. And then Elliot is gonna facilitate a very serious, very important break time exercise.
Yes.
so that I can set up our next round.
Okay, you have to listen to me though if you want to play the game, which you do. Okay, so what's gonna happen is we are going to play rock, paper, scissors. And you're gonna find any person to start with. I'm gonna choke on my own saliva. My dad. Okay, so what you're gonna do is in this room, you're gonna find a partner. And with your partner, but not starting yet, you're gonna play rock, paper, scissors. Does everyone know how to play rock, paper, scissors?
Rock, paper, scissors, right?
So we need to decide if it's rock, paper, scissors or rock, paper, scissors, shoot.
I always go just rock, paper, scissors.
It should be
This is the problem.
individual with the person you're playing with. Rule set at the beginning.
This feels like the exact like personification of our getting to our voting and our consensus. I'm not gonna die on this hill. You pick shoot or not. Either way, one of you is winning the rock, paper, scissors. Then what happens is whoever wins your rock, paper, scissors one-on-one, the loser has to now cheer on the winner and they go find a new person who won. And at the end, we will have two people who have two cheering sections behind them of all the losers who are now supporting the winners to be the best rock, paper, scissors person.
Too much pressure.
Does that make sense?
Are we doing best of 3 or just one?
Just one.
This one.
Like all day
Yeah, not
event.
more than I need to
I
get
don't have
to.
time for
Are
that.
we doing double elimination?
So you're gonna find a partner. You're gonna play rock, paper, scissors one time. The winner of that round is gonna go find another winner. The people who didn't win are going to follow around the people who lost or that won against them and cheer them on.
Okay.
And at the very last round is two people with one person being the winner, and your prize will be that everyone is cheering you.
Okay.
Ready? Yeah, wait, one more question. The decision was basically you just decide with your person, because there's a split on the value. All right, begin.
Oh, all right. You're up.
Okay, now you're, now you want, right.
Okay, so you need to find a winner. You can wait over here.
Johnny, go! Go, Johnny, go! Go, Johnny, go!
Another winner, over here.
Gotta win.
Three or
Okay. And so it's rock, paper, scissors.
Come on, man.
He's the winner. Other guy. Vinny's the winner. All right, we're gonna be doing another goal. So similar sticky tables, we're about to do the same thing.
Yeah, please mix up who you're working with. These are opportunities to get to know people. So we've got goal 1 over here. Provide effective, equitable, understandable, and respectful quality care responsive to diverse cultural beliefs and needs. Remember, you're gonna get to play with that if you hate it. Over here, we've got 3, make families and youth equal partners in care, emphasizing dignity, inclusion, and shared decision-making. And our final strategy for goal 2, which is on the board, break down known barriers. Pick a table, try and mix it up and work with new people this time. We've got the same thing. We've got hand stickies, we've got dot stickies, and we have lots of sticky stickies because this group loves those and I love that. So find a table. We'll take a break after we get through this one. Now that you're used to it, it'll go a little bit faster.
Wait, one more question. Are people okay with people taking photos and posting them online? Folks are wanting to share through their like professional social media. Are folks okay with photos being taken and posted online? Please speak.
As long as you tag me.
They might not be comfortable, can they text you?
Yeah, if you're not comfortable being in photos, please text me.
And I'll put Elliot's
Number on the board.
As long as my eyes aren't half closed.
What kind of photos only?
We're not going to like photo.
You just post all the photos where people are like,
Yeah, I know. Participate in advance to
We all decide.
procure authorization for photos, and then I'll have to review them individually. This is how we do things, Addie. We're just gonna make up. I'm kidding.
I was like, we can do
I'm
that.
gonna kill you, Anna.
I was like, I like
I'm
rewarding.
kidding.
All right, good. Find a table and get the conversations rolling. Like I said, this one's gonna be a little more fun and a little bit quicker.
So is that it?
And feel free to grab more brownies or lemon bars.
I think you're.
I will text you.
Until you hear something else.
Okay.
Yeah.
Or I will let you know if I'm gonna text.
It's very expensive, but I wanted to.
None of these are.
It's the ground.
Wins for me. I love you forever.
There's like $100.
Have you?
Families and youth.
But hopefully it lasts for the rest of your life.
It's nice.
And it could be what.
Providers are gonna do this?
Yep.
If necessary.
If needed.
Yeah, everything on REAP side's going good.
This or a.
There's this one.
We're asking the system to do this, yes,
Develop
Asking
strategies.
providers to do this.
because we're not providing.
I like this one, develop strategies to recruit, promote, and support health and linguistic.
He's 7 months old, about a month. Nice, congratulations. It's awesome. Yeah, my sister had a baby last night.
So that's.
Yeah, that's, so can I slow us down a second on that?
Haven't even had this. Yeah, you know,
Can we
this whole retreat, man, that's when I'm.
Develop strategies, because I feel like this isn't something that we should own when.
Most of my adopted community, so.
I almost feel like the support is so broad.
See her.
It's a systemic
Yeah.
Right.
issue of getting
Developmental
through
assessment.
college to
There you go.
serve, like,
Teach.
there's
Damn
that
near
huge
impossible.
barrier. that
Families and youth, equal
you don't
partners
have the
in
money
care,
to do it.
emphasizing dignity, shared
So you have the
decisions.
same people coming through the system, who don't
We've
have.
been doing a
the
lot of
training, they're well intentioned,
Another one.
Middle upper class.
middle
white
upper
kids.
class. And so, nothing, Bill, but I feel like this is a more systemic issue that maybe
Multiple systems.
consider putting a pin in, because it's just, it's huge.
Do you feel like that got to where you're going?
Yeah, I think so.
We would.
And, you know, I think about
Zelda.
in Eastern Oregon, we're high school kids and bachelor's level students, right? With
Yeah, so I think that
scholarships.
came from
So
the youth data.
work in-
And that's pretty much so.
The other goal that we were looking at.
It's a problem there too?
Oh my God.
Problem Southern Oregon.
Yeah, it's work, yeah.
So anybody, once they reach a certain age, can be given straight cash instead of having somebody.
Get their license and then they.
Yep. Get their license in their private practice or
Yep.
wherever.
So you got the youngest, least experienced doing work with the most.
You are
complex
speaking
kids.
my language, my biggest gripe.
Oh.
It is
Yeah,
sad.
I don't know.
They leave in like a year.
Yeah.
Well, and that new.
Some of these to make like
The new OHA policy
a lot of recommendations.
about bringing
That's gonna
those.
make the least trained worked with the most.
Work
kids.
Because you're bringing them under,
Just inequities.
back into community mental health.
So it was like everyone wanted to shift it. and
Our
then you
coordinating
just
care
shifted the
organizations
policy.
fund
there
things
some
at a different
community
rate
service
than
that deals
with
with
ours,
because
so
you wanna
their
retain
providers, they don't need to reimburse.
Yeah,
So the
rate.
youth council, I just wanna know what the council, if this is a strategic.
I know one.
Yeah, that's kind of my.
Who does not hire these
CSWA is
staff, give
no
them
longer
our trained staff.
outside of the
Expecting kids.
Yeah, that's what I should do.
Because
I can't go into private practice. So they have school-based. School-based.
Yeah, there's time.
That's a barrier.
I'm giving a lot of training.
And I'm in support of it.
Because in theory, they're getting higher
transportation.
So in theory, they're getting a diverse.
We have therapists out of college. trying to
Yeah,
board
so I'm
To
like,
even
how?
acknowledge.
It shouldn't be.
Ooh, I love this. I love
Parts
this.
like that.
Because your peers are the ones that can really do a lot of this.
Would help with the
Such a
credibility
cool idea.
as well as the
I also
people
think that, yeah,
Link your family's resources.
Even maybe restorative
Which in turn
measures.
breaks down all of them, because so
That if there's
me,
some sort of
I
credibility
feel
and
super
or
strongly
even
about
just follow up.
they are not necessarily specifically. They have lived experience. It's complicated.
What I
You
saw,
don't just work with children.
and I'm thinking about specific situation, but it like opens up as full as like, I think we get so procedural that we might forget
Especially for Yellow Hawk, that is.
the actual messaging of it.
I just heard free money.
To the children.
I heard free money.
That are office based.
You get lost in
Don't forget to validate
It's
you like a
because of the
cookie.
process.
That'll help us later
I
this
will
evening
say
as we
that
process.
And this is in the spirit of.
Oh, yeah, I know.
Yes, it's
But
amazing.
they have to be enrolled.
They do.
There's so
They
many
do.
requirements for a peer
Yeah.
support to get filled.
Yes.
Yes.
At least
You know
you
what?
get the word
Some of the
smitten.
things, it's not.
It's okay.
I mean, I would rather go through those.
Oh, geez, I just did the wrong one. Oh, well.
Medicaid reimbursement rates are phenomenal. Actually.
That's actually kind of where I was going with this, is I would say it would almost be to like analyze like barriers to peer support and to try, or to engaging peer support and.
Kansas seeing you here.
You said.
Like almost create like a
Right? Oh, wait.
peer.
You're doing the same thing.
Peer support strategy.
Right?
Something.
We could add it to this list.
Yeah.
This one, I wonder, like, how.
Finding ways to do it.
Honestly, like.
Is it actually implemented?
Pretty-
Because this is really about improving access to services.
I think maybe a piece that would be good to talk about is if we're equal partners in care. We all attend the same training as our partners.
Oh, family needs the same training.
Super doable. Open the trainings up. Yeah.
Equal opportunity for everybody to train.
Thanks in there.
Maybe we should make the system so it doesn't need navigators.
Or what if we make all the navigators?
Lived experience and your expertise.
So they, how many peer support specialists?
I was gonna ask, 'cause I came in late, how many,
16 counties,
like,
right?
how many
13
navigators
people.
per?
So that, well, we can be equal partners.
Oregon 34.
It is, but I think that's part of workforce development. And also like as far as equal partners, to be able to have that, you need someone that has the experience. And we can develop.
I think.
Anyway, sorry, I digress.
I think that that's what like process is really revolutionary to what we have to do as a whole system. We had to get a senator covered so many.
You there?
It's not just like the. Make context.
So I even think about when we open it up for a community.
Nobody would call it that.
My thought is meeting after meeting, creating space for that and nothing said. Is there anything being done?
And well, that's what it is. That's the main thing.
You know, what could be done to even do that? So when we have our discussions and decisions, that is just incorporated in there. And I don't know what it looks like.
There
in
is
the
this
local
one
schools
here,
there,
too.
but
It's around
it's something I've been noticing in the short time that I've been on the council. We have our general council meetings, we always open it up for community and family member input, and there's never any community family member input. And I'm wondering if folks are even invited into the spaces to speak. And I don't know if that same thing is mirrored at the local system.
CCO though, is who left.
What I'm hearing is the meeting operations and family to
I tried to limit the universe a little, so that way we
Participate
also
in the
know
window that they leave is
they are the
basically
barriers.
not utilized.
It's
not really,
I think a very
open
good
meeting.
conversation, respectful
They-
conversation,
they're
but what I
either
hear
there
is like
or
where
pretty much
the,
don't even know about it.
like
So
the,
Maybe it's.
the paradigm of the cultures of this world, we have to operate in healthcare, Medicaid look like this. And you have to think about the services, the billing pathways, the care. Because other real value that
All this
comes
feels
from a
very
very
systemic.
different perspective of the holistic
Like,
care.
we don't have
that
that shelter is always the place where they can come and say,
Like, you mean like a upstream
Dialogue where we
Yeah.
can take these
I
two
feel like there was a
languages.
meeting.
we need to like go back.
There's still space for public comment, and I think the question is, are there any marketing strategies
Which isn't
there
necessarily
to
our
fight? So I can invite folks to come, but I don't know if that's what I should
Because
be
we have to
doing or
think
not. I'm
about
still so new
how to
to
keep the
council.
whole
Like a
system
town hall.
sustainable.
Well, we
Like a
have to
session
think
of the
about,
meeting.
it's online.
CCOs
on
and
the website.
How are we going to budget for it?
Right.
How do we do
This
this
is
to provide high impact value that we
Invite
can
is out there.
last night?
Got
Check the budget.
But whether
I don't
it's
know how to,
here, then if it's a
I don't know how to
hot button
bring
issue,
those together. That's, I would
to
ask.
draw more people in, but if it's not, it's just our regular
Everywhere.
SOCAT meeting.
I love that. What, I want to make sure I'm hearing what you're saying. So I'm hearing two different things. One is a desire to have the conversation sort of right here now. The other is sort of, there is a system.
And now
There,
they're-
maybe there is, I hate this distortion, I don't, there's a work group that needs to happen around peer and navigators where we get the right
But I kind of like this to be,
Like when so, but
as most
like
when
when someone
an agency is.
that's kind of how I feel about like culturally.
I don't wanna say it went
I don't
away
know if we always do it our
because
best.
I
Something like this, sorry, like what the
I'm
heck are
seeing
you
a lot of value as we have these conversations. We're so
But
happy.
information.
that means something different.
Yeah.
So maybe we can talk about this.
And that's a doable, right? Like we, one of the coolest things that came out
It
from our
didn't go
last
anywhere. They were heard,
round
but
robin
nobody in
was
the room stepped
SOCAT
up and said,
convening on, I
okay,
can't remember the issue, but it
you know
landed
what, I
on
can
sticky
help you.
notes.
As the
Do you
best
think
place.
that maybe
Sounds like
they,
peer
the reason is
navigators,
that
or
they
sorry,
created
peer
the
support.
stage
That's
for
what
the
you're
meetings and they thought maybe
This could be the place.
Or like
to convene.
Create.
Like,
are we
that would break down.
This is just my thought.
Yes, or incubate, or provide, or provide guidance.
Personality on how and when families are involved, because
How do we even
I've
measure
been
Been
to
in a lot of
like
circles.
every meeting, and every meeting there's
Now
something
everyone
we're
gets to
talking
meet
about
that.
that
Oh,
I would think families would be interested in,
I
and
will
if
step
there's
back, but
ways to
I
then
love
invite
that we're getting into the tough
in
conversation and
alignment
then
with whatever
what's the
that need
solution
is.
look like?
So
And
it's
I
not a, hey,
heard
thank you
a
for
lot of
sharing
people
your
say,
story,
"Ooh, I
it's
wanna say
a,
this in the
hey,
tough
thank you for
conversation."
sharing that, and this is what we're about to talk about to
Now
really
I'm
incorporate
like,
what you're
okay.
saying.
Get out of here,
So
bye.
that-
Voices that are trying to measure the same thing.
And it's not just a, okay,
It's
thank
hard
you, like,
also
because
because
we
we
want
also
to
want to
see
see in our
how
agencies,
we're
but what can SOCAT,
moving with
right?
that
I mean, that's
information.
what we.
And I think that's not even just within our meetings, but
Then
the
also when we
large,
talk
like
about,
how the data is shared.
measurements and
what's
stuff, are we
involved
saying like?
And that's why I was like, I'm not sure what happens in local
And
systems
stuff,
of
or are
care
we saying we wanna
as
Lead
well,
example right
that's
from
what that looks
so
like.
that everyone's on the
I
same.
can say we have
Capture that.
Spanish agenda items.
I mean, this is a good
We're
point.
gonna
Everyone's
take
comfortable
down
with
some,
doing.
we're gonna bring all the barriers that they've submitted, summarize them, and give them a
I think,
chance
you know,
to share.
specifically on
Like a
the
standardized rubric.
I think one of the
This
biggest,
is how
the biggest
we
barriers
measure. This
or
is the
biggest
Yeah, I
benefits
just-
of
yeah,
is
just-
the
yeah,
ability to engage folks that are system
I think
aware.
this needs to be.
What does that
local.
increase
Don't
access
talk like
needs to be
provider, don't
local?
look like
Say,
provider,
why
so
do you
it's
feel
easier
this
for
has to
folks
what
to
it-
hear they need.
Improve access.
Without
It
feeling
just has to be
like
one
they're
of the.
forced to or feeling like they're gonna be taken advantage of.
Like we get trained so much
Wait,
about
wait,
you
so
need
just
to have
go
these
back from
family
here
voice,
and
and it's
then-
kind of like preaching to the choir, because we know that. We want that.
There is.
We don't have
So
funding.
heck, dude.
Like, you need to have, I mean, I
We've been
had
hung
this
up for so
funding.
long.
You don't.
And I think part of
We
this
wouldn't have
process
that.
is just
but
saying,
for
yes, we
CEO.
agree with it, there could be a strategy or it could be
Yeah.
a work.
Is this
And then
also like the goal
where it
that
ends up in the general plan.
Yeah.
is
analysis or the
rest of it
barrier
right now.
Yeah.
Well, it's our problem, but it's
Not right now.
Not in this minute, yes. So the one on design and implement direct cash transfer systems for transition.
Well, here's this one.
Name a month.
Well, is that, what are
Decades
the,
of
this is, so this is one.
Yeah, we know what the barriers are.
Like, my God, we have to talk more about what barriers.
They look at all of that.
All right, last minute.
I think that's awesome.
We're gonna move to the next station in just 1 minute.
Shared metric for like what is acceptable.
I think that's at the local. And I don't know if that's something kind of like where you would say.
We're not getting into the, we're just thinking.
If it's good or not.
In your area, right?
I would say yes.
Yeah, right, not telehealth.
Like from.
Same with like, okay, for every number of kids, right, maybe in, you know, under a certain economic line, whatever, child welfare population, you need a PCIT provider, or you're not hitting the.
I wanna say also maybe.
That number is.
I wanna say-
In theory, the CCO should be asset mapping to know, I mean, we do.
We already have an asset. All CCO should have
Yeah, of like, how many folks do you have that are specializing 0 to 5?
Early screenings, BRS.
Like, what the hell do you
crisis.
All right, time to rotate. Same way. Clockwise.
Providers. We're 0 to 5.
Move to the next table and wrap up your thoughts.
Is there like what that, to see you, Kathy?
Maybe,
Nice to meet you.
right, maybe we're the ones to do.
It got a little.
Through the CCO, OHA, CCO folks, and then CCO 3.0, and you fold in the
Not
content.
environment. Right, that'd be nice.
That would be fast.
Money.
Well, it's, we're not talking about money right now.
not.
Like all these things, like, yeah,
As if you had monopoly money right now.
Oh.
Are they over there? Or they're on the table?
I play end it all.
No, money's real and
Oh my gosh. From OHA, in order to get like which kind of money?
Just for our contract with the state.
Monopoly's it.
And that's.
Yeah, that is OHA.
Feels like a mess.
To be done.
And then sorry.
Universal metrics.
Inside that.
It's always on to the next. Get ready.
You to get confused with family.
What
money
is?
Yeah.
So this is Chelsea's big question.
And it's a little.
Look at the tiny little.
I mean, I love all of you. I try to, yeah. But I have a pretty good for that.
Yeah, think about I make
You know, Jenny's getting. And then I think the other one. You know, it's all the things in the world, right? Like, how do I make sure that this is appropriate and cultural barriers? Yeah.
So we have here, the
Right.
first
I don't know
one.
how to do that for you.
Yeah.
Try.
Yeah.
I didn't.
You
There's
didn't
creation
take
of
the
supports
papers.
to get that 200,000. Not how we pay
On the bigger.
not how we pay staff.
It doesn't make.
What is?
It doesn't make you a contract.
Right, and that's not.
advanced recommendation.
It's in our policy. Oh, I see. But you could
create family support
to that or.
No, it's just like, some of us only have one.
Did you look at it? Community partners.
Expand.
Standing committee.
Which
She's asking if this is
Service
more
policy.
I know.
I'm for families and community partners.
This one seems tangible. Find and offer best practices programs that empower you.
There has been a lot of work. It's been amazing. Like around that bit into community.
There's a ditto family pick
That's
one there.
like huge, especially.
So it's the same idea of like the cat or the to be their own advocates, the health side of things, but also a little behavioral health.
I'll be honest that-
I don't know
Like,
about
that's
that.
so exhausting, like, I think about
That's
our
for us to
parents
do
that
with
we
each
work
other.
with, that like, they're like on the edge every day.
Is it improved?
You know, I've
By doing the family.
kinship navigator program that I oversee, it's like grandparents call us all the time, they can't make
Getting.
to find a resource because they're just exasperated.
When, like this one, lean into community-based systems. of health.
Yes,
Because
over here is
we have a workforce
still
shortage.
heavy on.
Create access where
I know there's a
No, the
barrier.
barriers go straight
So,
to.
yes,
Are you telling them how to
Go to OHA.
coordinating, integrating.
From OHA.
Ever seen seeing all the barriers, they're seeing all the grants, whatever. But as far as like actual, I think it's the services that increase that just
I don't think it's like you go to workforce very clear. Elevate and amplify voice. I see. Youth and family committees, like if there are these. And it has to be part of the barrier. Slapping on Christie does. Right.
Yeah.
But most of us don't actually see the barriers until we get to.
Right now they are.
State grants.
Oh, who knows? Mental health or to like higher levels.
I don't know. I was just talking with the school counselor.
Yeah.
And she was saying.
Right, you gotta, they gotta be like through it before they, right, yeah, and have like a period of time, right?
have a co-regulator list whenever, and we can train people how to be co-regulators for these family members.
Well, also like,
I mean, because
we do system of care contracts with LCSW who does
prioritize the review, but
right after.
not that it would go through, but that
So
it would be seen.
I mean,
Because
the way that
I'm
we
starting to see that
For the
around
system,
so
is
many
for
different things.
the people with the
Like
complex.
stuff gets stopped.
Yeah, well, yeah, I'd
Or
say
even
that
started
micro
level.
level.
It is not about.
And so we're talking about individual experience. This is
How would that go as far as?
Is that a realistic thing?
There's no, it doesn't feel, you don't get rid of the power dynamic in care. No, the intention is like, okay, people in the system are there because they're trained.
That's why.
Like,
Question.
Is that a
people
regular
isn't the
thing
right.
So this
for
says.
SoCAC?
You know, like,
Bill?
system is every, long session. Like, we're supposed to be comparing.
I'm still learning.
Yeah. Providing this care, and folks wouldn't need to feel like they need.
I don't know.
Well, it's like, I think.
Because I don't like it when
It's not that it
they don't want you to contact them, so these are kind of like training on your own. People feel like they don't.
I think town halls, local town halls would be a great way
Just
to.
investing in how families can co-regulate with each other, so people look bad.
Staff, outreach to local communities. Halls to better understand the barriers first before they try to address them.
It's almost like interpretation too.
Whether it's listening.
So
that people can inform.
Yeah, I'm just thinking about like, so we get these initial calls, right, and folks are,
to the root causes even
and
further.
so we are not in a place
To
of
find out what they
where
are.
we're like
by hearing
helping them be their own advocate. We're basically
primary
telling them,
data,
we'll
not
handle this
what
and we'll get back to you when we
know
have a
as a system,
path for
right?
you.
This one's talking about.
And taking
Part
that
of
off
that is
their
getting
plate,
more
right?
connected
Yeah,
with
that's
the
what,
local
yeah.
systems.
But we don't trust you to do that for
I know it's
us.
part of one of the.
So, I mean,
Well, this is a little
oftentimes-
different and like, this is purely voluntary, right? This is
Oh, okay.
this is
You're talking about
grandparents.
where you were.
Grandparents and other relatives, right, that are calling in crisis. They're often involved in other systems. But we aren't the ones, they're coming to us. It is purely voluntary.
Yeah, let's do it. Some sort of regular, not. So how do we, every single like question that was on there that we looked through.
It's like a question.
It's not obtainable, just because you say it's.
And so like a report out of some sort.
What I write in my treatment plan, like that.
Or if you're just
Just 'cause you
indifferent.
and I, just because you feel like I'm connected with you, doesn't make it an equal family first. Right?
Yeah, I don't care.
I think so much of the lack of trust is just
Cadence of a report out of CCO.
callousness and like burnout from providers that like, it's not, I feel like we lose the humanity in that. This is what we see every day, but this is not what the families, all our families see. And so for us, it's just kind of like, oh, right, another day at the office. But for that family, it's a very unique experience. And I don't think people lose that empathy when you're connecting with humans.
That's one of the.
For 17 years.
Yeah,
right?
fine.
That's like. It is on.
Hearings through conversations that gives every other state. The workers also, I think have to actually see what's happening in the city. They can't. And I think this is what actually here narrow or talk to the.
I don't know, you know what?
Yeah.
Could you add one?
Well, I think.
Do we need, when I see the word.
So, you know, to Jenny's point, like, it's, yeah, it's like, nobody, you know, Jenny and I talked about, we meet every month or so, right? And talking about this, people just don't trust the system. And so like, then there's no, and if we're not coming to it, and they fairly don't trust the system, just to be clear. But like, if we then not trust it, you're never gonna assume positive intent. So you're always gonna then fill in the gaps of what's happening with probably the worst stuff. That's what I do as a human.
So then that's the.
I don't know something. I have to consciously say, probably just.
All right,
Right,
Data, how it's like trying to like get uniform, everybody back to the same data, doing that.
Maybe I can learn a lesson from you.
It's not easy and not always.
Like, because then when we talk about
Conversations.
shared decision
Sort of
making.
guide.
Like, you know, what you were
Subcommittee level that does.
I threw that as a first step where people can, so if you do that, don't know that very well, which is also engaged. Oh, and I see, okay. But I just need to keep out tired of repeating myself, just make it all over the network, just make it a shared decision.
Because that's just not gonna happen.
In my
It's not
experience,
possible.
in my experience,
Centralized, yeah, you were saying. Similar to like healthcare where like.
it's not that people are being given options, it's they're not being given what they're telling you they need. And then we're kicking the can down, you know, down the road until it's such a massive issue.
Identify.
But the
Very
damage is
softly
done.
continuing,
So
but
it's
it
like,
feels like
Treatment
it's not
modality.
about
here brings a different angle.
giving them options, we don't have options, and we're usually withholding options, right? Like, I mean, you know, so it's like, I mean, we're,
Okay.
like,
I think
the
they would have a
system
lot more
builds in.
meaning if it started here and rather than.
Right, like, oh, well, we haven't. Yeah, and
All
then,
right, move to the last one and then you've earned a break. So let's get to the last one. Remember, just share the big picture on this last one and then we're taking a break.
Capitalism on there. Probably have to focus on.
It all ties back to that.
democratic socialist, sort of.
Goal that is end racing by 2030 and I said no. I can't do that. I want
That's not even, thank you.
Cool.
I know it took me forever, but it did finally work, not that one.
Sure, the end of.
Sorry, guys. I need a lot of caffeine. I feel like that's toward the end.
Ty, this is the last one before a break.
Bye.
Dig deep and get those answers. Let's get this last one just as serious as the first one.
It's on it.
23rd. All right.
Let Sonia answer, you can write.
Okay, now I'm on this side.
Yeah.
Got it really sad. Read these upside down. Good idea.
Develop a series.
Oh, support resource hubs.
Is like something
Barriers.
I'm sorry.
Wins.
Barrier.
Give me some of these upside down and backward.
There's not a barrier, let's put one up.
It's going back to my.
Now you're starting to sound like you're from the state.
There it is.
I feel like we're getting.
So the first big one
But
is.
as like,
Yeah.
just sum it up.
And third space is.
Let me find it because I want to see it again.
Basically to create.
Yeah.
I love that. It was like.
Yes, I want to handle that too.
Yeah, it's like building.
Quality of care.
To push against that, we've had those spaces. that were
Everyone in
residential.
ways they need.
Really?
Really? Like a.
And there was no training, there was no.
Would you say like the impact from Matrix?
My team is still. Resources.
So here's the thing, right? We start.
See that, I'm like.
I read some of them upside down.
This is. I guess you have to go to state.
We rewrite.
They reworded their.
They reworded it heavily. And I respect it, but also it's hard for me to read.
Like I was.
Some of these run an after school program.
Going on here, I wasn't one of those people, but I know.
But I understand
The
that
idea is.
Oh, yeah, all parents are so bad.
Yeah.
Everything.
Well, it says that
But now
when
we
you
understand.
increase youth centers, find spaces with peer led. I think, you know, this is a big family and voice because at least the way I see it, it's like after school programs cost a lot of money. Some people can get scholarships, okay, great, so what if you don't have any, then what? What kind of drop-in spaces are available? Like,
Yeah, I mean.
activities, like, let's just see an example. A center that allowed for kids to learn how to climb, right? Like, that all costs so much money, it's really expensive. Drop-in spaces, community, so like community centers.
I have to come to the other side.
It's clear that there is the voice out there and some of the information is okay.
Build families and youth engagement, equal parts, shared decision making.
So how do you improve your experience to say
And it sounds. I'm really hoping that the person who did put the dots there speaks up, because I want to hear.
If done correctly, would that have been
There.
better?
it might have been that, yeah. Yeah, that's why I was thinking appropriate, but then that's.
Especially the problem.
Yeah, and so it was like. They were. This is some second.
All the time.
Oh,
gotcha,
gotcha.
I'm like, okay, I go get a provider training.
So here's a barrier though, so that's a kid ratio, right, but it's a kid ratio rule that's preventing them from opening. Is it better to be able to cancel, you know, because that's an OAR thing, you can change that administrative rule, it's not law.
Maybe have.
You know, in theory, that can be changed in less than 6 months.
Because you have that kid ratio in it.
It's administrative rules. It's
Yeah, but
not.
you don't not yours, but I do like.
You could, for rural, right, on the examples of, yeah, a variance, right? It's like, for example, would it be better if they open with 3 staff?
And I mean,
The background check process takes so long.
So like.
Yeah, I mean, it's a month at least, like for my new staff, they can't work with kids.
So when it says care,
That makes
that's
sense.
not just with Spanish, it's with
time, but then once it's
ideology.
established, to go to a town where you only have 3 people.
Where is
there's no
proportional?
comes there, then it
That
becomes
makes no sense because now.
Or would it be better to just allow them to open with their staff? I don't know.
I need to read it's also not action, right? Like, what do we do about that? How do we get?
It's also a ban.
I know, right? Because then you've got lower staffing ratios, so you're gonna have more incidents, or you're gonna have less supervision, or kids more likely to be harmed. Kid stuff, right? Like,
I'm hearing
I like
too,
that
though.
idea.
I don't know.
I was like,
Kids sitting in the street.
And,
Okay, so we have
Because I was-
It's
improved
like,
access. We have two.
how to do everything.
Two things we want to
Yeah.
improve.
Got it.
Thanks, Jesus.
Early screening, behavioral services.
I do wear that back.
I just remember that. So anyway, this was the necklace that I.
And I need to-
Identify
should be some places, so I can describe, say this one
Yeah.
feels like this, right? And it may be because of the nitty gritty, but I was just thinking. when I saw it.
I struggle a lot.
Best practices,
Yeah,
yes,
best practice.
yes.
I struggle a lot with the term like evidence-based.
Yeah.
I don't know, under they're not drug substance treatment, I live in areas, yeah.
So I'm just gonna back.
I thought we were just doing it for them, but it was like.
I mean, maybe.
Another one on.
Well, yeah, I mean.
Then we gotta think about how,
I mean, and we really.
it does mean being purposeful in some ways, because you know, some people.
Yeah.
Like paths that are easier, and of course, the conversation. When we say.
So we're screening for like developmental disabilities, substance use, depression, anxiety.
Yeah.
So Anderson, capture all that on a screen.
It's not specific, like one of my specific screening, I mean, they were doing that anyway. You didn't get paid for it.
You know, just so I remember tonight, can we do sort of array of providers? I wouldn't see the that way I think our things.
And you don't know. You're not doing it good. You're doing it.
No, they say I'm really good. They want to do it all.
So grading,
My handwriting is, that's not EPSDT. That's not.
That's like, let Kate Kelsey. What's the witness from CDRC? 2 years?
It's like this access to.
Because that's different, and it was listed.
Associating behavior.
And for children with autism, it's also on that too. If you get the diagnosis, because it's. So long,
They're gonna give you.
Yeah, so that's what that's.
That has nothing to do with it.
That's a benefit.
You have.
Yeah.
And one of those strategies is trying to stop.
So
mediation.
slots.
Yeah.
Actually, you need to work
to
grow it more.
That was one strategy to kind of.
We got it.
Dedicated resources to Portland and
Yeah.
there's poverty.
I know, that's what I'm saying.
Carissa, right?
I just have to look at my
Disassociating
agenda.
behavior.
Pediatricians can diagnose autism and start access to the services, but if there's no OT.
Oh, I would.
Okay, I think this might not be.
I think it.
I think I mean like distinguishing.
I'm not doing it again. My head hurts. It'd be really helpful. I feel it in like here.
So T is
I mean,
where
Dr.
some
Cousins
other
knows.
folks.
That's a bad boyfriend.
Everybody's getting on that.
And then maybe that's. And SOP service, so. I think the
Put a Band-Aid on it.
That would have been perfect. I think it's.
As a pediatrician,
Get it on here and we can always.
Ah.
Yeah.
Daylight. Oh,
There are other ones.
Oh, what?
Candy, in case you need it.
I think, oh, when I was writing the thing, I think I just got mad and I was like, okay, next one.
Give me a better.
Yeah, I think this is
Studies that causes that.
We get a.
Yeah, the opposite.
I can feel. I know who's.
I'll give you a big.
We're trying to honor the word.
My work is in high school. Yeah,
When I said that, it would be standing now, all these here. That's $20 million. I need that.
Can I be, when people are gonna be mad.
These have all felt, these last ones have felt very similar.
So awesome. Working on it.
All right, Anderson.
$8 million.
There's the,
What are you gonna do with $10 million? That's not, that.
You were talking about me.
That $1 bill.
Until more beds appear.
Okay.
I know, I think a lot more than, we've got lots of.
You know, but you know, we've got a 5-year-old that's going to Dornbecker, Lennon Falls, and Salem.
And it just gets so much better.
7 times in the last 2 weeks. They won't keep him. They can move him back to our foster home. Hell out of him. And then.
So, yeah, I worked in residential.
But there's a level of trenches that you can more than a community placement. Do anything but like shield themselves. I mean, when we.
Why is he getting rejected?
Like,
There's no.
Isn't no rumors that his diagnosis? Happened.
Oh, you're.
Has he been diagnosed with
intervention? Yeah, right.
No diagnosis. But my point being is like we're getting residential treatment, right? We have 2% of kids in foster care and residential treatment. National average is 9.
I'm just gonna say mark down.
Some states have north of 20. I don't want 9, I don't want 20, but I can say if there's capacity.
That'd be good.
There's none.
I kind of want to draw the baby next to it. What happened with the resident baby?
Lisa, did you remember where you were?
They're still building it. It's not over.
They just say that. How many beds is that?
It's like, and it's
Yeah,
so
for
hard.
younger children.
It looks like bad script in Google. Look it up right now. It's called bad script. That is my.
Yeah, but they said they have to drive up to Portland, 35 hours away. Like, why won't people from other areas drive to Springfield?
But like in Oregon, when we look at our population, it's not even 14. But in order, I mean, I worked with Kimberly years ago, right? We were still talking about how to map this out for staffing, for nursing, for site. Yeah, in board.
We have fewer.
Comes for the youth engaged.
And we don't have the population until Portland.
3 hours. I don't have me learning cursive
Right, they will, but
availability,
it'll be the
accessibility.
most desperate, most complex kids are getting discharged.
Right.
Which is what happened in Eastern Oregon
And the outcomes.
and Burns and why they.
Started rewriting that, like learning down capitalism and kind of reading closely everything.
So many.
It's
true.
Somebody with that high level overview to get their ticket to break.
$10 million, but that's how like go more. That doesn't feel like my world.
Half was 75.
Wow.
Sometimes
We're gonna do
and I have it for what?
How many years?
We actually did like.
Like.
Don't say it about
$7 million.
Then Mike not allowed. I mean, it is, I agree, and I was like, no integration. Come on. It's like, I'm like, yeah, do it. Even better. Well, now it's actionable. I'm like, okay, that's a great idea.
That's a great idea. You know, I was, when we were doing the first round over there, I was like, that's so fun. Yeah, like, let's be so realistic. 4 years.
But it's a beautiful building. They're gorgeous.
They do great work, but it's an art form.
Yeah, we have goats now. You don't have goats.
I didn't know they got the goat.
Yeah. No pressure. Perfect.
Holly is the one that's leading it. She's here.
Hurt my feelings. They just wonder here. Private insurance, primary. All in go.
Like, That's not fair recommendation. For some states. Consistent and all are under. Individuals. Another option would be to go for these kids, if older kids. And you
Write those down, I don't want to lose that. Stall another minute.
Yeah.
It would save a lot of money too.
I like
A lot of money.
do it.
That's where our value.
They're right notification now. For CCO 3.0.
Without asking when.
Yeah.
I feel like a kid from
Yes, okay.
different area. I'm feeling it.
I really hurt for the CCO, but. Well, use Carissa then.
Yeah, we can. Are we ready to bring them in? All right, we're gonna bring it in because people are ready for a break, except for this table that is solving all the problems of the world right now.
Dude, they're solving racism. Let's go.
All right, let's bring it in for a report out, please. Then we all earned a break. And then we're gonna come back and do a really fun lightning round.
Woo, what is that? So exciting.
All right, we're gonna start here at this table. Same thing, just the high level. Where did we land? What are the highlights? We're gonna get into the details. But what are some thoughts over here about what this paper is telling us? And then we're gonna hand it off, which is the exciting part.
So ours was break down known barriers and get some wins. And I think one of the ones we were really excited about is design and implement direct cash transfer systems for all transition-aged youth. Right now, that program's really limited. And one way we could do that is limit state agencies' use of youth's Social Security funds for cost of care and instead put those in a special needs trust so youth have more money as they transition into adulthood.
Love that. So solution oriented.
The other one we had talked a lot about was improving access, and we like the prompt of pick two because they're really important. And we went back and forth. I think we all agreed that there needed to be develop upstream and community-based services to prevent the need for higher levels of care, but also having those higher levels of care when the youth needed it. And it was the least restrictive means consistent with their care needs so that there's better flow of kids up and down the continuum.
I said we needed more residential treatment and Emily threatened to sue me.
All right, love it. I'm gonna collect it and take it.
I'm kidding, of course. I'm kidding, of course.
It's a good place for jokes. All right, I'm moving back here. I don't know who from this table wants to give us the hot take, but we'd love to hear what's happening with our strategy over here.
So the hot take was we rewrote the. There was a lot of red stickers on there, and so we rewrote it. It was develop a series of measurements, provide effective, equitable, accessible, understandable, and respectful quality care responsive to diverse cultural beliefs and needs. Reading some of the stickies as folks were trying to respond to it, it seemed like it was starting to get a little murky with like the meaning of what the intention was. And so we rewrote it, listening to some of our local system of care work and what they were doing. And that was to create services that are respectful and responsive to all cultural beliefs, practices, and preferred and necessary languages tailored to lived experiences. And that sort of started connecting what we were seeing in the sticky notes. And then there was a brief conversation around letting youth and families decide what this means and looks like for them. And moving forward with that, having a youth and family specialized provider training to local and state professionals with impact reports so that we can see how that is actually going as that goes out. Yeah, and I think with that accountability of like developing system-wide, you said we did trainers, and just that whole method of work where folks can see what was done throughout everything that is done with this.
Transparency.
Yes, so that's our conversation.
Taking it over, we're getting it typed up. Throwing it over to this table. What do we got? Where did we land?
So, welcome to another table that had the entire thing rewritten. So this one was nutty, yo. Can I say that? Originally it was make families and youth equal partners in care, emphasizing dignity, inclusion, and shared decision-making. The reason I'm saying it very robotically is because there's highlights and there's additives and there's parentheses and there's dots. So after that, we rewrote it to say, promote family and youth engagement and shared decision-making, emphasizing dignity, inclusion, and supported decision-making. Because I could not read that. We also have burn down capitalism, very important.
Easy, Addie, write it up, let's go.
Solve racism, burn down capitalism. Booyah!
4 years.
Step 1 and 2 right there.
Step 1 and 2, baby. We have. Okay, we've got create family support hub. I think there's create a youth resource database. I'm just going on the ones that we green light to. Find the best practices and programs that empower youth to be their own advocates. Someone red dotted this. We weren't sure why, so we put a high five on there. There was
Back to it tomorrow. We'll have these tough combos tomorrow.
Was
Get
a
ready.
reason.
There was, I would love to know. There was, I wonder if a youth put it there, or if it was not a youth. Just saying, elevate, amplify voices from family and youth committees and councils, and then draft a bill with people of lived experience to improve release of information practices and less paperwork.
Doable one, very doable. I mean, not that the legislature's easy, but.
Let's go.
All right, I'm taking this one. We are taking 10-minute break. No games. You're on your own time. Do what you need to do to
10
take
minute
care of
breaks?
you. 10-minute breaks.
That's what I heard.
10-minute break.
See you back here.
What's your reasoning, Adam? I wanna know.
Oh, it was a matter of like. It wasn't me.
Another one.
It was about-
I'm gonna go get one.
Yeah, it'd be like improvement.
Yeah.
Yeah.
but
I'm, again, specifically, the group. I'm making sure that-
After this table check over here. Oh, yeah, no, the
Parts of it ready to then be that advocate versus like when you're coming for support. We expect you to be advocate.
Exciting, to say the least, right? How's everything going?
That could have been perfect.
First time we're gonna meet.
Put it in now so that we're ready.
I'm following you.
Yeah, just wanted to say hi.
Hello.
My honor.
Makes a lot more sense.
Which is what tomorrow I think is gonna be, is the like, okay, here's how I read this, here's how I read this, or the other side is like,
enough space for that.
can we do this in
I will
4
not be here
years?
to-
Do we have the?
explain.
Oh, I know. I just, you're so helpful.
Oh, never mind.
That's okay.
I'm just angry. I'm kidding.
Is it viable? Is it doable? Do we have the resources, right? Like, those are gonna be the harder conversations of like, okay, these all sound great, but how do we do this in 4 years? Do we do all of them?
Is it feeling like when you're bringing that up, it's being heard or?
I mean, with first staff, like, I'm personally, but do you want to? I will stand up capitalism and race.
You gotta find the CEO.
Thank you.
And also like.
I have names.
I think I now know.
Actually, now that you mentioned.
Dude, I met that guy. He's
I think he
not
was actually
cool.
the governor of Oregon.
And that's the expertise we've asked.
But and so I've worked with both of them in different capacities for a long time. Are you two partly have different strengths for sure? And where do you, so I feel good about that. I mean, I'm gonna miss Edward. She'll be my friend forever, always. And then, you know, Fairport.
I love that.
Yeah. All right. And I'll give you a minute to get a break.
Dancing fruit.
Never sleeps, never lets it be I admire him so much, so I don't know how he's gonna actually retire. I think I'll probably end up with him on every advisory note. But I think Lisa's gonna be great. I think she, they have a little bit of a different
So
style.
that's why it was okay.
Oh, I heard, yes.
Like they're making fun.
And that right now, I just think, in a way that like having federal funding.
That's funny.
But to the people that they're making fun of, they're like,
Unless something major changes, I'm not quite sure how we're.
Oh, you saw it? Really?
And you just lost.
Did he have to use
I can be,
Now if she was going there.
Out to the, take some food with you.
Yeah, I can see for the kids.
Yeah, and then we're gonna meet at the governor.
Actually,
Yeah.
I am gonna sit down.
Like after so long, and then you're like, oh my god. I think when I went to the bathroom, I sat down, I was like, oh no.
No, and
That's a lot.
Robin is
that's
also.
what I said. She said that.
Yeah, remember Billy got run over at that work.
It's like this.
Yeah. I knew about that. I didn't know that.
So we're, I don't think we're done yet. I think.
You want that, Robin?
Oh, I know exactly. Probably what- I doubt it.
Really do that.
I doubt that that's
Illegal.
Yeah, so
She's not
that
entirely.
stuff is really.
Yeah, right.
Do it again?
Chains of it, yeah. That's wild. I don't know they charge.
Oh,
Billy.
it's,
Yeah, I mean, sometimes.
That's insightful.
we played it last night at Guitar Hero. I don't care what they get mad about.
Whatever.
Somebody's gotta get mad.
should
remember.
I know, yeah, 10 years younger. And then, yeah, I love my team. We're having a great
Because
summer.
just that part is stuck in my head. It's making me angry.
I hate when that wouldn't happen.
I hate it, because then you just sit there and you have to be mad about it, and it's like, it's not really fair.
This isn't like a speak now or forever.
Okay, let me
About it.
no, let me sit on that.
We know.
I appreciate it.
See what the agenda.
No other reason.
But I like.
Is it me to reach out to?
But I was like, no, it's just like a young.
Do we have any mothers?
Yep.
We're
Because like I'll always be humming it, and I'm like, the worst case scenario is someone can like cop what I'm saying. Because it happens with that partner all the time. I'll be humming, and he's like, and he'll start like doing the lyrics. I'm like, oh, okay, cool. But sometimes I'm worried this could be a really bad song. But I can't look
So we package
So then start pacing
in front of the Senate.
Yeah, oh.
Unless they make particular amendments. Yeah, I believe.
Their own, yeah.
Yeah, so if we, I mean.
So.
I don't think that.
No, we didn't do that.
Well, that's before the other federal amendment.
Yeah, so that's probably the thing that's.
Yeah.
But at some point, like,
I just realized this is a picture. Just like it's countries.
That's a pretty.
They know.
They did, so they knew everybody.
For all of them.
Foster care is
There's sort of like economic.
Right.
Everyone else is gonna remember.
I mean, I would mind.
Yeah.
Picture.
Exactly. Youth and adults who are thrown over.
That's what we need.
No.
That's one of mine.
Oh, yeah.
Still do that.
In person.
In person.
Oh,
right.
I think you want to see the purple hair briefly at a meeting. Right.
You're already doing what I wanted to do, you know?
I'm not there behind the scenes, like letting people monitoring this, that, and like, it just look like I'm not even paying attention to what you guys are saying, so I'll put the camera off, but I am paying attention.
Yes, and now I. I know this.
We are all here.
Yes.
I'm just excited.
Yeah, it's a wild.
It's a nice trip, there's like 9 or 10 of us.
Yeah, we're doing some,
Still trying to come.
quite a bit of networking.
It's 90%.
Yeah.
Two.
Like celebrating.
Two, I don't really like it.
Yes. I added it.
Yeah.
Just show me pictures.
Oh, yes, and accessible, and yes.
Oh, we're gonna go.
Yeah.
Actually, did
Yes, you did.
I was excited.
I get to go.
He's really excited. It's a lot, yeah, and everyone sees flying, and that's the
I'm assuming.
Yeah.
He's going to be. Close enough to come home. Yes. Exactly, yeah.
Get a little mom time.
Yeah, he is fun. And, we had contemplated whether or not he was gonna continue playing college.
Yeah.
With that, but he did not want to go. And so he was
You're
like.
like, yeah. Going right up in the performing arts. Yeah. Good for you. I figured you got it. Did he get it? That's how really athletic fellowship or
They don't give athletic training, but he graduated. And so.
Oh, that's
Yeah.
kind of money. Yeah, but school, so it doesn't
Exactly.
quite as.
Right, yeah.
Still.
But no, yeah, I'm, and then they do a lot more, they offer, it's actually, and like, they offer.
Earlier someone was talking.
As well. It's great, because then you can just like,
All right, well.
Peter is like, just what it is, and I can pop in, like,
Oh, yeah, totally. I go there every month, like, and just to keep them on communication, because we disagree about it.
Yeah, for sure.
Makes me feel alive.
Yeah. Like, I promise
My
I'm not a
beautiful
monster.
unmedicated brain. Yes.
Yeah, so.
And she came in, right in the middle of everything, and we weren't even in a session yet, and then.
And I was like,
Yeah, because at least it's gonna be a difference. And everything else is, so she's already said, she's like, I was gonna also, did you see where I added?
Will not be.
Sure, yeah. Bring them on in.
That's a, yeah.
Simple.
You're fine.
What was that song that you played last night at Guitar Hero? It was like. Painted Black, thank you. Oh my God, it's been stuck in my head all day.
And then.
Oh, like inappropriate crochet?
Yes.
Yeah.
For legal reasons, no.
I don't know.
They just sit there and look at you and you're like, wow, I learned a skill for this.
My brand.
I could have been a lawyer, right? You don't want to open that one.
It's not too late. Yeah, exactly.
No, I don't want to stand like.
I was a Boy Scout.
Oh, gotcha, gotcha.
Cat, like catfish animal or like being catfish?
The animal, yeah. Clever.
It is actually like, it's.
Yeah.
Both can be true.
You can also.
Let's wrap this for the day.
We're almost done.
Thank you for letting me borrow.
It's a Sierra cover of Paint Black. That was me like Russia. That was.
If you can hear me, clap once. Can you hear me, clap twice. Thank you.
Okay, this last one is gonna be a lightning round, which is very exciting. It is a little bit different, right? If you all remember, we saved one, in some ways, the best for last. One is that big, exciting aspirational goal, right? It's transform the systems, which I think we're gonna say system, which I keep hearing, so we're moving that language, that serve children, youth, and families, right? And I think we all know that we would love to snap our fingers and do that tomorrow, and that's unlikely to be successful, right? This is our reach goal. I sort of said that at the beginning. So I've broken it down into 5 steps. There was a great question, and I think Holly left, but she said, are these sequential? Do they relate? This goal has sequential steps. That means they go in order. So I'm going to read them in order. It'll probably be a little bit helpful to pay attention because we are going to have to break up and some of you are going to have to start in the middle, but you'll know what's, before and after. And we're going to go quicker because these are a little bit more bite-sized, which you'll laugh when you see how big they are, but they're a little more direct. And this is the plan for the plan, right? This is this room saying, okay, Addie, you forced us all afternoon to be doable. You forced us all afternoon to use super action words. You really wanted us to get granular on what are the little things we can change in our current broken system. We get to toss that out the window for this next 45 minutes. And we're talking about what is the dream we want. But you'll see, this will shock you, I've broken it down into doable steps and how we get there. So there's going to be one of these that's the most fun for everybody. But this is how do we bring the legislature along, bring our state partners along, bring our local partners along, and actually create a system that sort of upends itself and starts to do practice in a totally different way. So I've proposed this is the way we do it. And then we're going to try and get some action steps in there. And then tomorrow we'll revisit the big picture in a more formally facilitated conversation. So one is create a shared digestible understanding of what the system of care is and what we are doing. What are we right now? So that when we start to talk to people about what we want to be, we know what we are right now, even if it's imperfect, right? Because if I go out to the Fred Meyers and I pull someone aside and I'm like, all right, tell me what you know about systems of care. I would bet $100, they're gonna be like, I don't even know what you're talking about. And if we're gonna try and do something transformative, we have to get people involved. And some of that's gonna start with, how do we talk about what we're doing right now so people know it needs to be different, right? They might know pieces of that. They might have hit barriers themselves or had a family member hit barriers, but we need to figure out, how are we talking about it? That's step one. Let's see if I remember where I put document. Okay, step two, engage in. And again, these can change. You guys are good at that. You can ask for the big sticky notes, but this gets us going. Engage in strategic and facilitated conversations with key partners, people with lived experience and community, which I spelled wrong. Hold please. To create a vision for system transformation, right? Everyone in this room, I bet, has what they want that perfect system to be. And we've started to have those conversations in different places. But if we're going to try and do some systems change, we need to be really thoughtful about bringing everybody in and knowing what that looks like and hearing voices, even beyond the voices we're used to saying and thinking about and bringing to the table and working to improve. It's got to be big. So we need to be having all kinds of conversations all over the state with lots of different people, all the way from current therapists, current people with lived experience, all the way to the legislature and the governor's office, and everyone in between who's never even heard of systems of care before. That's two. So far, I'm picking the right ones. 3, develop the transformative model, right? In the perfect world, you're taking all of that you're gathering at all those conversations, and you're creating what the model looks like, right? We know some things about it, and you're going to see those on here. This is the slide or the sticky page everyone's going to be excited about, right? We have heard, and this came up a boatload, that we wanted to be community providers, family-centered, have early outreach, include service menus, have better coordinated care, have a supported workforce, have integrated relationships, holistic support, right? This is the wish list. Feel free when you get to this station to put all your wishes on here. Like, this is the moment to get to think about what this looks like as we start to think through it. So you're going to develop that model. Tell me this is 4. Oh, and 4 for 4. All right. This one is access, resources, and support for the transformative model. We can design something really awesome, but if the way Medicaid funds and if the way child welfare funds and the way everything braids and blends, I know that's kind of a bad word in here, I'm saying it on purpose, isn't going to happen, we're never going to get lift off, right? This isn't going to do itself for free. So we've got to think about, how are we making the money work, and how are we getting the oomph, the excitement, the support to move this forward from the people top to bottom, bottom to top. Everybody's got to be ready to try it. Now this one, which is 5, is where I suspect I might get some pushback. And this is where I sort of say, all right, but as a planner, this is my advice. And then you guys get to take it where you want. I'm going to suggest you then pilot it, right? We're not rolling it out across all 36 counties. We can make that choice. A big transformative model is going to have some glitches, right? We're really smart and we're going to design something awesome. I believe in that. And you want to take a small chunk and try it, right? And the way Oregon really loves to do this is you're going to do a rural county, a frontier county, and an urban county. And that's not a level of detail on here, but you're going to try it in 3 different places and say, what are the glitches in each place? What do I need to work through? Where didn't the funding work? Where were the gaps? Where was co-location hard? So you're going to pilot it. And when you pilot it, you're going to do continuous quality improvement on that model, right? Because you can design the model. We've all done this. We design a model, even if the model is just like the recipe for dinner, and then you make it and you're like, well, that wasn't enough salt. I need more salt, whatever. So then we're gonna do the pilot and continuous quality improvement. And then what's not on here, but is in your next strategic plan, is roll that pilot out across the state, right? That's when you then take it to the next level. So this is gonna be a lightning round. It's gonna be tables that have 5 people each. We're making action steps that get us there. Remember, right in the center is the fun place where you get to dump all of your cool ideas. There are no rules here. It doesn't have to be actionable. You can use all the words on the right
whatever you want to get out all those good thoughts. We're ending on fun.
I love it. It's great.
I'm so fun.
About me.
So this is where there's no rules and you can just think about however you want to think about it. All right. And then we're going to do the quickest of wrap up activities to get people out of here. I'm hoping on time. So we're going to get 5 at each table. Remember, if you pick up in the middle, you've heard the way that this is going. What are we doing now? How do we get input? How do we make the plan? How do we get resources for the plan? And then how do we pilot the plan?
Speed round.
Go.
We're already here.
So-
How are we gonna? You ever stand up so fast, like your thighs just get out?
Yeah.
No, I like stood up and it was like.
Where are we going? My leg. Yes, you will get to all 5, but it's gonna be really quick.
This is just.
This is the dream.
Shared digestible understanding of what suck is and what we're doing.
So it's like.
That's what she was describing. Physical care, air conditioning.
Maybe it's
Created or like. I'm like town hall.
Why don't you like that?
Town hall.
I've seen a lot of doctors.
So instead of the CCO.
They film.
Yeah, that's what I'm thinking. So I think we need to better.
Yeah.
That's.
Find,
I will not be Millie Rocket on any TikTok.
I think it would have to be very clear that SOC.
Yeah.
I know Christine has some of those leadership understanding is that we're talking about what is a local SOC, what is SOC, the philosophy, what is SOC.
Yeah, no.
That is like the stuff. And then what is SoCal. And so those like 4 different things that come out of that one acronym.
Conversation kind of broad, identify people that want to.
So like.
Quality.
Association. Yeah, there's philosophy, then there's the system itself.
Yeah.
So it's kind of like, you know, it's I'm retired to try. I'm so sorry.
And then, SoCat, and then like one is and that's actually something that like down with me.
Like
What's my friend?
Good morning.
This one is.
Can you tell me about like
These are just a small version.
You can't do the one thing.
Or essay.
Oh, this is who.
Accessible website.
Like,
Yeah.
like our website. So we talked about a lot of the quote unquote transformation.
That's the thing. And I went to, I know a graphic designer, probably work in where local.
And so sometimes it might be interesting.
Yeah, I would have insurance.
The average man.
You know what I mean?
I would
Also,
also-
we need this in Medicaid or something like that. This is implementation where we keep getting.
To walk with them.
This is what I was very wide. You can get really local in Oregon. So you know.
Showing up places.
Yeah. So there's certain things, organizations.
Because to me, I
That navigator for every child systems for every family.
rather than like anything.
Really
Visual
clear and strategic about. Or you might want to put the designated piece on a different. We need to.
Yeah.
But we don't get to the why. It's like, I don't. This building.
come hard at you.
Yeah.
Oh, of the
What
existing.
system of care, like, and years of that, but I was also thinking, right?
Yeah.
It's like.
I think we can come up with a dance.
A
dance. A TikTok.
I just have to say, I think that would end well. That would just be like.
All right, 1, 2, 3, 5 to 1.
Insurance, neutral, or like, because like private, people with private insurance should have. Yeah.
Conversation, community partners.
Yeah.
The three-way table.
People with experience and communities to create a vision for.
We have a pitch to take.
Maybe I would.
Here, so we want to like.
I did go yesterday.
We're busy.
Resources for the change.
Like, I feel like it has to be a step.
To, what's it called? Comfortable, sitting, laying down.
Mine,
Time to go to bed.
0 to 5.
Show up in
Like
places.
3.
Yeah.
Prevention model.
I was like,
Yeah, like it is not
like
prevention.
10 p.m. I was like,
Not-
gotta get up,
But
be
our
up,
system
doing
looks
this
at
all day. Can you imagine me off like no sleep?
It should just be intentional intervention.
I was gonna say, most of the time you do see me in meetings, that's the
Funding.
Intervention here too.
Do something cool and innovative. And then falls flat on its face. And then
Here
you
S.
go back and talk about the old things we used to do. Okay.
Stuff like that, that's the bigger
All the
one.
way through.
Oh, Schofield.
Here
and now. I think,
Also, Glenn, slash Foster.
yeah, then for one of the things that their organization does, is unload all information for they're waiting on services. So while they're on the wait.
We're actually the worst technically. We literally
Instead of
brought
waiting
up
for them
stuff
to
and they
get
were like,
approved.
so much still need that then.
How'd that paperwork filled out?
person.
Yeah.
Most of the time they never even respond.
Exactly.
I love Sarah. I love Sarah.
Is there anything I can do beforehand?
And you're like, why would I do that again?
6 months since you filled it out before.
You have to get it out again anyway.
Oh, wow.
When we get to.
For the same result.
Exactly. Nothing's changed. In fact, it's
Yeah.
worse.
Just fill it out.
I know treehouse therapy is in Eastern, they're it's all, I mean, there's a way that we support and collaborate. That was incredible. Right, because you're waiting for occupational therapy, mental health and whatever, but like, while you're waiting, there's such a lack of resources, they built out a whole service. Again, Medicaid doesn't pay for that, so they're using.
Even on wait list, where wait was so long. No one told me.
Yeah.
You called over here.
So it's clear to the legislature what they're gonna.
Down there, it's.
I'm like, what? I used to work in housing services.
CSL or whatever.
I've been on like wait list for Section 8 or for specific like income restricted housing. And it's like, oh, well, we put the application in a year and a half ago. Like, well, nobody ever got back to us.
And so it's really hard.
I said, well, you didn't tell us that. Yeah. They get 52 if you keep calling me. Yeah. They're like, well, you gotta wait. You gotta wait. Then you wait and they kick you off.
5 to 1. Get it. The next one,
Another kid and restorative justice, the advantage to Island. Insurance services, centralized access. This is the fun one, whatever the heck you want.
I can't remember where I went now.
I don't
I don't know what you're talking about. I can't even
I'm not sure what you did, Holly.
Families in good scheduling, adolescent substance use disorder.
Digestible.
The idea of piloting one substance.
I put them all in, I'm sorry.
That would be the pilot.
I did.
Really good idea.
There's a couple.
Shared.
Digestible.
What do you want to see happen? What are your, what are you? Oh, this is the one that you like, literally just write out what you want to do. How you would do it. Integrated relationships, holistic support, supported providers and workforce, early outreach, coordinated care.
That's such a cool value add.
Coordinated care system for kids. They are mobile, things get lost.
Together.
Birth to prison framework, more
Form a larger point of view.
from early.
Really overhaul everything.
We get up to our.
Youth and adult repair training, restorative justice. Quality community providers.
Yeah.
Oh, an adequate quantity. I know everything. Of quality community providers. I think I read everything.
I mean, they're not actually, but that's. It's an integrator. It's maybe showing, this is about a lot about the community, but maybe getting to share. Getting close to right, like share.
But you will have to start wearing colanders on your head.
That's Cameron's. Dipping spaghetti mustard.
The purple ones.
Creating a.
Yes.
People were sort of saying, like, if I have to respect your religion, then you have to respect mine, and I.
That's where I'm. Creating a multi-system.
And Jigger OR religious, and they like put all these things.
Yeah, we get it. I don't know either.
SOFAC has this 2-minute warning, 2 minutes or an outcome.
In there. Guy's handwriting is probably work.
Elevator pitch, right? Like.
He's like. He's like.
Beautiful. 100%. Throwing you off? Didn't think so.
Right? Somebody to write.
I'm the only one who's been listening promiscuously.
Like bringing decision makers together with youth and families.
That song, man.
They do have to hear.
You're boiling it down to like now.
Oh, it's not.
And we're having like a conversation.
Yeah.
No, go ahead.
Wrap around.
With all these little children around.
And like, it talks about like a digestible understanding of what's just reading this, like might not be the scope, but it's like, that's not just.
I get any more tired, I'm running.
That's also for infant families.
Yep.
It like has to be transferred into like digestible to like last minute.
Anything else? Any other ideas? We have 1 minute, people, the rest of us
One concussion away from the season.
Halloween.
Yeah, that's good.
It's with the end goal, like, what's the community, but then like all the stuff that came out, what all academic papers, if you don't know, it's all academic English around the degree, so like, and then they also had to rely on someone else to.
Somebody was saying like, no.
And so like, what, like maybe one day we'll
Spent just trying to keep.
come around. And so you really understand, oh, like, let's do a good thing and act on the information.
Two?
And
What's the access to resources?
and like, data should be able to have access and use that data in whatever way they want. That was a long way.
Can you say that?
Very, very small. We'll see it. It's a smoothie.
But like, were we ever really?
We did not last weekend.
Yeah, I don't think so.
Yeah, and so I think we will have like
People
some
like
convenient
it.
projects. Like not an OH, not an OHAP.
Technically not supposed to do, but.
Tuesday, and then Wednesday she was just saying.
Also, do you know, like,
All right, time to hurry. On to the next one. Steve, you're so close. Don't give up now. Keep the good ideas flowing. We got like 10 more minutes.
was that yours?
Just so you know.
Yeah. I mean,
Right, because it's like, if something's that, like, not spend their time.
My plate's already. Just say, hey, is your.
You know what I mean? Like, why do you have to worry about what mechanism the state has to do to get something to work with? You're just like. You know what I mean?
Don't reinvent the wheel, that's wonderful.
Can
we put a high five there? I realized we've not been using the stickers.
We've completed the full cycle and now you're a part of the system, trying to fix it, you're trying to figure out how to get back out there.
Yeah, so, yeah, I was trying to, because, there's a lot of debates in early childhood of it's the equality. And there's the part that you really want families. And families know when they show up at the program, how it makes their child feel. Right?
I
But
see
then
this a
there's
lot where it's
mechanisms
like
around how we
engaging,
develop our work.
right?
You know, what kind of training support do they need? As a parent.
Hours.
It work, just make it work for my kid. I know if it's working. You know what I mean? And so that's what I've been trying to talk about.
Like, so I guess if I were.
Hate the minor and
You know, and I was like, so does that mean like?
A house. I really want to write up a foundation.
Doesn't, do they need to? No, unless they're in the system.
Someone has to.
So it's
Yeah, that's fundamental for the house.
Yeah.
Can we lower my
You know, so I've been trying to think about either metaphors, trying to figure out my language on the system side. Right.
To some degree, people do have to know how to govern, only in that when the next generation comes in, they know what
Exactly.
they're doing, but everybody doesn't need to know how it's
Right,
necessary.
it shouldn't be proprietary information. But like, you can ask all of our families for.
Maybe it's like the Chipotle model. But if you steer it over, you want to see how it's done. You just can't play it at the end of the day. It's like Chipotle.
Kind of see back.
Never come back.
Yes, and it's really clear if you did not get the plate that you wanted, they didn't put enough protein on it, you know. But it's enough to just be able to ask for more.
Right.
So one thing that we did, and hopefully you guys have heard some of this in the previous.
Anyway,
Yeah,
just
that's
high five everything.
Amazing years. They're
What
wonderful.
you thought about also,
But I was just
does
like,
our system of
it's some,
care.
I mean, do they have any overwhelming? It's just
The needs is different age, that's unique to different age groups get reflected. So like I see a lot around.
Yeah, it goes really well with the 30%. It's still working.
Not necessarily like the purpose. You know what I mean? And I've been trying to figure out. I know less of people. But the idea. Seems like there would be unique.
It is for not just about.
Which makes it better for.
Well, but between the two of you, that's different.
I'm still relatively new to the council.
Yeah.
So I don't.
I'm brand new. This is my first
Yeah.
meeting.
Wow.
But like I think it's from growing up and like how is sound
That you kind of have to go around government to know. So like we gave them any grants to the drug users union, like do they really get? But I don't think any county or certainly not.
yeah, right? Yeah, I think so too. So is that like
Not that we could, I think there's a place for it.
Downtown and then it's just like how. Yeah.
Oh, so they put it here last. If you found some of those, then you did a curriculum framework. I think how creative to talk about. Not that we're not. I had that. There's a lot of experience.
We're gonna see a lot more disagreements. Will they have close alignment?
Where did you imagine?
Maybe part of it is having like, okay, on to the last one of the day. You've made it.
If you're a partner.
You're gonna get to turn your brain off in about 4.5 minutes, maybe 5, so I'm not watching.
That was the.
1 to 2, 2 to 3, 5 to 1.
3 hours of therapy, but they don't know otherwise. Like I did an hour of therapy in the car ride I was taking them to.
And I think peace management, when I
Oh, wow, we got a lot of
But like, what are?
Oh, this one's full.
Services. Last one, wow.
Well, there's some.
Do whatever you want.
Solve racism.
Okay. I thought we were done.
Me too. I One left. You don't believe in capitalism?
Like, I'm sure they got it all, you know, if for us, but anything, it's just like.
Organization silent.
Yeah. There's put the hands on what resonates.
And I was lucky we didn't have that.
I just thought
I could find a shared.
I will do that.
It's like, this is the one where you just like add anything.
I did not.
No AC. There.
Yeah, what are?
And it's like, not just insurance plan, but tier. Like, right.
I mean, it really doesn't kind of come down to
It's ED or the CCO, like, just give them the service.
Oh, like the Skype
Figure
stuff?
out the payment on the back.
what we are.
Bunch of systems.
So.
That's so true, like, it's like, sibling service is so much more, time sensitive.
Just government websites and then, you know somebody knows somebody.
Of the day.
We're the provider Illuminati. Not
We
the.
do outreach. Treatment. What would be what's the goal?
Our outreach specifically would be to the local.
That was a big one in our. I think it's a training.
Income is like tabling events, income to showing up to other providers. Showing up at local.
Sure, sorry. I'm here because I have a huge social.
Oh my God.
Yeah, that.
Children's system staff and pull all services under one.
Yeah, we were finding it. It wasn't until I shared that to my corporate office.
I love this.
And then I started.
I just don't know how far I'm like always like.
For what? They have no idea.
This move away from early intervention. Yeah, I will.
Police you there, it's just.
Treatment.
I feel like I've been hugged. That shouldn't be that way.
And so I have not, I know it's Euphoria, I mean, I'm sure that's, I think they're missing better the R, the B, I think that's the R, that's also fuzzy.
No, I use my private license to make a living.
No, that's why we put the word C. And I'm coming out.
Yeah, I love that. I'm all down with that.
I'm not putting that on there. Yeah, they dropped the snap. I like it. Like physically attach it.
Someone shouldn't have to have a person.
Like a border. I know, right? So. He didn't have one thing like, I just like, but I was better than one thing like.
Establish an accessible.
There was some, I just based on some
And as through that, some of the strategies were like.
And those are like.
Here's an organization that are.
Like all those different questions, but do it in a way that.
Last 2 minutes of work of the day.
Youth and families have the ability to like advocate for or meet their needs instead of having to.
Communities,
I really
right?
think it's like having that access to training resources. Really.
The local departments like. Jackson High Mill has to they have no idea, which is crazy, they don't know the hours. It shouldn't be that way.
I mean, that's been pretty clearly demonstrated lately.
Yeah. Do you, is that a plant state plan? I'm sure there's way more. I mean.
That wasn't intended as a.
Having it all in one stream.
When do I turn 35? I mean, we actually involve the students. They say,
No, I mean, Cameron, laws are, the
laws are,
you know.
That's true. I should
Not
contact
mandatory.
Trump and ask about his signature. So maybe he can knock off.
When they say.
But actually, our constitution is unjoking, serious.
Like as long as.
Last minute, we're gonna do a lightning report out where you get 2 sentences to tell me what's up on your sheet.
Transform the whole system. So I think.
Yeah, this being kind of put out, it's like, I mean, I don't know if I can summarize.
You got it? Got it? Okay, okay, Adam's doing it. Adam's doing it.
Exactly, they really want to get in terms of. In the state
Or in government.
Big plans over here, big plans.
More on the.
Everything. Annalise and I will run your campaign.
The money, money.
Story where it gets.
2036, guys.
What are the range of one system?
It's usually people are like, I think it's hard.
Yeah, we know.
Oh my gosh, our numbers.
All right, let's wrap for the day. Every table, just 2-sentence summary so that none of us are wicked surprised tomorrow about where we've landed. And we'll be super traditional and we'll just go in numerical order. So 1, 2 sentences about what we've got.
The way that this read for me. The way that for me is like a focus on communication and access to information and resources.
Okay. Love it. Nice. 2, lightning round summary. What do we got on talking about how we're engaging in strategic and facilitated combos.
Bottom up design, funding, don't reinvent the wheel, and a bunch of different ways to engage all different communities.
Yes, love that. All right, the fun group. What is our answer for how is our transformative model gonna look?
Like basically everything everyone has ever said, like.
But does it feel really good to write it down and put it on a plan?
Like imagine every buzzword you've ever. They're all on here. Pick your favorite, what's your favorite ones?
Number 3, where are we getting funding and support? What do we got over there?
Over the map.
A real summary.
Grants,
Oh,
there's
okay.
Medicaid, there's small businesses,
Ooh.
dedicated allocation for kid policy,
Ooh.
general funds to make things insurance funds.
Yeah, love that. Insurance flag, whoop whoop. Yes, and our last one, what do we got about piloting and doing some continuous quality improvement work? 2-sentence summary or 1 sentence or 3 words. No pressure.
Just-
Uh,
I did it the last like 3 times.
Fair point.
Manly now. Partner with local system of care and or tribal communities to build out the plan. Incorporate people with lived experience in quality improvements. Implement collaborative problem solving into schools. Figure out how to pay for it.
Pay for it's over here. That's a whole page.
Maybe with a pilot, like you can set them up if you don't actually give them enough resources to do the.
Make sure it's adequately resourced. That's what this team did for us. I feel confident. All right, and sustainability. Hopefully the plan's written sustainably. I hope that buzzword made it on there. All right, we are about to be done. Give me 2 seconds to explain our exit activity. It's like for all the introverts in the room, finally your moment. You've been waiting all day. Thank you, everyone. We're gonna come back tomorrow. We're gonna revisit everything we did today. So those crock pot thinkers, you at least get a whole evening to simmer and stew on things. Purposely chosen words, culinary, funny. Okay, on your way out, I would love it if you would take any color sticky note, any size sticky note and a marker and write a little bit different. One thing you learned today, right? We were all sharing a lot and you weren't necessarily here to learn, but take a minute, reflect. What's something you learned? Could be someone's name, could be something about the system, could be about how to use Medicaid funding. No wrong answer here. And then you're just gonna slap it on the door on your way out and we will see you back here tomorrow morning. Reminder, right after this is a youth debrief, totally optional, just for our youth. Our staff won't even be here. And then at 4:15, there's a family debrief, totally optional. Staff won't even be here. And at 6.
So 5:30, totally optional. Peter Courtney Bridge and Riverfront Park. We'll go on a little walk through part of Minto Island Park. 6:30 dinner at Venti's, again, totally optional, but yes.
Love it. All right.
One more announcement, sorry. There's lots of leftover food, so please take some home with you. Grab some desserts or whatever. Or to your hotel if you're not going home.
Y'all got takeout containers?
You got plates?
In your hand.
They have pockets.
Very big.
Thoughts for later?
I'm gonna have to like move my shirt over. Drive to the hotel like that.
Yeah. Oh, hands me that, hands me that one too.
Did my best. You know, you only show me try.
Are you going home?
They have.
It was nice to meet you all. See you.
So from, are you?
Brian will be here tomorrow.
It's like right on the river, yeah.
Able to make it
Just a couple blocks, and there's like a carousel down there. It's like a bridge.
Solid, just say, hey, you
It's
know,
tough to-
you can do this.
And, yeah, and then you can walk from there and like on the way back.
Elliot, do you wanna help me get?
Yes. I want to hang out with a bunch of. Yeah.
I bet I could probably run. Oh, and see what you have and they won't be worth the parts. Well, I just gonna write it. Sonia ruined my name. You gonna be a part of it or you headed out?
Well, I have a counterpart.
Yeah, it would have been spring lives.
Not great. I think I am saying, are you coming to?
Yeah. Are you guys doing anything?
Well, I think I'm going on the. Yeah, with Adam right here.
That's what I'm always looking at.
Just asking where everyone's meeting, but yeah, I'm gonna go to Venice because I didn't go to dinner.
Yeah, so if you go past like Green Hill, right?
The bad action words for plants, that's what. Where are we putting that?
Right there by like.
It wasn't all for nothing.
With the Korean church.
I saw.
We're about to go into our.
Right now, we're doing us.
Oh, wow. So I don't have money.
Ultimately.
Trying to figure out, I want.
It's about Wilson. Nice though.
Okay, so.
I was like, that's myself. I'll put them in my fanny pack. I'm like, they're in my pocket now. Like,
Hey, you meant to bring this with me.
When you come out of the grant, it's like
200 high end.
There's one somewhere.
And then-
Table, the orange one over there, it's already in there.
See like how you can.
It's really fun.
It's just I'll be hanging out.
I mean, I still drank the sink water, but they told me I shouldn't have.
It just doesn't taste good.
Exactly, and so that is the thing.
Yeah, just on a little walk, there's a.
DC
Oh,
Bridge.
DC water?
At some point, I went like the ice cream machine, the ice machine. Use that little ice
And then we can walk back and dinner is like.
like a water bottle.
Thank you, sorry you couldn't be here, thanks for joining.
5:30 at the park, 6:30 for
Networking.
I've already. Clean your crap at GTFO. Kids deserve the room.
Voluntary anyway, yeah.
Alright, we're gonna go.
What are we using?
Oh, it's the youth sea breed.
I'm going to take a nap.
Yes, I think you've been on that.
Yes. Why? Was 4:40 closed? No way.
Because of.
Where did you go? Where did you go?
Visit my friend and his baby in the next.
Okay, very different.
Let's run by today. They're doing okay.
Good vibes down there, yeah. Separate to the.
That's
like.
But I did not take.
So yeah, Kaiser, yeah, so close.
Yeah, then all back on the table and they'll be ready for us.
Yeah, hey, we moved down here when we moved to Lake State, where my wife and I started at the same thing. That was like. Yeah. Exactly. Yeah, right, yeah.
Hey, that is not me, that's was just you.
It is in there. but
Yeah, and we
it does a bit of
bought a
help
house
us.
here and now.
Yeah, that's the, always said these things. It took like them a year.
I believe it, that's a lot of data.
Yeah, there's a lot of good info. It's super intimidating, but if you wanna like dive in and look at it, read the executive summary.
That's so, I read the executive summary, and I read the education, part.
Right, and like, I know,
Hey,
like, I know, I feel kind of guilty saying it.
Well, that's no fun.
There's so much good stuff. Yeah. Also, good to see you in person. On the themes of. Right up.
Totally like.
You don't have to stay. If you're like, I'm done.
It's gotta happen. There's no way.
I'm like, I can't solve that for you.
No. I mean, are you a neurosurgeon?
No, I'm
But I
Oh,
mean.
yeah, oh.
But I
Being
think.
old.
sorry.
That's okay.
Also, if there are things that you're like, I just want you to know.
I
are
live on this.
So how far did you get? What your thoughts are. If they're there, right? Just like G3.
Thanks.
Yeah,
Yeah, thank you.
Our.
I will
I
see
just
you.
have minus two. And
I'll send
Susan
you.
text you,
Yeah.
her to text you if she
They
has,
are
save the family debrief.
Okay.
Send the, if she has suggestions for things you should consider for tomorrow. Yeah, we all have.
I'm trying to decide.
They're the only other two.
Alexa
Yeah,
Cameron
we
is
would just-
first woman president.
Like, Michael's not.
It's okay, that's all, that's how, like, are they together?
I
live.
More hours.
I think they're probably just hanging out.
Going to dinner?
Or Michael might
We do nothing. I did. I said nothing.
Yeah.
You mean nothing? That's what I did.
Oh, I don't know if you, sorry. And he, like, I've asked him, I'm like, what do you
think we're
prefer?
walking from
And
the
he's
park
like,
to
I
dinner.
don't. And he's like,
Oh,
and then I'm
literally
like,
right after.
which one do you want? In there till 6:30. Depends on my mood, what time I introduce myself as. And
Sorry.
so usually what happens is whenever he introduces himself as, he's like, what sticks? And so it's like whatever mood he was on the very birthday.
Yeah.
But so in my phone, like, but now that I know him well enough, I like associate
Oh, is that
with him.
work?
So in my
Oh,
phone,
and
it has to be both, or else
Oh,
I'll
like
like
group?
type in one and be like, I lost his number.
Yeah. So you put in some stickies on
Where did, where's?
Yeah.
it? And they think that, they asked Jesus.
Yeah, but it's not serious,
They're
sorry.
like,
I mean, it is true, it's serious.
it was because
But
it
it's
was
like
like,
a little bit of a
people
joke too.
sometimes get reminded.
That makes sense.
Oh, yeah.
Okay.
Do you know if Michael and Jess are coming back or no?
For the family debrief, do we wait here or are we
So I'm like,
outside?
I think, let me.
I think Michael's
I'll
out
check.
here.
There's a chance.
I'm
that-
pretty sure both of them are out
that
here.
there's a chance that they're both being home sticking around. Thanks for all your info.
He's
Good chance
taking
that
a
they're
nap.
just
Yeah,
appreciated.
That's great.
I think Michael.
So y'all want to just give them a minute.
We don't have any tape. Are you gonna leave like the markers and like, should I just leave? Are you guys gonna clean up for tomorrow? Or are you just gonna leave them
We just
tomorrow?
reorganize as in like getting it
Okay,
more
like just like
clean,
more
a
together.
little less
yeah.
chaotic.
And yeah.
You know, Jesus and.
Jesus probably got.
I trust in you. I've seen you be restored.
No pressure on the stick around.
Julian, you know him too well.
Yeah, big pressure. Some people need a little bit of pressure.
Hanging out? Are you heading out? Right, do this. I think it might just be you, me and Elliot, which is super fun for me.
Oh, don't
This
count
is,
out Cameron.
Debrief what you're
I
talking
think
about.
we've got like.
Yes, for young people.
I think we've got like 4 folks.
Oh, they're coming back in.
Regathering.
Brad.
All of our business cards. in there.
Brain is mush.
It was a lot, huh?
I will say.
Here's my new idea.
Think about the transformational piece towards the end, but
Enjoy your
also.
debrief. Like, should I really?
Sure, I'll do my best.
We're gonna go type up all this genius.
Yeah.
It didn't get the time it needed. But
You
we'll
know,
talk more about it tomorrow.
That we'll talk more about tomorrow. And the good thing is sort of as the aspirational goal.
I know,
A lot of
we're
stuff
gonna
to
do
bring
this food.
right? Like it doesn't require quite the same
All right.
amount of.
If you're an adult, other than you,
We're
we're
out.
doing the youth debrief. If you want to leave the
In
room.
here,
Yes.
I was asked to.
Yeah,
be a part-
Anderson's welcome to join.
Okay. Are all the other young people cool with that?
Yep.
Awesome.
Oh, I need my computer. Can I have my computer?
It's too late, Hannah. You gotta wait till tomorrow.
But yeah. That was
Sorry.
a bit of constructive feedback, but I think at the same time, getting those other boxes down.
Right. I appreciate that feedback. It's hard to know. We were talking about how before the pandemic, this would have been an 8-hour day. Like I would have done like an 8:30 to 5:30.
Great.
Exactly.
We're at the like